Order, order. Questions to the Secretary of State for Health, Julie Hilling.
Number one, Mr. Speaker.
Thank you. With permission, Mr. Speaker, I'd like to answer questions 1 and 9 together. Over the 4.5 years between May 2010 and October 2014, 5,210 people, equivalent to annually less than 0.1% of the NHS workforce, have been made redundant and then returned to work elsewhere in the NHS.
Julie Hilling.
Thank you, Mr. Speaker. But at a time when A&E is in crisis and there aren't enough nurses, how on earth can the Minister possibly justify firing and rehiring thousands of NHS staff? What greater sign could there be of a government with its priorities totally wrong?
I'm not sure I recognise that picture of the NHS. We know there are around between 6,000 and 8,000 extra nurses, midwives and health visitors now working in our NHS than there were under the previous government. And also in A&E, the average length of stay in hospital has steadily come down from around 8 days in 2000 to around 5 days today. So our NHS is getting better and improving under the current government.
Mr. Graeme Morrice.
Thank you, Mr. Speaker. Last year, the Prime Minister promised to recover redundancy payments from people who have been rehired. Can the Health Minister tell us how many payments have been recovered and to what cost?
Well, the honourable member will be aware that it was the previous Labour government that set in 2006 these eye-watering redundancy payments for the NHS, and we've committed to making sure that we reform that and change that. So as part of our negotiations and our pay offer to the NHS staff, we want to introduce a redundancy cap of £80,000, and as many members opposite are supported by trade unions, I hope they will encourage union members to back that pay and redundancy cap.
Mr. Andrew Stevenson.
According to the latest figures, can the Minister confirm that there are more nurses working in the NHS now than in 2010, including an additional 391 at East Lancashire Hospital Trust and an additional 59 at Airedale Foundation Trust, the two trusts that serve my constituency?
I'm delighted to confirm that, Mr. Speaker, and we've made a conscious decision to reduce NHS waste and bureaucracy. The NHS administration spending is down from 4.27% under the previous government to now only 2.77%, which has resulted in £5 billion of efficiency savings and meant that we can invest in around 6,000 more nurses, midwives and health visitors.
Mayor Miller.
Thank you, Mr. Speaker. The extra staff that my honourable friend talks about are welcome in the NHS, but my constituents want to know that standards of care are the best as well. What progress is he making on, to ensure that when patients go into hospital, they're getting the best care that they can?
Well, the most important thing that we have done is supported our frontline staff with additional investment in the NHS, which is something the party opposite called irresponsible, and that's about £13 billion more money going to the NHS during this Parliament. But we've also increased the level of transparency to make sure where there are isolated pockets of poor care, the Care Quality Commission can intervene and make recommendations to improve the quality of care available to patients in those hospitals.
Jenkin.
Speaker, given the significant challenges facing the NHS and this top-down reorganisation that's led to this hiring and firing and the distraction of energy and attention at crucial times that this has made, doesn't the government regret what it's done on this top-down reorganisation?
A reorganisation of NHS services that results in administration spending being reduced from 4.27% under the previous government to 2.77% under the current government, meaning there's £5 billion more money for frontline patient care, is a good thing. That's something the party opposite should support because it means that patients are getting a better service.
Could the Minister remind the House of the number of extra specialist A&E doctors working in the NHS in England compared to the figures for 2010?
My honourable friend is right to raise this important point. As part of our commitment to investing more money in the front line, we've been able to ensure there are between, I believe, 800 and 1,000 more doctors now working in A&E compared to the Labour government.
Just gently remind the House that the question isn't about staff per se in the NHS. The question is about people made redundant and subsequently re-employed. Attention to detail tends to profit a member. Meg Hillier.
Mr. Speaker, on the Public Accounts Committee, we've heard about the industrial scale of this revolving door of people out of one job and into another with a fat redundancy payment. Doesn't this just show that the Tories have lost a grip the government has lost its grip on what's really important in the NHS, which is paying frontline clinicians to serve patients?
It's extraordinary, and the Public Accounts Committee will also be aware that these redundancy terms were introduced by the previous Labour government in 2006, and we have committed to changing those, and I hope, as I mentioned earlier to her honourable friend, that the party opposite will support us in exerting pressure on the unions to support the pay deals on the table, which will introduce an £80,000 redundancy cap.
Ms Johnson, you have a similar question? No?
Mr Speaker, I'm grateful. I wanted to know about the number of nurses that have been made redundant and whether now lots of hospitals in my area are recruiting from Spain, and I wondered if an assessment had been done about the actual cost that the NHS is having to bear now using nurses from abroad when they made other nurses redundant in the past.
Well, our NHS has always benefited from staff from overseas coming to work here and bring their skills. That's something I think we can all welcome, as long as there is a good standard of English that is spoken, and that's something that we're putting right through legislation that we're introducing. But there are, as I outlined earlier, around 7,500 more nurses, midwives and health visitors now working in the NHS than there were under the previous government.
Ms Carswell.
Two, please, Mr Speaker.
Thank you, Mr Speaker. In addition to the extra 1,000 GPs working in our NHS since 2010, our mandate Health Education England will ensure that 50% of trainee doctors entering GP training programmes by 2016. This will enable the delivery of 5,000 additional newly qualified GPs by 2020.
Mr Douglas Carswell.
Many young doctors are choosing not to go into general practice, I'm told. In places like Clacton, this, coupled with the increase in the number of retiring GPs, is leading to real shortages. What more can be done to make general practice more attractive to young doctors to offset the number of people retiring?
Well, there have always been parts of our health service where it's been difficult to attract GPs to work, and that's a long-standing problem. And there's now a new £10 million investment fund which has been put in place to put a new 10-point plan delivered by NHS England, looking at how we can better incentivise younger doctors to work in areas that have traditionally been difficult to recruit. And I'm sure that was something that will bring benefits to his constituents and elsewhere in the NHS.
Sir Tony Baldry.
Well, my honourable friend agreed, though, this is not just a matter of total numbers of GPs. Quite a lot of GPs are now wanting to work part-time. Quite a lot of GPs now want to be salaried rather than being partners. And is my honourable friend confident the model which was set up in 1948 of each GP practice being effectively its own separate private business is still a suitable model as we go forward into the 21st century?
Well, my honourable friend asks an important question, but it is, of course, the case that we can support the existing model and the innovation and that comes with GPs being small businesses, and that's exactly what we're doing with a £1 billion investment fund in GP infrastructure and technology to support those GPs as small businesses to develop better patients for their service.
What is his last outing? Could the minister say, as well as those retiring, could he say how many of those have left the profession and those who've gone to work abroad?
Well, it's always been the case, and certainly the case of many of my medical contemporaries, that people do from our NHS go and work overseas for some time and then often come back to the NHS bringing broader experience and skills. But as I outlined earlier, there are now 1,000 more GPs working and training in our NHS than there were 5 years ago.
Mr Philip Hollowbone.
Following the retirement of a senior partner who they've been unable to replace, Dr Hadrian Moss of the Dryland GP surgery in Kettering has followed the advice of the BMA and informally closed his expanded list of 2,500 patients on the grounds of patient safety. Yet he is now being taken to task by NHS England for potential breach of contract. What is the Minister's view about reconciling the view of the BMA on patient safety guidelines and NHS England's view on potential breach of contract?
I'm sure my honourable friend will understand it's very difficult for me to comment on an individual case, but I'm very happy to look into the matter and to get back to him about it.
Margaret Ritchie.
Mr Speaker, to ensure that the needs of patients come first, and considering that young people are not maybe choosing, as they used to do, GP training, what discussions will the Secretary of State hold directly with the British Medical Association, the Royal College and also the Training Council and his devolved colleagues in all of the administrations in the UK to address this particular issue to ensure that there's not further congestion in A&E departments.
There is a lot of work going on in this area, and firstly, we are encouraging and supporting GPs who have had career breaks, perhaps because they started a family, to get back into the profession more easily than they have been able to do in the past. And secondly, we also have a commitment that 50% of students, medical students and doctors leading foundation training will become GPs in future, and that will make sure we have 5,000 more GPs by 2020.
Mr. Andrew Gwynn.
But the government's reorganisation took billions of pounds away from the NHS frontline. Mr. Speaker, figures released last week show that fewer than a quarter of medical students now enter general practice because they can see the pressure that ministers have put on it, while GP morale has collapsed. Shouldn't the minister now admit that the reorganisation was a mistake and instead match Labour's pledge to invest an extra £2.5 billion a year to recruit 8,000 more GPs and guarantee appointments within 48 hours?
Look, I mean, I know that the party opposite is full of professional politicians, but the medical students don't just leave, don't leave medical school and go become straight GPs. They become foundation doctors. And as I've outlined, when people leave their foundation training, 50% of those doctors will become GPs in future, which will increase the number of GPs by 5,000. And under this government, the number of GPs in education, training and working in the NHS has increased by 1,000, which is a move in the right direction.
Number 3, sir.
Mr. Speaker, I'm delighted to report to the House that the number of CT scans performed at the Countess of Chester Hospital NHS Foundation Trust has increased from 2010 to 2014 by 67%. And in December 2014, only 0.6% of patients waited more than 6 weeks from referral to test at the Trust. Rather better than the figure we inherited in 2010 of 4.9%, and I hope that the opposition will welcome it.
Stephen Mosley.
Thank you. Can I welcome those fantastic figures that the Minister has outlined at the Countess of Chester Hospital? Can he confirm that early and accurate diagnosis is critical for many, many conditions, and we are seeing the results of that in improved survival rates in things like cancer?
Well, Mr. Speaker, my honourable friend is absolutely right. Diagnostics play a key role in our drive to improve cancer survival, and that's why we've committed £750 million to deliver our cancer strategy, including £450 million to achieve better diagnosis of cancer and better awareness and access to diagnostic tests. And projections show that this is working. We're on track to see 12,000 more cancer patients a year surviving for at least 5 years in 2015, which is over double the target we set ourselves of 5,000 in January 2011. And I hope that the party opposite will agree these are real benefits for cancer patients in the NHS today.
Mr. Reid.
Thank you. Thank you, Mr. Speaker. Cancer scanning services in Cheshire and Staffordshire have recently been subject to a competitive tendering process, and the contract was awarded to Alliance Medical, despite their bid being £7 million more expensive than the NHS bid. Can the Secretary of State explain why the more expensive private sector bid was chosen over the better value NHS bid to provide these services? Will the Secretary of State commit to investigating the bidding process to ensure that the tender was conducted fairly? And he's chuntering from a sedentary position. But will the Secretary of State today confirm, because this is a matter of profound public interest, that no contact of any sort took place between his department and the Board of Alliance Medical with regard to this decision, including at any point with the current board member, the Right Honourable Member for Kensington?
Considerable essay to which a pithy but comprehensive response is expected and the House seeks.
Speaker, I admire the honourable member opposite's chutzpah, but really it ill-behoves him to come and talk to us about privatisation. It was his party that led to the increases, and it's this government that has stopped it, and he needs to acknowledge that. Mr. Speaker, on the facts, in December, NHS in England performed over 130,000 more diagnostic tests compared to December 2013. I note that the honourable gentleman didn't talk about Wales, where 24% of patients have waited more than 8 weeks for their diagnostic test, compared to 2% of patients in England.
Well, I think, yes, the question was about Chester. Yes. So there's no particular reason to talk about Wales. Mr. Paul Uppal.
5, please, sir. With permission, Mr. Speaker, I'd like to answer questions 5, 6 and 13 together. This government inherited the worst cancer survival rates in Western Europe and, as we've just heard, invested a record £450 million in improving early diagnosis, which means that record numbers of people are being tested and record numbers of people are being treated.
Uppal.
Last year I met with cancer patients and carers with the aim of how we can improve cancer survival rates amongst the best in Western Europe. The main observation was that early diagnosis is key. Would my right honourable friend agree that it's absolutely crucial we can actually support GPs to find the early signs and symptoms of cancer so that we can improve survival rates?
Well, that is absolutely right. And what everyone says who's been wrestling with this problem about why our survival rates are not as good as we want is that early diagnosis and access to the latest drugs are the two critical things. And he will be pleased that 9,000 people in his region have accessed the Cancer Drugs Fund, and in his constituency 300 more people every year are now being treated for cancer than 4 years ago.
Thank you, Mr. Speaker. The excellent progress made in cancer survival rates is great news across the UK and in my constituency in Fylde. A lot of that is down to the number of increased availability of diagnostic tests. Statistics from Blackpool Trust show that just under 33,000 more diagnostic tests were carried out in 2014 and 2010. With this in mind, can my right honourable friend commit to further availability of diagnostic tests?
We absolutely can. In fact, we're doing about 500,000 more diagnostic tests for cancer every year than was happening 4 years ago. And the result of that is that over the course of this Parliament, 700,000 more people are being admitted for cancer treatment in our hospitals than was the case in the last Parliament, saving 12,000 lives every year.
Robin Walker.
Thank you, Mr. Speaker. I welcome the Secretary of State's answers. Improvements in radiotherapy have been a key factor in improving cancer survival rates and quality of life for patients. Worcestershire is this month celebrating the delivery of a state-of-the-art radiotherapy centre at the Worcestershire Royal Hospital, and I visited that £25 million oncology centre myself last week, with some of the most advanced equipment in the country and 8 new consultants recently recruited. Would my right honourable friend agree this centre will be a key asset in taking forward the fight against cancer?
Well, absolutely. And it's a fantastic thing for Worcestershire Royal. He's campaigned very hard for that. It's fantastic for his constituents. Cancer treatment is, of course, expensive, which is why you can only fund developments in cancer if you have a strong economy to back it, and that's what this government is committed to doing for our NHS.
Mr. Graeme M. Morrice.
Thank you very much, Mr. Speaker. Can I draw the Secretary of State's attention to an excellent debate we had in the Chamber on the 5th of February under the auspices of the all-party groups on cancer? And can I draw his attention to the uncertainty surrounding the funding of the National Cancer Peer Review Group programme, which has recently been reviewed, and the Minister indicated that it would continue. Could he use this as an opportunity to give a commitment to funding that peer review group, because there does seem to be a doubt amongst the 17 national cancer charities that support that work?
Well, let me reassure him that we are absolutely committed to furthering and improving peer review as a way of improving and winning the battle against cancer. NHS are committed to that programme, and they're just looking at how it can be improved.
The honourable gentleman seems to be enjoying a very close relationship with his mobile phone. I hope it profits both of them. Mr. Derek Twigg.
Can I ask the Secretary of State, in terms of early detection of cancer, whether he would consider putting more resources into areas that are deprived, such as Bolton, socially deprived, where they have a higher rate of cancer instances, whether he would consider putting more resources into areas such as Bolton?
We are putting more resources into Bolton. In fact, we're putting more resources across the NHS, but for diagnostic tests, including cancer tests, 21,000 more tests every year compared to 4 years ago, and I hope that's something he'll welcome.
Mr. John Barron.
The Party Group on Cancer and wider cancer community have commended the government on introducing the cancer one-year survival rates into the delivery dashboard from April of this year as a means of driving forward earlier diagnosis. But what can the Secretary of State tell us about work being undertaken to ensure that the levers of accountability are in place to ensure that underperforming CCGs raise their standards on behalf of patients?
Well, I really would congratulate him for his understanding of the importance of transparency, and he will welcome the fact that we're now saving 1,000 more lives a month as a result of focusing on the 5-year survival rates. But that transparency must apply to CCGs as well, and discussions are ongoing with NHS England as to the best way to do that for lots of things, including cancer.
Liz Kendall.
Thank you, Mr. Speaker. Last week we learnt that the 62-day target for cancer treatment has been missed for a full 12 months. This isn't just about missed targets. Consecutive breaches mean thousands of patients are being failed, and these targets exist to ensure swift diagnosis of cancer and access to treatment, which is vital if we're serious about having the best survival rates in the world. Not my words, Mr. Speaker, but an exact quote from Cancer Research UK. Which bit of it does the Secretary of State disagree with?
I don't disagree with it, but I'll tell her why it is that we're missing that one target. Incidentally, we're hitting the 7 other targets. It's because we are treating and diagnosing so many more people, 560,000 more diagnoses every year. What that's meaning is that we are treating in this Parliament 700,000 more people than were treated under Labour's last Parliament, saving 1,000 more lives a month. And if she looks at some of the other things that Cancer Research UK say, they welcome that strongly.
Yeah. Dr. Sarah Wollaston.
Number 7, Mr. Speaker.
Minister Norman Lamb.
Thank you, Mr. Speaker. HM Treasury's costing demonstrates the limitations of data available nationally in estimating the potential costs of providing free personal care at the end of life. That is why the Department of Health is undertaking further work with stakeholders to develop an evidence base to inform the next spending review.
Dr. Sarah Wallace.
The Minister for that. He will know that most people want to be able to remain at home at the end of their lives, surrounded by the people that they love. And I pay tribute to all the carers, volunteers and health professionals, including Rowcroft Hospice at Home, that helped to make that possible. Sadly, he'll also know that very often the situation can break down because of the sheer exhaustion of caring for a loved one at the end of their lives. And I wonder whether the Minister would commit for the Government to also consider the quality of care as well as the costings in considering bringing forward free end-of-life social care.
Well, I thank my right honourable friend for that question, and I share her in paying tribute to the work of so many people, both volunteers, loved ones, but also the professionals working in the community. And the whole emphasis should be ensuring that we respect people's choice about where they want to be and ensuring that they get the best possible care. Later this week, we'll get the publication of the independent review of choice at the end of life, and I hope that will also inform the discussion, but I'm completely with her in trying to make sure that we can achieve this.
Lisa Nandy.
My constituents recently went through a lengthy, distressing and difficult process to get NHS continuing care for his wife. If we remove this distinction between NHS and social care, so many people across this country, including my constituent, would be spared this distress and this difficulty at one of the hardest times in their life. We know that funding should be put in where it's needed. We know that that would be more cost effective in the long run, and we know that it would be better for patients. So why is it that the Minister will not act?
Well, I think actually we are all agreed on this. We all want to achieve a situation where there is free care at the end of life. But whoever is in power after the election in May will have to ensure that we understand fully the costs. There is a lot of evidence, and the evidence is growing, and we're having very good discussions with groups involved in care at the end of life, and we all want to achieve that solution. Of course, the truth is that very many people are receiving free care at the end of life, but they're in hospital where often they don't want to be. So I'm completely with her in trying to achieve this.
Mr. Paul Burstow.
Thank you, Mr. Speaker. 8 out of 10 people say that they prefer to die at home when their time comes. Since the government published its white paper in 2012 and said that it saw merit in social care being free at the end of life, there have been a succession of reports from Macmillan, Nuffield and others that have shown that there are savings to be made and benefits in terms of more dignified deaths and compassion for families. Is it not time to act on the evidence and make social care free at the end of life?
Well, we very much hope that the case will stack up. As I indicated earlier, we are in active discussions with these groups. I held a round table with them a few months ago to discuss how we can achieve this. Everyone is, I think, agreed on the objective. We just do have to understand the full costs involved before any government can commit to it.
Frank Fylde.
Something deceitful about the government promising major changes for the next Parliament when we don't know how they're going to be paid for. If we want to have an NHS and end-of-life care improvements in the next Parliament, both sides of this House need to put before the electorate how they're going to pay for those very important long-term changes.
Well, I'm tempted to say that's a bit rich, coming from a member opposite, but right honourable member opposite. I'm sure he would agree that whatever commitments are made, we need to understand what the cost of those commitments are. That's the work that's underway at the moment. As soon as we achieve a full understanding of that, I hope personally very much that we can then proceed.
Mr. James Morrice.
Number 8.
Mr. Speaker, the government's £300 million Genomics England programme, led and announced by the Prime Minister as part of our life science strategy, has the potential to dramatically improve cancer diagnosis and treatment by sequencing the entire genetic code of 100,000 NHS patients and volunteers and combining with their clinical records and launching a genomic medicine service, a world first in the NHS. We're going to be able to understand the genetic triggers of disease, unlock new diagnostics and identify better treatments from existing drugs.
The number of people being successfully treated for cancer and getting appropriate diagnostic treatment in Dudley and Sandwell has increased substantially over the last 5 years. But would the Minister agree with me that harnessing genomic medicine is absolutely key to the future, and we need to drive innovation in this area over the next 10, 20, 30 years?
Well, my honourable friend makes an excellent point. He is absolutely right. Cancer is a genetic disease, and the more we know about genetics, the more we're discovering that different patients' predisposition to different diseases and drugs is absolutely key. Nowhere is this more clear than in breast cancer, Mr. Speaker, where the HER2, Herceptin breakthrough and the BRCA2 gene are allowing us to better screen, better target and better predict the treatment of breast cancer, freeing women from the choice of mastectomy, which has been far too dominant, and allowing us to treat breast cancer as a preventable disease.
Bob Russell.
Question 10, Mr. Speaker.
Thank you, Mr. Speaker. The Government is clear that voluntary organisations and charities make an important contribution to the delivery of local health and social care services, including services which support people's mental health needs. However, it is the responsibility of local commissioners to commission appropriate services based on their local population's needs.
To the Minister for that answer, but he will be aware that while the NHS is one organisation, trusts seem to operate as silos. Will he therefore convene a meeting of all the trusts in the Colchester area to discuss the future of the Haven project?
Well, I visited the Haven last week with my honourable friend, and I have to say I was enormously impressed by everything that I heard, including the extraordinary testimonies of people with personality disorder who had benefited so much from their service. And in my view, it would be incredibly sad and very concerning if this service was to be lost. So I'm very happy to invite the Clinical Commission Group and indeed the Mental Health Trust to a meeting in the department to discuss how this can be saved.
Sir Kevin Barron.
I recently had a meeting with the United Kingdom Youth Parliament members from Rotherham who talked, each one of them, 5 of them, about the lack of facilities for mental health help in education, both in further education and in state education as well. Could I say to the Minister, it's all right saying that it's up to the local commissioning groups, but where is the leadership in relation to this, where our young people are left in very, very difficult situations and is seen by some professionals, but certainly not held professionals?
Well, I think the members of the local youth parliament, the local members of the youth parliament that he has met with, make an incredibly important point. And indeed, I would refer him to the Young People and Children's Mental Health Task Force, which will report very soon. And I think that the role of schools will be absolutely crucial as part of their conclusions. But I would encourage him to look at that when it emerges.
Ziana Berger.
Thank you, Mr. Speaker. The latest figures show a huge rise in the number of young people with a mental illness turning up at A&E. Young people not getting the help they need early on and becoming so ill that they need hospital care shows that the system is failing. Does the Minister accept that this Government's decision to cut children's mental health services at the same time as wasting £3 billion on a reorganisation has been a key factor in this failure?
Well, this government has absolutely not made any decision to cut children's mental health services, and she knows that it's misleading to suggest that that's the case. These decisions are taken by local commissioners, both in local authorities and in CCGs. We've legislated, indeed, for parity of esteem with mental health, and I would urge her again to look at the outcome of the Children and Young People's Mental Health Task Force, which I think gives us a real opportunity to improve the way in which services operate.
Number 11, Mr. Speaker.
The full-time equivalent number of nurses, midwives and health visitors working in the hospital and community health services in England per million population from September 2010 to September 2014 inclusive has remained broadly constant at 5,872, 5,768, 5,703, 5,712 and 5,781 respectively.
Steve McCabe.
I'm grateful for that answer. Mr. Speaker, out of 11 parliamentary questions I've submitted in the past year, the Minister has admitted that he doesn't know how many part-time agency and locum GPs are in the health service. He doesn't know the number of agency and part-time nurses. He doesn't know the number of part-time doctors in our hospitals, and he doesn't know how many working nurses and midwives are also drawing their pensions. Given that he has so little detail on staffing, where did today's figures come from, and what faith can anyone have in them?
Well, they're in the monthly staff statistics survey, and I'm sure very pleased to hear, as he would like to know some detailed information in his own constituency, there are now 386 more nurses than there were in 2010 under the previous government, and nationally there are 7,500 more nurses, midwives and health visitors working in the NHS.
Mr. Joe.
Thank you, Mr. Speaker. Does my honourable friend agree with me, and indeed the nursing profession, that if nurse staffing levels on acute hospital wards falls below one registered nurse to 7 acutely ill patients, excluding the registered nurse in charge, that this will significantly increase the risk to patient care and result in avoidable excess deaths?
My honourable friend and I have discussed this many times, and I don't agree with him, as you know. What is important is that the patient is assessed on their clinical needs, and a rehabilitation ward will need a different number of nurses. Indeed, it may need physiotherapists and occupational therapists, whereas intensive care nursing often requires one-to-one care. So setting arbitrary staffing ratios isn't in the best interest of patients.
The Minister surely knows it's not just broad numbers. It is the shortage of specialised nurses in many departments, certainly in Calderdale and Huddersfield, that we're finding difficult to recruit the right qualified nurses for very specialist tasks, as well as the doctors to go with them.
Well, I think in many parts of the country we're actually seeing more specialist nurses working, particularly in areas such as diabetes and supporting patients with complex care needs. And as we need to better support people with those complex care needs at home and in their own communities, having specialist nurses that can provide care not just in the hospital but also work in the community at the same time is something this government will continue to invest in.
Mr. Austin.
Mr. Speaker, Russell's Hall Hospital is being forced to lose 1 in 10 staff, which could include midwives, to deal with government efficiency savings of £12 million every year. This morning, the hospital's chief executive has written to me and says, quote, that these excessive efficiency requirements place care at risk. She says the financial challenge has reached unviable levels and that NHS providers, quote, can no longer guarantee sustainable and safe care. What's it going to take? What's it going to take for ministers opposite to listen, not just to us, but to NHS staff, and ensure that hospitals like Russell's Hall have got the resources they need to provide care for local people?
Well, I'm sure the honourable member will be very pleased that, as part of our winter pressures funding, Dudley received £3.5 million to support the hospital during a difficult winter period. And there are now 69 more doctors, 324 more nurses, and 20 of which 29 are more extra midwives working in the area than there were in 2010.
Mr. Bernard Jenkin.
Number 12, Mr. Speaker.
You keep going.
My right honourable friend, the Parliamentary Under-Secretary of State for Quality, responded in February 2014 to correspondence from the client chair of the Haven project about its funding. As I said a few minutes ago, decisions on NHS funding are a matter for local commissioners, but I will invite the North East Essex Clinical Commission Group to meet to discuss the issue in more detail.
To my right honourable friend for taking such a close interest in this, and indeed along with the visit paid by my honourable friend for Central Suffolk and North Ipswich. While understanding the huge cost pressures on the CCG, can I invite him to study the Enable East report, which gave a different recommendation as to how this unit should be treated. And in particular, it would be sad to close the leading example of 11 Department of Health pilots, and just to close this one when all the other 10 are being kept open, as the lessons learned are very valuable.
Well, I am very much aware of the work that my honourable friend, my right honourable friend, and my honourable friend, the member for Colchester, have done on this. And it is interesting that all other 10 of the pilots have continued. They are part of NHS Trust. This is the only one run by a voluntary sector organisation. But it seems to me that this is an incredibly valuable service. And what really struck me was the extent to which people told about how much they had reduced their hospital inpatient admissions as a result of the incredibly impressive preventive work that this service provides. And I want to look into it further.
Griffiths.
Number 14, Mr. Speaker.
Thank you, Mr. Speaker. The government acknowledges the challenge posed in supporting patients with Ehlers-Danlos syndrome, which encompasses a complex range of conditions with a wide variety of symptoms. Diagnosis and investigation of suspected EDS takes place in dedicated regional genetics clinics, with specialist clinics, as he will know, at Sheffield Children's NHS Foundation Trust and North West London Hospitals NHS Trust.
I thank the Minister for that response, but people in Burton have raised £130,000 to pay for a life-saving operation for Nina Parsons, my constituent who suffers from EDS. This operation isn't available in the UK. I have another constituent, Sarah Pugh, who is having to pay for vital physiotherapy and also for an MRI. Will the Minister look at what more can be done to help people suffering the misery of EDS? And will she agree to meet some sufferers to discuss it further?
Well, I'm certainly very happy to talk to him about his particular constituents. I'm aware of the work he's done in his local area. I mean, he will be interested to know that the government in 2013 published the UK Strategy for Rare Diseases precisely to address some of these sorts of issues and the complexities around them. And there are aspects of that strategy that speak directly to the challenges that he's just outlined. Could I also take this opportunity, perhaps, Mr. Speaker, to mention that there's an event tomorrow in Parliament organised by Rare Disease UK to mark Rare Disease Day, at which the Parliamentary Under-Secretary for Quality will be speaking.
Davies.
Number 15, Mr. Speaker.
We know from local examples that areas which offer 24/7 community palliative care services have been able to reduce the number of A&E attendances and inappropriate hospital admissions, including emergency admissions, for people with palliative care needs. I would encourage all areas to offer these services in line with the NICE quality standard.
Well, I'm very grateful to the Minister for that answer. A poll conducted by Sue Ryder shows that 82% of people expect advice to be available 24/7, yet only 8% of CCG areas have a dedicated around-the-clock palliative helpline and coordination centre. I'm sure we all agree, carers do wonderful work and they need as much support as possible. Will his department work with Sue Ryder and others to ensure that there is a dedicated 24/7 palliative care service, which would certainly help to take the strain away from A&E, which is already under great pressure?
Well, I pay tribute to the professionals in his own area who are one of the leading areas for providing strong support to in the community, which prevents unnecessary hospital admissions. And I'm very happy to work with Sue Ryder and others to try to get the message across that if this can be provided across the country, then we will improve the experience of people at the end of life, but critically also save costs further down the line by stopping inappropriate hospital admissions.
Macleod.
Thank you. Number 16.
Mr. Speaker, you sounded a bit tedious in calling my name again there, but...
I feel no sense of tedium, almost a state of ecstasy upon calling the honourable gentleman. If I gave any other impression, I most heartily apologise to the honourable gentleman. I hope he's now assured of his status in the affections of the chair, if possibly also of the House. There may have to be a division on that proposition, I don't know. Minister.
I'm so grateful to be reassured, Mr. Speaker. So mental health is a priority for this government. We have legislated for parity of esteem between mental and physical health, invested £400 million in talking therapy, significantly reduced the numbers of people who are placed in police cells during mental health crisis, and are introducing the first ever waiting time standards for mental health from April this year.
Mary MacLeod.
Thank you, Mr. Speaker. I recently met a constituent at one of my advice surgeries who'd been refused NHS mental health care because she'd been told she was only entitled to one batch of free support. Considering how complicated and varied mental health issues can be, is there anything we can do for people who need more support after a relapse in mental health?
Well, may I just say that if that was the advice that she received, it is complete and utter nonsense. The idea that you have one episode of care under the NHS and that's it is just so ridiculous it hardly merits a proper response. But I would urge her to encourage her constituent, with her support, to go back to local services to ensure that if she needs further support, that she gets it as she's entitled to.
Parish.
17, Mr. Speaker, please.
Mr. Speaker, great spring in your voice. Community hospitals can play a hugely important part in the 21st century NHS. The NHS 5-year forward view explicitly recognised the role of smaller hospitals, including community hospitals, as part of the new care models towards which we need to evolve. And specific local commissioning decisions are rightly taken by local clinical commissioning groups reflecting local need.
Neil Parrott.
Thank you, Mr. Speaker. I have excellent hospitals in Tiverton, Honiton, Axminster and Seaton, and there could be a much greater link between the RD&E in Exeter and the community hospitals to take away patients when they've had their acute operation, move them to the community hospital in Axminster, so creating space at the RD&E and keeping Axminster Hospital open with beds, which the population is very keen to do so.
Well, Mr. Speaker, I pay tribute to my honourable friend's tireless work on this, and I know he's recently met with the Secretary of State on it, and he's been very active locally and here in Parliament on it. He's right, local community hospitals can play a key role in supporting patient convalescence, providing particularly good care in the community close to home, convenient for elderly patients, and relieving pressure on acute hospital beds. And don't take it from me, Mr. Speaker, take it from Simon Stevens, Chief Executive at NHS England, who I'm delighted to say recently said that a number of other countries have found it possible to run viable local hospitals serving smaller communities than sometimes we have thought are sustainable in the NHS. The NHS needs to abandon a fixation with mass centralisation, and I hugely welcome it.
Andrew Robertson.
Number 18, sir.
Mr. Speaker, the Government welcomes any individual who has the courage to shine a light on malpractice, wrongdoing or patient safety issues in the NHS, and the House will be well aware that this is something the Secretary of State has very much championed. Professor Thomas has a right to express his views on the health service and wider issues, and I understand the Trust has confirmed this. The Department isn't responsible for the investigation of cases involving individual members of staff, but I do want to be clear that confidentiality agreements cannot be used to prevent individuals from making a protected disclosure in the public interest.
Mr. Andrew Robertson.
I'm glad to hear that answer. I know that the Secretary of State has had dealings with Professor Thomas, but I do think it is very important that this be looked at closely in the light of the Francis report. If it is the case, as it is said in media reports, that Professor Thomas has been forced to sign a confidentiality agreement, so-called gagging order, I think this is disgraceful and shows a very dire state in the NHS in the Royal Marsden. Perhaps she might like to comment.
Well, I can only reiterate this Government's complete commitment to openness when it comes to patient safety, and to reiterate confidentiality agreements cannot be used to prevent individuals from making a protected disclosure in the public interest.
Mr. Andy Slaughter.
Did the Secretary of State see...
Number 22.
Oh, number 22, I apologize.
Mr. Speaker, the clinicians are leading a process in West London which is very much aimed at improving services for people in West London. As he is well aware, the local NHS is pressing ahead with the implementation of service improvements as part of the clinically led reconfiguration programme Shaping a Healthier Future.
Ms. Randy Slaughter.
She doesn't sound very convinced by that herself. I wonder if she saw the comments from the College of Emergency Medicine yesterday that said that trying to get people not to go to A&E had been a dismal failure, and what we should do is locate primary care services alongside A&E. That is the model we have at Charing Cross and in the rest of West London. That is succeeding. What's failing is the closure of emergency departments that's putting an intolerable strain. Will the government look again at this issue? Will you stop closing A&Es in West London?
Well, I'm afraid that the honourable gentleman has got a very, very dismal track record of campaigning on this issue. We have all seen the leaflets that have put out in West London, and I can only say to his constituents in the coming election they would glean more from reading their tea leaves than reading his leaflets if they want to know the truth about the NHS in West London.
Order. We have got through all the questions, I'm pleased to say. We come now to the 10-minute rule motion. Oh, sorry. I beg your pardon. I'm ahead of myself. Topical questions, indeed it is. Sir Nic Harvey.
Thank you, Mr. Speaker. In the past couple of days, several... Number one, sir. Sorry.
Yes. My getting it wrong disorientated the right honourable gentleman, for which I apologise. T1, Secretary of State.
Thank you, Mr. Speaker. At the end of this Parliament and before returning, I trust, to the same size of this chamber in late May, I'm pleased to update the House on NHS workforce numbers. On the back of a strong economy, our NHS now has more doctors, nurses and midwives than ever before in its history, including 7,500 more nurses and 9,500 more doctors, and the result is 9 million more operations this Parliament compared to the last Parliament, fewer people waiting a long time for their operations, and a start in putting right the scandal of short-staffed wards that we inherited and were highlighted by the Francis report. Indeed, last year the Commonwealth Fund said that under this government the NHS has become the safest, most patient-centred and overall best healthcare system in any major country.
Now, the topical questions and answers should be brief. It is a rank discourtesy order. It is a rank discourtesy to the House to expatiate at length and thereby to deny other members the chance to put their questions. It will not happen. Simple, short, factual answers is what is required. Sir Nic Harvey.
Mr. Speaker, in the past couple of days, a number of Devon and Cornwall hospitals have declared black alert status, meaning they're essentially full and can't cope with any more demand. Do ministers understand public concern, therefore, that the CCG is considering closing beds in community hospitals, including Ilfracombe and South Molton, in my constituency? Can anything more be done to help rural health economies trying to restructure but struggling already to cope existing demand?
We do understand those concerns. It's absolutely essential that CCGs make sure that they have the right bed capacity to deal with the pressures of winters.
Mr. Andy Burnham.
Thank you, Mr. Speaker. And let me take the Secretary of State back to a subject he likes to avoid, NHS privatisation. He tries to deny it's happening on his watch, but we heard earlier about the ideological privatisation of cancer scanning in Cheshire and Staffordshire, despite it being more expensive than the NHS bid. And now it could get much worse. On the Friday before recess, the government sneaked out the public contracts regulations, which require NHS contracts worth over €750,000 to be opened up to full EU competition. Will the Secretary of State confirm that this is indeed the case in these regulations, and can he explain what mandate he has from the public to open up the NHS to private bidders across Europe?
Can I just suggest to him, since the last time we met, the King's Fund published their assessment of the NHS reforms over the last few years, and their words were, claims of mass NHS privatisation were and are exaggerated. He knows perfectly well that when it comes to outsourcing, it grew at double the rate under the last Labour government than it's grown under this government.
King's Fund report, because the King's Fund report said it had resulted his reforms in, quotes, greater marketisation of the NHS. And people will notice, Mr Speaker, that he failed to answer my question, and that's because he wants to sneak these plans through under the radar. Well, I served notice on him today that we will fight him all the way, right to the very last day of this Parliament. If passed, these regulations will mean that almost every NHS contract will be forced to be advertised across Europe, shattering the promise he made to protect the NHS from EU competition law. Isn't it now abundantly clear that he has forfeited the public's trust on the NHS, and that 5 more years of this government will lead to huge acceleration in NHS privatisation?
Claims of mass NHS privatisation were and are exaggerated. But if he doesn't like those reforms, let's look at a country that didn't do those reforms, Wales. People waiting too long for A&E, nearly double England. People waiting too long for urgent ambulances, nearly double England. People waiting for operations, 10 times those in England. That's our record. It's a record of success.
Lynn Davies. Thank you, Mr Speaker. Not enough GPs want to practice in rural Wales. And I'm told that one of the reasons is that DPs currently registered in England have to go through a bureaucratic process to be able to actually work in Wales. Will the my right honourable friend work with the Welsh Government to ensure that we have a common registration process so GPs can move between England and Wales without having to have special, long, time-wasting new bureaucracy?
I'm very happy to look into that issue and look to what we can to support the workforce that we have in our NHS to move as freely between England, Scotland, Wales and Northern Ireland as possible. Of course, the fact that we have increased GP numbers in England has been the fact that we protected the NHS budget, unlike in Wales, where it's been cut by the Labour administration.
Recent Ashcroft poll shows that only 15% of the public think that this government have the best approach to running the NHS. Will the Secretary of State come up to the dispatch box and apologise for his top-down reorganisation of the NHS and his Tory privatising Health and Social Care Act, and accept that the public will never trust the Tories with the NHS?
I'll tell him what the public think about the NHS. Last year, under this government, dissatisfaction at its lowest ever level. Satisfaction jumped the highest amongst Labour voters. And where did satisfaction go down? In Wales.
Annette Brooke.
Thank you, Mr Speaker. I previously made ministers aware that there are no beds for females in Dorset who need intensive psychiatric care. Our local newspaper, the Daily Echo, reports that such places will not be provided in Dorset for another 3 years. Meanwhile, patients are being sent as far away as Bradford. Does the Minister regard this as satisfactory? Are there enough resources coming to Dorset? Or is it a local organisational issue?
No, I don't regard it as satisfactory, and I'm happy to talk to the local commissioners. We've ensured that there will be real terms increases in mental health funding for 2015-16, and this is something that should be regarded locally as a matter of some urgency.
Bolton's accident and emergency has been in crisis recently, partly because the clinical commissioning group closed the town's walk-in centre. So will the right honourable gentleman support my petition calling for its reinstatement, or will he more predictably say, it's not me, Gov, I'm just the Secretary of State for Health?
Well, let me tell him, and I'm accountable for what happens in the NHS, what's actually happening in Bolton. Because compared to 4 years ago, 2,756 more people are being seen at A&E within 4 hours. That is a record of investment and success.
Duncan Hames.
Mr Speaker, what alternatives do clinical commissioning groups have to a full-scale commercial procurement when their existing contracts for community health services approach having run their course?
Well, this is a matter for local commissioners. There is no requirement on them to competitively tender if their judgment is that it's right for the local community that services remain with the existing provider. We've been very clear that this is a matter for local commissioners.
Thank you, Mr Speaker. My constituent Wilma Ord was prescribed Primidus in the 1970s, an oral hormone pregnancy testing pill she blames for her daughter's birth defects. As the Secretary of State is aware, it was announced back in October that an inquiry would be established to look into this whole issue. Can I ask him what progress has been made in setting up the inquiry, and what assurances can he give to my constituent and the many other women and families affected throughout the country that the inquiry will be fully comprehensive, transparent and independent?
Well, I'm delighted to report, Mr Speaker of the House, I've met on a number of occasions with colleagues across the House and patient representatives of that campaign. We have appointed the chair and made sure that the terms of reference for that inquiry are clear and comprehensive. It is not, I stress, a judicial inquiry, it is a medical inquiry looking at the evidence.
Jim Lawton. Mr Speaker, a constituent of mine has pointed out that drugs for cystic fibrosis are not subject to an exemption from prescription charges, despite being a long-term condition, apparently because when it was first diagnosed, it was only considered to be a children's disease. Can the Minister look into this anomaly?
Minister. Well, this is something that did come up during a debate we had about cystic fibrosis last year. I'm very happy to look at it again. I did look at it subsequent to the debate in response, I think, to an inquiry from the Honourable Member for Colchester. But I'm happy to look at it again and get back to him on that.
Field.
When I asked the Minister last June what guarantees he would give to GP practices at risk because of the withdrawal of the minimum practice income guarantee, I was told that NHS England would ensure that threatened practices, and I quote, get to the right place. Over the last 7 months, those discussions have not alleviated the threat to 2 highly regarded practices in my constituency which face closure. Will the Minister agree to meet with me and representatives of the practices to discuss what's really happening and to consider what can be done to save them?
Minister. I'm very happy to meet with the honourable gentleman, but he will be aware, of course, that the move away from the historical funding formula towards a per-head capitation formula is the right direction. But if there are certain local concerns, I'm very happy to meet with him and discuss those.
Mr Robert Jenrick.
Can I commend the Government for prioritising or raising the priority of dementia and the announcement last week by the Government? And would the Secretary of State and the Department for Health put all their resources behind towns like Newark, which are trying to establish themselves as dementia-friendly towns, working with shopkeepers, banks and the business community for older towns to make it easy to lead fulfilling lives with dementia?
I commend him for his work in that area because, of course, people with dementia want to lead as normal a life as possible, and being able to go out to the shops is one very important thing they want to be able to continue to do. We now have 1 million dementia friends in this country. It's a great step forward, and with his help, we'll do even more.
Seebeck.
Speaker, can the Secretary of State confirm when he expects NHS England to confirm a date for the national tariff for the supply of prosthetic services and equipment? Because his lengthy and, quite frankly, unacceptable delay on his watch is now causing really serious issues for those who need prosthetics, as well as those who want to deliver the service.
I'm happy to look into that issue and get back to her.
Mr Jeremy Lefroy.
Mr Speaker, in addition to the work which Monitor does on tariffs for individual pathways, what work has it done to assess the base funding which acute hospitals need to maintain core services which are so interdependent?
Monitor has done extensive work, but he's absolutely right to talk about this issue because if we're going to meet the financial challenge the NHS faces over the next 5 years, then we need to have a very sensible discussion about what realistic efficiency gains need to be made, and I'm sure he'll engage in those discussions.
Reckless.
Medway's clinical commissioning group is looking at putting GPs at the front of our accident and emergency to help relieve pressures on emergency doctors. Do ministers believe this is a promising way forward?
There's certainly a lot of benefit from having general practice co-located alongside A&E so that people with more minor ailments and concerns can be seen by those GPs. It can often take pressure off of A&E services. There's also more senior expertise on hand when required.
Sarah Newton.
Speaker, would my honourable friend, the Secretary of State, update the House on what steps he's taking to prevent avoidable deaths from sepsis?
Well, I'm absolutely happy to do that because we have overall 1,000 avoidable deaths every month by some estimates. A number of those are from sepsis. We've launched a big campaign to prevent those deaths. Indeed, we'll shortly be hearing the results of the Morecambe Bay inquiry, where I think we'll hear more about this issue. I'd like to thank her for her campaigning and her work with the all-party group to raise this very, very important issue.
Gibson.
Speaker, GPs across the North East say they are facing a workforce crisis with falling numbers of family doctors. Does the Secretary of State not recognise the connection between people being unable to get an appointment to see their GP and the rising and major pressure on our A&E department?
Well, the Honourable Lady, I'm sure, would like to support the plans that we have in place to make sure we increase the number of GPs by 2020 and ensure that 50% of doctors leaving foundation training but go into careers in general practice.
Mr. Adrian Sanders.
In order to combat fraud, the last government quite rightly introduced 5 yearly prescription charge exemption certificates. Now people are coming up for renewal. They're finding that they have to pay for their medicines because it's expired, or even being fined. Unlike a TV licence, there's no renewal. Will the government look at ensuring people are told that they need to renew their prescription exemption?
Well, as my honourable friend will be aware, 90% of patients do receive free prescriptions, either due to the fact that they are older and over the age of 60, or because of long-standing other factors. And, of course, if he has constituents who are running into difficulties and have problems with renewing their certificate, I'm very happy to look into that and meet with him to discuss it further.
Mr. David Anderson.
Mr. Speaker, despite assurance from the Prime Minister, it's now clear that the drug Translana will not be available until after NHS England has concluded its consultations, internal consultations. The Secretary of State and Minister have told me repeatedly that they have no control over this, but can they give us any idea when this drug will be available to young boys suffering from Duchenne's muscular dystrophy in this country in the same way as across Europe, and it's saving young boys going into wheelchairs early? Have you got any idea when this will be available?
Mr. Speaker, I've had meetings, a number of meetings with patient groups and campaigners and the charities over recent months. The Honourable Gentleman will appreciate due process is important here. NHS England are looking at whether to make an interim ruling on the drug in advance of a NICE decision, and I have worked with NICE to ensure that their process is accelerated, and we should get a decision from NICE this summer, and I'm hoping that NHS England will make a rapid decision based on that judgment.
Order. I'm sorry to disappoint remaining colleagues, but as usual, demand has exceeded supply. A point of order, Glenda Jackson.
Mr. Speaker, this is a genuine request for real information. Because I'm ignorant. Mr. Speaker, on January the 13th, I forwarded correspondence from one of my constituents to the Prime Minister. My constituent was very concerned of what he perceived as the Prime Minister's wish, and I quote, with regard to encrypted communications, to enable the government to snoop on the private individual. As a month had passed and I had received no communication, I did a follow-up. And on the 23rd of this month, I received a copy of a letter sent to my constituent directly. It is on Conservative Party paper from the political correspondence manager, 10 Downing Street. The correspondence was sorry to read of my constituents' concerns, and then goes on to say, the Conservative manifesto will therefore make very clear that a Conservative government will introduce the legislation. The final sentence of this letter, Mr. Speaker, is I do hope you find this reassuring and that you will feel able to support us in the months and years ahead. It was my understanding, Mr. Speaker, that no humble backbench MP is ever allowed to use our parliamentary offices, indeed our parliamentary salaries, on party political campaigning. It is also my understanding that number 10 Downing Street does not become the property of its incumbent's political party. So I would be grateful for your advice, Mr. Speaker, as to precisely whom I can address my concerns for what strikes me as being totally unacceptable behaviour on the part of the Prime Minister.
Well, is it on the same matter? No, well, we're saving the Honourable Gentleman up. We'll come to him presently. In respect of the point of order of the Honourable Lady, although I understand the very considerable unhappiness she might feel, and that her constituent has experienced on this matter, it's not clear to me that it is a matter for the Chair. And I say that in all sincerity. I have had modest advance notice of the matter, and it's not clear to me. The question of the letterhead is not a matter for the Chair. It may well have been judged proper in the circumstances to volunteer a view as to what a party to the coalition would intend for the future, rather than to purport to speak on behalf of the coalition government as a whole. In other words, it might be thought by some people to be a prudent judgment to answer on behalf of a party on party notepaper rather than on the part of a government. That may be a matter of opinion. All I would like to say, I do take what the Honourable Lady says seriously, not least because I know she doesn't regularly raise points of order, and certainly not frivolous ones, which, believe it or not, some people are inclined to do. Therefore, I treat her with great seriousness. But what I would say is that she will be with us, fortunately, in the House for a little while longer. There will be an opportunity in the House to air her concerns, I feel sure. She will look at the order paper, she will see what opportunities for questioning there are, and she will draw from her study the appropriate conclusion. Perhaps we can leave it there for now. Well, I hope that the honourable gentleman has been suitably warmed up. Point of order, Mr. Barry Sherman.
But, Mr. Speaker, you wouldn't consider this frivolous. You gave me a very considered reply when I asked for guidance because of the really unique situation of having a fixed-term parliament and ministerial visits around the country. We've just had a health questions, where ministers referred to visits to members' constituencies to look at things, presumably. Could I say to Mr. Speaker, what guidance can you give me? We have now seen targeted ministerial visits in this long campaign that are obviously purely political visits to prop up marginal seat candidates. Now, I don't mind, Mr. Speaker, as I said in my last point of order, if this is a political visit, it's paid for by central office, Conservative central office or whatever. What I do object to is people coming into constituencies like mine or nearby, because we've marginal seats in West Yorkshire, but the taxpayer paying for a political visit. Yeah. Could he guide me on who I complain to?
The short answer to the honourable gentleman, whom I thank for his point of order, is that if he thinks that there has been an abuse of public funds, it is open to the honourable gentleman to raise that matter with the National Audit Office. However, the question of where ministers visit is not, and very properly not, a matter for the Chair. The only point I would make is that ministers must visit the chamber in order to answer questions. That is a matter of course, and ministers must visit the chamber at the instruction of the Speaker to answer urgent questions, something that happens rather more now than in the past. Beyond that, the day-to-day activities of ministers and where or when or for how long or in whose interests they perambulate around the country is thankfully not a matter for me. Well, I do want to come to the 10-minute rule motion, but very... No. Unlike some people who are tolerant of the sound of their own voices, but spectacularly disinterested in those of others, I will hear the honourable gentleman. And if there are a few members who don't like it, well, they'll have to lump it. Mr. Barry Sherman.
Mr. Speaker, I don't want to make myself unpopular with anyone, but where I want guidance, it's the similar point of order I made 2 weeks ago, and that is ministers coming to constituencies, not telling the constituency MP, telling the government MPs, but not the opposition MPs. That's breaking a convention that this House has honoured for a very long time.
On that point, the position has been clear. It is a convention, it's not a rule. The convention should be honoured. And what I've said many times, as the honourable gentleman knows, in response to protests from members on either side of the House, is that the spirit of the convention should be observed. What that means is a member should give decent advance notice to the person whose constituency he or she is intending to visit of the fact of that prospective visit. It's pretty clear, but it oughtn't really to be necessary for it to be constantly aired on the floor of the chamber. I think people outside this place attending to our proceedings, who are often very critical of the way in which we conduct ourselves, would expect that grown-ups could treat each other with courtesy and respect in this matter, and indeed, perhaps, in a good many others. Point of order, Mr. David Winnick.
Mr. Speaker, supporting my honourable friend, can I just, however, make the point that the more ministers visit my constituency, the more my support grows. So I'm making no complaint.
I note what the honourable gentleman says, and I repeat the point I've often made. The honourable gentleman has served without interruption in the House since 1979, so it's coming up to 36 years in the House without a break, and before that he served for 4 years in a different constituency from 1966 to 1970. So the honourable gentleman is now a celebrated denizen of this House, and he must be doing something right. We'll leave it there. Point of order is over, and I think we now come to the 10-minute rule motion. Sir John Randall.
Thank you, Mr. Speaker. Mr. Speaker, I beg to move that leave be given to bring in a bill to set biodiversity targets for 2040, to establish a natural capital committee, to require local authorities to maintain local ecological network strategies, to identify species threatened with extinction, to make provision for access to high-quality natural green space, and to include education about the natural environment in the curriculum for maintained schools. Mr. Speaker, the idea of our green and pleasant land is more a part of the great British identity than for any other country I know, more than the rainforests of Borneo or the rolling savannah of the Serengeti. In recognition of the importance of our environment, this House has pioneered laws that have changed the world by protecting nature. Even as the bombs of the Second World War were falling, MPs from all parties were debating how recovery would depend on protecting and restoring our natural landscapes. Looking back in Hansard, I found that honourable members were urging the government, especially in view of the new National Health Crusade, to take action for the countryside and its amenities, including the reservation of areas of national interest against disorderly development and spoliation, and the improvement of their accessibility to the public. So even a century ago, people knew that our countryside was vital for people's health and well-being. It was with cross-party support that visionary MPs introduced the National Parks and Access to the Countryside Act in 1949, which protect our national parks and areas of outstanding beauty. Since then, this House has legislated to protect thousands of species in the Wildlife and Countryside Act. It legislated for countryside access for everyone in the Countryside and Rights of Way Act, and it was the first in the world to create binding national targets to beat climate change. And I'd like to congratulate the Prime Minister, the Deputy Prime Minister and the Leader of Her Majesty's loyal opposition for reaffirming those vital commitments last week. That announcement was reported and commended around the world. Today I'm proposing a Nature and Wellbeing Act to take us further. Mr. Speaker, we are the generation of David Attenborough and of Springwatch. We're also the Danny Boyle generation, probably the only people in the world to understand why the Olympic opening ceremony started off with a flock of sheep and some farmyard geese. We all understand that nature is a part of our lives and a part of our identity. But we're also the generation that could preside over a terrible loss. We know that 60% of our native species are in long-term decline. More and more of our countryside and wildlife is disappearing. Unless we do something about it, many of the next generation will never see a house sparrow in London. They will never hear the song of a turtle dove or a cuckoo, or smile at a hedgehog snuffling along their garden path. And ultimately, nature's loss is our loss too. No government can really meet its social and economic objectives if it does so at the expense of nature. It's impossible to create a sustainable economy while we continue to take more from our natural world than we put back. Perhaps the most obvious example is our fisheries. Restoring our fish stocks to the levels of 50 years ago could bring in £1.4 billion a year and revitalise our seaside economy. You only have to ask the fishermen whose lines come up empty because the sea has been trawled to ruin. Think of the bees. The Secretary of State for the Environment has rightly recognised the importance of nature's pollinators for our farming sector, the biggest manufacturing sector in Britain. I understand she's even got bees on the roof of DEFRA. And we will never have a really fair society with a decent standard of living while environmental inequality remains. It's the poorest and the most vulnerable people who live along the most polluted streets, with no access to any sort of green space. It's a travesty that people still die years earlier in some places than others, because the air they breathe is dirtier and they have no safe green places to walk or to exercise. Natural England has estimated that we could save £2.1 billion for the NHS every year if everyone had decent access to nature. So we all want nature because, quite frankly, Mr. Speaker, it's brilliant. But we also need nature for our livelihoods. The first thing to do, however, is to admit there is a problem and then make a commitment to change. Now, I know that targets may not be in vogue in this House. There are people who do not always agree with them. But people outside this place do understand what they mean. And I want to tell people that we will be the first generation ever to turn round nature's decline. I want us to make that promise and set targets for wildlife sites and species with regular reporting to Parliament. In the next 25 years, we should make sure that British biodiversity is richer than today, measured by an index of wildlife. We should make sure that our most precious landscapes, places like the North Norfolk coast, which I was lucky enough to visit last week, are in better condition than they are today. But of course, we all know that targets are pointless unless they help to change the way we behave. That's why I'm also proposing new ways to put nature in the heart of decision-making. This government created the Natural Capital Committee. The previous government conducted the National Ecosystem Assessment. This amazing work has begun to show how crucial our natural world is for our businesses and our communities. But we routinely ignore our need for nature in the way we make decisions. As the Environmental Audit Committee recommended, I want to set the Natural Capital Committee on a legislative footing, with new independence and new powers to report on progress. Its duty will be to make sure that when we make new law, the importance of nature is taken into account. But it's not enough to create newfangled accounting mechanisms without changing what's actually happening in our countryside and our towns and our cities. One inspiring example is Wallaston Island. There, Crossrail has recycled 4.5 million tonnes of earth from its works to build a new island. I hope it will be home to some amazing birds, perhaps like the spoonbill. There are already thousands of ducks and geese enjoying the site. But it's also expected to save £650,000 in flood defences, create new jobs and protect jobs supported by the fisheries and dockside businesses in the area. And we're also going to need a lot of new homes over the next few years. So let's make sure we do that in a way that works for nature. The best businesses are already thinking about it. Barratt Developments has just teamed up with the RSPB to build 2,500 homes in Aylesbury. The development will build in 50% green space, and RSPB scientists will monitor the site over the next 20 years to make sure that we end up with more wildlife than we started with. It's good for nature, it's good for people who live there, and it's good for business. Yeah. But that can't be the exception. We need to make sure that we reward the businesses that look after nature and that we set the right standards to help give people what they need. Which is why I'm also proposing new ways to plan for nature at the local level. Sir John Lawton showed how important nature networks are for linking up big green spaces. And the Wildlife Trust have shown how mapping those spaces in local plans can help to speed up planning decisions and improve important services like natural flood defences. Mr. Speaker, our children today are more cooped up than ever before. The average distance that children play around their homes is a fraction of what it was a generation ago. We should set basic standards for access to green space to make sure that everyone has a chance to enjoy nature. Now, of course, it doesn't mean every house can have Richmond Park down the road, but it does mean that when planning decisions are made, we consider how nature can improve people's health, mental health and education. In built-up areas, it might mean planning for a new road bridge or planting wildflowers to bring a patch of grass to life. I'm not alone in calling for a Nature Act. Over 20 organisations have joined a campaign for a Nature and Wellbeing Act, including groups like the RSPB, the Wildlife Trust, the Green Alliance and the Ramblers, alongside health and mental health charities. They recognise that even in tough times, and perhaps especially in tough times, people need nature and nature needs us. Mr. Speaker, in conclusion, I would remind the House that there are always great challenges for society to face. Today, we're recovering from an economic challenge. We're planning to meet huge challenges for our NHS, and we're looking for ways to build enough homes. But let's follow the example of those MPs a century ago who knew, even in wartime, that to face our biggest challenges, we need to look after our natural world. Let's be the first generation to make a commitment in law to turn round nature's decline, for its own sake, for our economy, for our communities and for our children. Not only because it's special, we here in this house can just look at the peregrines that nest on top of Victoria Tower. I can see them from my office window. Not only do we need nature for our economy and for our health care, but also because it's a part of who we are. This will be for the next Parliament, and I will be watching you all. I commend this bill to the House.
Order. The question is that the Right Honourable Member have leave to bring in the bill. As many as are that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
The Speaker, Nic Dubois, Michael Fabricant, Richard Harrington, Rebecca Harris, Dr Julian Huppert, Simon Kirby, John MacDonald, Dr Matthew Offord, Miss Chloe Smith, Henry Smith, Mr Mark Spencer, and myself.
Sir John Randall.
Nature Bill.
Second reading what day?
Friday, March the 6th, Mr Speaker.
Friday, March the 6th. Thank you. Order. We come now to the Pension Schemes Bill, programme number 2. Motion to be moved formally. Thank you. The question is, as on the order paper, as many as are that opinion say aye. Aye. As the contrary, no. I think the ayes have it. The ayes have it. Order. The clerk will now proceed to read the orders of the day.
Pension Schemes Bill, consideration of Lord's amendments.
No? Thank you. We begin with Lord's Amendment number 1, with which it will be convenient to take Lord's Amendments numbers 2 to 9, 44, 49, 56 to 65, and number 117. To move to agree with Lord's Amendment number 1, I call the Minister, Minister Steve Webb.
Thank you very much, Mr Speaker, and I beg to move that this House agrees with the Lords on Amendment number 1. We have two groups of amendments resulting from their Lordships' consideration of the Pension Schemes Bill. I believe that the bill is in a better place as a result of those amendments. Many of them are the government's own amendments designed to tidy things up or deal with errors, and some of them reflect their desire of their Lordships for the affirmative procedure to be used in certain statutory instruments. These amendments are largely of a technical nature, but obviously I'm happy to deal with them in more detail if the House should wish. Beginning then with the Defined Ambition and Collectives amendments, numbers 1 to 9, 49, 59 to 65. The bill, as the House will recall, contains key reforms to private pensions, encouraging and enabling defined ambition or shared risk pension schemes and collective benefits. The following amendments seek to refine or build on this legislation since it left the Commons. Amendments 1, 2, 3 and 6 are minor changes to ensure drafting consistency. Clause 27 of the bill makes provision for regulations to require a scheme providing collective benefits to wind up the whole or part of the scheme. Clause 37 of the bill makes provision for regulations to impose a duty on managers of non-trust-based schemes to act in the best interests of the members when taking certain decisions. Both provisions make reference to different types of obligations that may apply in relation to the scheme, including those that are part of the scheme, that is, provisions of the scheme, and those contained in legislation that applies to the scheme. These amendments ensure descriptive consistency across the provisions in relation to those two different types of obligations. Amendments 4 and 5 provide clarification about, quotes, publication of documents, end quotes, provisions. Powers in Part 2 of the bill may require trustees or managers of schemes providing collective benefits to have policies in relation to a number of matters, including the factors used to calculate member benefits, the calculation of transfer values, and steps to deal with a deficit or surplus in relation to the target. Clause 32 makes provision allowing regulations made under Part 2, which requires trustees or managers to prepare or obtain any document, to include requirements about the publication of those documents and the sending of copies to a specified person. A specified person could include members and regulators. Publication of various policies is a key feature of the regime we are seeking to put into place to ensure that it is clear how members' assets and benefits will be managed or calculated by the scheme. It ensures transparency about how collective benefit assets are treated in certain circumstances, because less direct relationship than in a money purchase benefit about the member entitlement in relation to contributions. We also have regulation-making powers to make certain requirements in relation to the policy. But amendment was required to put it beyond doubt that the provisions of Clause 32 also apply to the policies specifically. It ensures that there is no possibility of a scheme having a policy which we cannot require to be published or sent to a specified person. Moving to Amendment 7, this puts the meaning of the amendment made by Clause 45 beyond doubt. Change to Section 67A of the Pensions Act in Clause 45 of the Bill makes any modification to an occupational pension scheme that would replace a member's accrued rights with a right to collective benefit a protected modification. Protected modifications can only be made if the member consents. Amendment 7 makes it clear that the provision only applies where the existing accrued right is not a right to a collective benefit. Moving on to Amendments 8, 9, 59 and 60, these address an omission in the current legislation. In the course of checking through the changes made as a result of this bill, omissions in the Pensions Act 2014 came to light. The amendments needed all relate to overriding legislation. Where legislation overrides conflicting provision in the scheme rules, there are circumstances where that legislation needs to be treated as if it were part of the scheme rules. These amendments ensure that overriding requirements made under regulations under Schedule 17 and 18 to the Pensions Act 2014 will be treated as part of the scheme rules for the purposes of the Pensions Act 2004, brackets Amendments 64 and 65, and subsisting rights provisions in the 1995 Act, brackets Amendments 8 and 9. Amendments thereby provide for consistency and clarity in the way in which the overriding provisions are dealt with. Moving on to Amendment 49, this changes the parliamentary procedure that applies to certain regulations under Part 2 of the Bill. Part 2 defines the concept of collective benefits and makes provision for regulation-making powers in relation to them. Regulations made under subsection 8.3b and clauses 9 to 11 and 21 of the Bill determine important aspects of the arrangements for collective benefits. These powers cover matters such as the exclusion of benefits from the definition of collective benefits, the setting of targets in relation to benefits, the factors to be used in the determination of benefits, and the policy for dealing with a deficit and surplus in relation to that target. The effect of Amendment 49 before us today, Mr Speaker, is that the regulation-making powers in 8.3b and clauses 9 to 11 and 21 of the Bill will be subject to the affirmative procedure the first time that they are used and will be subject to the negative procedure for subsequent uses. This amendment relates to recommendations made by the Delegated Powers and Regulatory Reform Committee about the powers on how collective benefits are defined and how schemes which provide these benefits will operate. And finally, in this group, Mr Speaker, Amendment 61 makes a minor correction, replacing a stray reference to hybrid schemes that was missed when the bill was introduced, while Amendments 62 to 65 amend the amendments to Section 99 of the Pensions Act 2008. Section 99 lists definitions used. Currently, two separate provisions in paragraph 50 of Schedule 2 relate to the definition of defined benefit scheme. One adds a new definition drawn from Part 1 of this bill. The other is intended to remove the existing definition. So Lord's Amendments 62, 64 and 65 replace two provisions with a single provision that substitutes the old definition with the new one. Lord's Amendment 63 also adds a definition of collective benefit to Section 99. I'll just briefly deal with the remaining amendments in the group. Amendments 44 and 56 relate to public service pension schemes. New information has suggested that the pension schemes for the Secret Intelligence Service and the Security Service were misclassified when the Public Service Pensions Act 2013 was originally drafted. When the Act was drafted, it was thought that agency schemes were, quote, public body schemes, which must close and reform by 2018. The agencies have since been working to reform by April 2016. But we now believe that the agencies may be existing schemes as defined in the Act. This would mean that they have to close and put in place a new scheme by the 1st of April 2015, like the other main schemes, such as for teachers. At this late stage, it is not possible to put a new scheme in place by 2015. So without the amendment, the agency staff could be left without lawful pension provision after 2015. So Amendment 44 introduces a new clause after Clause 77, prevents this by ensuring that the agency schemes are not included as existing schemes in the Act. It ensures reform of the agency schemes can proceed to the expected timetable of 2016, whilst Amendment 56 to Clause 84 enables the new clause to come into force on royal assent. Amendments 57 and 58 provide general amendments to Part 6 of the Bill, to include reference to the Bill in the definition of pensions legislation in the Pensions Act 2004, and they come into force on the 6th of April 2015. Amendment 117 relates to pension schemes for fee-paid judges. This amendment is required to fulfil the recommendation of the Delegated Powers and Regulatory Reform Committee's report proposal that regulations made under the new Section 18A of the Judicial Pensions and Retirements Act 1993 should be subject to the affirmative resolution procedure. Mr. Speaker, as I say, these amendments are welcome and, as far as I can see, largely technical, and I commend them to the House.
Order. The question is that this House agrees with the Lords in their amendment number 1. Mr. Greg McClymont.
Thank you, Mr. Speaker. I thank the Minister for his explanation of amendment number 1 and those with which it is grouped. Mr. Speaker, let me make a number of points. We know, of course, that this bill has really two parts to it. We will come to the second part regarding the way it interacts with the pension budget flexibilities announced in last year's budget in a moment. I would like to put on record my thanks to the other place, and particularly those from the opposition front bench who have done such a sterling job in examining what is often a rather technical bill. And alongside the front bench in the other place on the opposition side, I'd like to put on record in particular my appreciation for the work done by Baronesses Drake and Hollis, who have done so much to really make this a better piece of legislation. Let me take the Minister up on a couple of things, particularly around Clause 8. The Minister referred in his explanation to Clause 8 and the delegated powers which are contained therein. The Minister will be aware that the debates in the other place focused for some time, in fact, on the implications of Clause 8, because, of course, it is a key and critical provision setting the definition for what are collective benefits on which the rest of the clauses in Part 2 and many of the associated delegated powers depend. That is why it is so critical in its construct and its definition of the delegated powers associated with it. In the other place, Baroness Drake, for example, made clear that in the view of the good Baroness, the power to set regulations under Clause 8.3b should be subject to the affirmative procedure, because the definition of what is or is not a collective benefit makes it so critical to the whole scope of Part 2, which deals with collective benefits. Clause 8.3b would allow the government to use regulation to avoid schemes being subject to the expense of meeting the detailed requirements set out in clauses 9 to 35 if they are deemed not to be proper collective benefits. But the clause in granting the government power to significantly alter by regulation the constituent benefits that are not included in the definition of collective benefits has the ability, therefore, to potentially remove members of schemes out of the protection of the requirements in the other clauses in Part 2. The Minister will know, of course, that this could have considerable implication for members and the scope of the whole of Part 2. The potential of this regulation to remove members from the protections they may already have by being in a designated collective benefit scheme, which subsequently a change of regulation deems they are no longer in, makes it, in our view, compelling that this remains a power that should be subject to the affirmative procedure. Now, the government's reply to this scrutiny from the opposition in the other place was to say, well, there will be the affirmative procedure used in first use, but subsequently not. But surely this is worth considering, and I'll be interested to hear the Minister's response. I say that the government in the other place gave a detailed response to this critique, and it really revolved around, as anyone who reads the debates will see, the fact that actually the first use will be by affirmative procedure. But if the affirmative procedure is used in the first instance in something quite straightforward, such as that an obvious with profits policy arrangement is not to be included in collective benefits, But the subsequent use of the regulation under the negative procedure went to the heart, to something much more fundamental, such as, for example, an existing collective benefit scheme. Then we must be aware of the possibility that regulations could be used to weaken the protections that scheme members have. Now, in response to this specific point, Lord Bourne in the other place said the negative procedure will still provide a measure of protection, but we know that's not the level of protection that would be provided by the affirmative procedure. Now, of course, this is indeed rather technical, but it does bear upon a very, very important aspect, which is that moving towards a negative position rather than a positive position through an affirmative vote could be a way in which the protections are weakened, I'm sure, against the Minister's inclinations and desires. So I'd appreciate the Minister's observations on that part of the debate in the other place. More widely, Mr. Speaker, much of the debate in the other place on this part of the bill focused on clauses relating to the duties of fiduciaries or managers of the schemes. And the Minister and I have had this debate a number of times before, but when one goes through all the regulatory complication of setting up the independent governance committees, giving them fiduciary responsibilities to monitor the behaviour of private pension providers while exempting the private providers themselves, this just seems an unnecessary complication. Pensions are complex enough without making it that much more complex. Surely the responsibility should be put directly on the decision makers in the pensions industries by applying a fiduciary obligation not to them themselves but to trustees to do the job of governance throughout. The Minister will be aware that John Kay, Professor Kay, reporting for the Government, and particularly for the yellow-tinged part of the Government, Mr. Speaker, something which the Pensions Minister will no doubt be aware of, was very clear that everyone managing someone else's money or advising investment should be subject to fiduciary standards of care. I've argued a number of times now, Mr. Speaker, if it's exhausting to me, it must be exhausting to those listening, for extending a clear fiduciary duty to those of discretion over the management of other people's money. The Australians, of course, have this principle at the heart of their system, and while their system is not perfect, I think that aspect makes it clear unequivocally that conflicts of interest must be resolved in the favour of beneficiaries. I'll say finally on this point, Mr. Speaker, because I'm not expecting the Minister to dramatically change course at this stage, that the FCA, in my opinion, in the recent investigations into the pensions industry, have actually provided substantial arguments in favour of the proposition that myself and others have been advancing. We've had numerous reports now, Mr. Speaker, on how the market is not serving pension scheme savers well, be it legacy schemes, annuities, lack of transparency and charges, and many others examples. Of course.
I'm very grateful, and as he says, we've discussed these issues before. Could he clarify which of the amendments he's referring to enable me to respond helpfully to him?
I was, of course, the Minister will be aware, referring to Clause 8, which the Minister referred to, and more widely to this part of the bill as it pertains to governance. I'm sure the Minister, although he may be weary of the debate we have had on these issues, will be keen to set forth his current thinking on this aspect of the bill. And the Minister is aware that this issue is central to his ambitions for collective defined contribution. If it wasn't, he would not have set out the bill in the fashion he has. So I put in record again, Mr. Speaker, my thanks to the other place, in particular the front bench on the opposition side, and the good Baronesses Drake and Hollis, and the constructive spirit in which the Government and the other place has approached this bill. And I look forward to the Minister's observations on the issues around delegated powers and, more widely, the governance of the pension schemes, which the Minister is right to want to make permissible under this bill.
Minister Webb.
Mr. Speaker, just to respond briefly to the issues raised by the honourable gentleman, I'm grateful to him for his comments and would echo certainly my thanks to our noble friends in another place who brought forward the bill on our behalf. And I indeed share his respect for his colleagues, Baroness Drake and Baroness Hollis, for their knowledge and contribution to these debates. As he says, the issue of the use of regulations and whether the affirmative or negative procedure is used under the regulations under Clause 8 was debated at length. As he says, his noble friend Baroness Drake wanted it always to be affirmative. The government originally planned that it would always be negative, and the government responded to the views of the DPRRC by agreeing that on the first use these powers would be affirmative. Obviously, one can always say everything should always be affirmative and there's a balance to be struck here. Clearly, although the committee wanted that, the government doesn't consider this to be appropriate because we do sometimes need the flexibility to act quickly if schemes are being inappropriately caught by the collective benefits definition. And there's always a trade-off here that in the world of pensions sometimes things happen that you hadn't expected, people are in the wrong place, their rights might be at risk or inappropriately protected, and the ability of the government to move quickly rather than the rather lengthy parliamentary process of the affirmative procedure is sometimes needed. But we do accept that Clause 8 is a key provision, and therefore I can put on record that it is not our intention for members who are in schemes providing collective benefits and subject to the provisions suddenly to lose the important protection that regulations made under Part 2 of the Bill will provide. If the situation were to arise that protections would be taken away, we would want to understand that and make sure it was appropriate and necessary before taking action and laying regulations. As he said himself, even with the negative procedure, if there was a particular concern, there was a scope for praying against those regulations and for there to be a debate. In my experience, most of which has been from the opposition benches, during the passage of primary legislation, the opposition are always desperate for everything to be affirmative and the government wants nothing. But then when you actually get to these statutory instruments, many of these affirmative statutory instruments that he and I have done over the last however many years it's been, have been over in 10 minutes. So we get very exercised about the need for affirmative scrutiny, and then later in the process, when we get to affirmative scrutiny, it tends to be occasionally bordering on the desultory. So I hope that we're striking the right balance here, recognising that these are important matters, providing affirmative protections on the first use, and obviously further parliamentary scrutiny on any subsequent use through the normal processes. He raised much wider issues, which I'm not sure it's appropriate for me to go into in great detail. I do recognise that he wants to strengthen the fiduciary duties of those overseeing pension schemes. Clearly, this is a debate we'll continue to have. I believe that the new independent governance committees will mark a big step forward from where we've been in the past, will provide scrutiny. It's quite clear to me, I've talked to most of the major insurance companies in the last few weeks, that are setting up their IGCs now. It's quite clear that these will be organisations with serious people at the head of them, with teeth, who will be listened to. But obviously we will continue to keep that under review. And with that, Mr Speaker, I commend Amendment 1 to the House.
Grateful to the Minister. The question is that this House agrees with the Lords in their Amendment number 1. As many as I have that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order. With the leave of the House, I will put the questions on Lords' Amendments numbers 2 to 9 together. The Minister to move formally to agree? Thank you. The question is that this House agrees with the Lords in their Amendments numbers 2 to 9. As many as I have that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. We come now to the second group of amendments. The next amendment to be taken is Lords' Amendment number 10, with which it will be convenient for us to consider Lords' Amendments numbers 11 to 43, 45 to 48, 50 to 55, and 66 to 116. To move to agree with Lords' Amendment number 10, I call the Minister, Steve Webb.
Thank you, Mr Speaker. We move now to the second group of amendments, and I beg to move that the House agrees with the Lords in Amendment number 10. This group of amendments relates primarily to the new pensions freedoms announced by the Chancellor in the budget last year and coming into effect in general on the 6th of April this year. Beginning first with the pension guidance, now known as Pension Wise, pension guidance and guarantee. This is Amendments 10 and 66 to 72. The Government intends that all those who stand to benefit directly from the new pensions flexibilities provided by the Taxation of Pensions Act 2014 should have access to guidance. The amendments to Clause 47 and Schedule 3 are technical amendments to ensure that this is indeed the case. These amendments adjust the definition of pensions guidance in new sections 333A and 137FB of the Financial Services and Markets Act, or FSMA, to extend pensions guidance to survivors of members who have flexible benefits rather than just members of pension schemes. This is needed because in some circumstances pension schemes may provide benefits to survivors of members of the scheme other than insurance-based products or cash lump sums, i.e. flexible benefits, without their becoming members of the scheme. Amendments 11 to 18 and 50 provide advice safeguards. Clauses 48 and 51 were amended in the Lords via government amendment. These contain the provisions creating the advice safeguard, which requires schemes to check that financial advice has been received before an individual exchanges their safeguarded rights for those that can be taken flexibly. Clause 48 makes provision for Great Britain, whilst Clause 51 makes corresponding provision for Northern Ireland. Amendments 11 and 15 improve the drafting of Clauses 48 and 51, whilst Amendments 12 and 16 ensure that the requirement to take advice also applies when a member takes an uncrystallised funds pensions lump sum from benefits that are safeguarded. A second group of amendments to these clauses were made at Lord's report stage in response to the recommendations of the Delegated Powers and Regulatory Reform Committee. Amendments 13 and 17 specifically provide for the only exception to the advice requirement that is intended to be in effect by April the 6th, i.e. an exception from checking that advice has been received in the case of those with safeguarded wealth of £30,000 and below. Amendment 50 provides that regulations creating this exception are subject to the negative procedure, whilst regulations creating any other type of exception are subject to the affirmative. Amendment 14 provided more detail as to the nature of the appropriate independent advice that is to be required under the safeguard. Amendment 14 provides that appropriate independent advice must be given by an authorised independent adviser and sets out that this means someone who has permission under the Financial Services and Markets Act 2000 to carry out a regulated activity specified in regulations. The FCA set the standards for regulated activities in their rules, and this will allow them to set the standards for advice provided under the advice safeguard. Amendment 18 makes corresponding provision for Northern Ireland. Moving on now to Amendments 19 to 21, 23 to 25 and 38 to 43. These are amendments to clauses 55 and 56, consequential on the Taxation of Pensions Act. It allows a person to leave any remaining money purchase funds to a nominee or a successor. Schemes will be able to offer both nominees and successors a drawdown fund, so they need to be included in the clauses which deal with such arrangements. Amendments to clauses 60 and 61 do the same thing for legislation covering Northern Ireland, whilst amendments to clauses 72, 73 and 74 make small changes to the definition of terms used in Part 4 of the Bill. Moving on now to Amendments 22, 26 and 73 to 116. These amendments are technical amendments to reflect the extension of the statutory right to transfer benefits and to ensure that the transfer process continues to operate smoothly after the requirement to take appropriate independent advice comes into force in April. Without these amendments, there is a risk that the new transfer rights would not operate as intended after the new flexibilities come into force. Schedule 4 of the Pension Scheme Bill amends the existing transfer rights provisions contained in Part 4 of the Pension Schemes Act 1993 to give scheme members a statutory right to transfer a particular categories of benefits and give scheme members with flexible benefits a statutory right to transfer these rights up to and beyond their scheme's normal retirement age. Amendments 73, 92, 94, 96 and 115 would make consequential amendments to reflect numbering changes made elsewhere in Schedule 4. Amendments 22, 82 and 83 ensure that Clause 55 and regulations under Clauses 56 and 57 override any pension scheme rules which conflict with the statutory right to transfer overriding provisions for the purposes of the definition of scheme rules. These provisions amend the Pension Schemes Act 93, the Pensions Act 95 and the Pensions Act 2004, whilst Amendments 26, 105 and 106 make corresponding provision for Northern Ireland. Amendment 75 replicates existing powers in the Pension Schemes Act 93 and will be used to preserve the effect of existing regulations under those powers, whilst Amendment 98 makes identical provisions for Northern Ireland. Amendments 76 and 78 provide powers to extend the period within which a member who has received a statement of entitlement must take the cash equivalent of their accrued rights, and for the right to take the cash equivalent to lapse. Amendment 80 provides a power to extend the time in which the trustees of a scheme must do what the member requires. Amendments 88 and 89 make similar provision to extend time for pension credit members and for trustees to act on members' instructions, whilst Amendments 99, 101, 103, 111 and 112 make similar amendments to the corresponding Northern Ireland legislation. Amendments 79 and 102 make changes to section 98(1) of the 1993 Act and clarify that a member's right to take a cash equivalent falls away where the trustee's duty to carry out the member's wishes is extinguished because they have been unable to confirm that the member has taken appropriate independent advice. Amendments 81, 86, 93 and 95 ensure that the definitions of scheme rules in the Pension Schemes Act 93 and the Pensions Act 2004 work for personal pension schemes. Amendments 82, 83 and 105 ensure that the definitions of scheme rules in the 93 and 04 Acts also apply for personal pensions, whilst taking account of any provisions that override these rules. Amendments 104, 109 and 116 do the same for Northern Ireland. Amendment 87 inserts a power to disapply the right of a pension credit member to transfer their pension credit rights in relation to prescribed descriptions of persons, and again Amendment 110 makes a similar amendment to Northern Ireland. The remaining amendments in this group make a number of drafting, technical and consequential amendments to Schedule 4 of the Bill. Amendments 27 to 37 relate to public service scheme transfers. These are technical changes to improve drafting, and they ensure that the new safeguard applies where it should. Whilst the remaining amendments 45 to 47, 48, 51 to 55 are general amendments to Part 6 of the Bill, often known as the back of the Bill provisions. Amendments to clauses 80 and 81 would extend the provisions to Northern Ireland, whilst the amendment to clause 84 would ensure that pension flexibility's provisions come into force at royal assent. I hope that's helpful to the House, Mr Speaker, and I commend these amendments to the House.
Indeed. The question is that this House agrees with the Lords in their amendment number 10. Mr Greg McClymont.
Thank you, Mr Speaker. The Minister raced through his text there, I'm sure much to the chagrin of the whole House, because we were enjoying it so much. Let me pick up a couple of issues with the Minister. Mr Speaker, we come to the part of the Bill which has created some complexities, I think it's fair to say, because it, if one wants to put it politely, dovetails with the Treasury Pensions Bill, which has been proceeding apace and indeed has finished its passage through the Commons. If we were being less kind, we would say creates some tensions in examining this bill, because one, of course, can't side by side scrutinise the Treasury Bill. Putting that point in the record and something which has been discussed before, let me focus in two areas. Firstly, Lord's Amendments 13, 14, 17, 18 and 50, which refer, of course, to the much discussed guidance which those eligible to access their pension pots from April will be offered. The Minister referred to government amendments being put down in the other place, and of course those amendments I refer to are welcome. They're welcome both because it's necessary to have what has become known as a second line of defence, and welcome because they show the government listening, Mr Speaker, to the opposition in this place, the opposition benches in the other place, and also to the campaign really led by interested pensions organisations outside of the House. Why is it so important to have that second line of defence? Well, the Minister, of course, referred to the government amendments. The government accept this fact, but it's simply because it's one thing to offer guidance online from .gov.uk, in person from Citizens Advice Bureau, and telephone through the Pensions Advisory Service. But actually, what happens at the point where an individual comes to discuss buying a product from a provider? That is something which much of the debate around this bill and other pensions bills in this Parliament has revolved, simply because we know through the FCA studies, which I mentioned, and more widely from a variety of sources, that often those decisions end up being much more in the interest of those selling the product than in those buying the product. And it really is welcome that the government has recognised that it's important that when an individual comes to consider buying a product, that the provider must check that they have the appropriate guidance, either from the services mentioned previously or from some other source. So it's very welcome that the government has accepted the argument of the opposition and others in putting in place this second line of defence and what the Minister calls the advice safeguard, which is the second line of defence. But that does, when we think about the second line of defence, Mr Speaker, bring us to one of the issues which is part of the Treasury Pensions Bill as well as this one, which is how do we ensure that individuals actually are equipped to make what at times are pretty complex financial decisions about what to do with their retirement income. Of course, much of the legislation pertaining to this important aspect lies in the Treasury Bill, and it's one level is out with the bounds of what we're discussing today. But it's important to put on record that significant questions remain about how the guidance guarantee will work from April. That's been heard repeatedly from those in the pensions world, and that's something I'm sure the Minister, if he's not having sleepless nights about, is indeed paying close attention to. Mr Speaker, let me move on to something which was the subject of much discussion in the other place, and something which pertains to the guidance amendments, but more widely to the Treasury Bill, which of course goes hand in hand with this piece of legislation. And this is the impact of the new flexibilities from April on eligibility for means-tested benefits. The noble Baroness, my honourable friend, the Baroness Hollis, in the other place, really put down a series of, I think, very important questions to the Minister and to the Government around actually how will this new system of pension flexibilities work in harness with existing eligibility for benefits and really more widely DWP benefit rules. And I have to say, it's not that reassuring to hear from the Minister in the other place, the Government in the other place, that all will be revealed before April. As things stand, there is still no clarity about how the new flexibilities will interact with DWP benefit rules. And that's something I think which the whole House will be concerned about. Let me give just 3 examples. The first is income. Let's say at 56 you have a modest wage of £20,000. You rent privately and get housing benefit as you have minimal savings. You have a small pension pot of £25,000, and after April you take £15,000 of that pension pot to pay off debt or buy a new car. Up to 25% of that pot, Mr Speaker, some £6,000, is obviously tax-free under pension rules, but will count as income against your means-tested benefits under DWP rules. Above that £6,000, you will pay income tax as well as lose benefit on the rest of the £15,000. Surely it's essential that anyone in means-tested benefits at the age of 56 knows what the impact will be for accessing their pension pot in line with the new flexibilities after April. I suspect that most people are simply not aware of this interaction. There will need to be something done, I think, rapidly by the Government to ensure that that kind of interaction and detriment is understood. Now, that's quite a simple example, Mr Speaker, but what about capital? What happens if instead of accessing your pension pot to count as income, it simply sits there as capital, fully accessible when you need it but not yet taken, like, as the Baroness Hollis pointed out in the other place, an untouched ISA? Up until now, inaccessible pension pots can't be accessed under current rules have been ignored quite sensibly. They do not count against the DWP's capital savings rules, whereas other accessible income and savings such as ISAs do so. That is another issue which the Government, in the debate in the other place, said, well, we will be coming up with information and clarification shortly on this matter. But it is already nearly the end of February and the rules come into place in April. I mean, I don't think it's unfair, Mr Speaker, to suggest that the government is really running up against time here if individuals are really to understand the potential impact on their eligibility for benefits if they access their pension pots. Let us say, for example, Mr Speaker, that you're earning £25,000 a year with £25,000 in ISAs and £25,000 in your pension pot. You've injured your back and need to stop work and would want means-tested benefits, but your £25,000 of ISAs savings debar you. What do? It's a no-brainer, as the Baroness Hollis observed. You cycle your ISAs into pension pot and shelter them. When next year you retire at 56, you will get full means-tested benefits and potentially the same access to your savings that you had when half of them were ISAs. Great for that individual, but for the rest of us it means bigger benefit bills to be footed by the taxpayers. Again, a question which I have to say in the other place, the government did not provide a compelling answer. Thirdly and finally, social care. Social care, as the House is aware, is means-tested. At normal retirement, your pension pot, even if you've not touched it, is treated as though it was giving you a notional annuity income. This notional income is included when assessing what you pay for social care. Pension pots are not sheltered. OK, but if you're 55 and built up a modest pension pot at work and now have broken your back and need social care, even though your pension pot is fully accessible, as if you were 65, your pension is not taken into account for social care means testing. Get injured at 55 and you pay little or nothing for your social care. Live a little longer, as we hope, and your pension is taken into account and your social care bills soar. How is this fair? The Baroness Hollis suggested it is age discrimination. How can we expect people to understand what appear such contrary rules? Now, the government might have compelling responses to these case studies, hypothetical case studies. So far, the government has not provided any, never mind compelling evidence, any enlightenment as to how the pension flexibilities contained in the budget will interact with eligibility for DWP benefits. In the other place, the government said we will, and let me find precisely what the good Lord said, that actually the government intends to come forward soon with explanations of how the budget reforms will interact with DWP rules. But time is, of course, marching on, as I've noted before. We are very close now to the budget flexibilities going live, and I think it's incumbent upon the government to let us all know, inside this House, but also more importantly, outside, actually how the reforms interact with DWP benefit rules. Madam Deputy Speaker, the issues contained in the second part of this bill and the amendments pertaining to that part of the bill is laid down, in which the Minister has spoken, are necessarily related to the other bill, the Pensions Treasury Bill. The Minister won't be able to provide all the answers. One of the problems actually has been that often questions which one is compelled to direct at the Pensions Minister are actually questions which would be as well directed at the Treasury Ministers. That is something which has emerged in the course of these two parallel bills. But I'm sure the Minister does agree both that actually the interaction with DWP benefit rules is going to be absolutely crucial, and unless the government very rapidly explains what the situation will be, then it's very possible that significant numbers of individuals will undergo detriment, and more widely that the second line of defence, which the government has accepted, is something which all sides of the House will welcome, and something which the great work of opposition members in the other place, and indeed on both sides of the House, should be acclaimed. So on that note of consensus, Madam Deputy Speaker, I rest my case.
Minister Stephen.
Madam Deputy Speaker, thank you. I hope I can respond helpfully to the honourable gentleman on the two sets of issues that he raised, and thank him for his description of our dovetailing between DWP and HM Treasury legislation, a very attractive word, dovetailing. He raised two issues. First of all, he asked the issue about what he called the second line of defence. I think there might have been some confusion in what he said, and I apologise if the speed with which I went through my remarks put him off the scent, as it were. I assume that nothing I said would affect what he said, so that's why I went quite quickly. But just to clarify, the second line of defence, so-called, the requirement on providers to ask searching questions of people choosing to do things with their pension pot, is not in the bill at all. So the amendments I referred to advice, specifically advice as in independent financial advice, regulated advice, those are the safeguards for people who, for example, are transferring from a DB pension into DC with a view to accessing the flexibilities. The bill requires them to have taken independent financial advice, and these amendments help to specify exactly what that is. So I hope there's no confusion there on the gentleman's part. These amendments relate to the advice safeguard, which is about things like DB to DC transfers. But he is right that the issue of a so-called second line of defence is an important one. The government has listened. We anticipate that the FCA will be bringing forward its detailed regulations, or rules rather, I should say, rules on how that should work in practice, and we will be working with the trust-based pension sector to do the same through the pensions regulator. And I agree with him that those who've raised these important issues, both within and beyond the House, deserve credit for doing so. And I'm grateful to him for the credit he gave to the government for listening to those concerns. The second set of issues he raised were those raised by Baroness Hollis in another place about the interaction with means-tested benefits. He will know, I hope, that my colleagues, noble lords, met with Baroness Hollis prior to third reading in the Lords, and I believe another meeting is planned to make sure that her concerns are properly addressed. But I can tell the honourable gentleman that, in a sense, it's largely business as usual, in the sense that the intention is that the principles of the current rules relating to the treatment of pension funds will remain in place after April 2015. Now, obviously, we're in a new world and we'll have to carefully consider the impact of pension flexibilities and freedoms on income-related benefits and, as he says, social care. But the government wants to ensure that someone's decision to use a flexible pension product does not have a significant effect on how their means-tested benefits or social care charges are assessed. Now, he asked one specific question, which is, if I've got some cash in an ISA and the government account that as capital, whereas if it's in a pension fund, they might not, why don't I just shove it into a pension fund? To which the answer is, if someone transfers money from an ISA to a pension pot for the sole purpose of improving their retirement provision, then it is highly... then that's fine. We don't mind people putting money into a pension to retire on, but if they have done it with the intention of increasing their benefit entitlement, then we can still take account of the money, and that mirrors existing provisions. In other words, currently, if you've got some money in the bank, you blow it on a foreign holiday or a sports car, and then you come along and claim benefit without the capital, one of the things we'll say to you is, well, hang on, where did the money go? So we have current deprivation of capital rules, so that if someone's artificially engineered their finances to get within the scope of means-tested benefits, we can deem them to still have the money. And in the example the honourable gentleman gave, if someone takes their ISA balance and simply flips it into a pension simply so they can get more pension credit, then if that's why they've done it, we can simply come along and say, no, sorry, you've still got the cash, we're going to treat you as if you had the cash. And we think it is right to treat ISAs and pensions differently. ISAs are immediately accessible, are not long-term savings vehicles, and we do still think that distinction is an important one. But I can confirm that we will be continuing to have our conversations with the noble Baroness to ensure that we've addressed her concerns. But the spirit of what we're doing here is business as usual, is the same broad approach that we had before these reforms were introduced. So I hope, Madam Deputy Speaker, that responds to the honourable gentleman's concerns on these amendments, and I commend again Lord's Amendment 10 to the House.
The question is that the House agrees with the Lords in their amendment number 10. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. With the leave of the House, I will now put the question on the remaining Lords' amendments numbers 11 to 117 together. Minister to move. The question is that this House agrees with the Lords in their amendments numbers 11 to 117. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to the allocation of time motion for the House of Commons Commission Bill.
Madam Deputy Speaker, I beg to move very briefly the motion in my name on the order paper. This motion provides time for the House of Commons Commission Bill to be considered today. It guarantees up to 6 hours debate, with up to 4 hours for second reading and a further 2 hours for committee and remaining stages. How much of that time is actually used in considering the bill is, of course, a matter for the House, and it does not look as if such restrictions on debate will turn out to be actually necessary. But importantly, the motion also provides for us to consider all stages of the bill today, and in view of the non-contentious nature of the bill, the absence of any amendments and the other business that follows it, I am hopeful of swift progress.
Swift progress indeed. The question is, as on the order paper, as many as that opinion say aye. Aye. On the contrary, no. The ayes have it. The ayes have it.
House of Commons Commission Bill, second reading.
Call the Minister to move the second reading, Mr. William Hay.
Madam Deputy Speaker, I beg to move the bill be read a second time. And again, I hope not to detain the House for long in considering what I think is obviously a very short and what I think is a widely supported bill. The House is familiar with the background to this bill. It arises from the report of the Committee on House of Commons Governance, which itself was established following the halting of the recruitment process for a new clerk of the House in September last year. The committee's report was fully debated in the House on the 22nd of January. And as I emphasised during that debate, the chair and members of the committee did an admirable job, and I again pay tribute to the Right Honourable Member for Blackburn in particular, and indeed to all the members of the committee from all sides of the House who worked with him, because they reconciled successfully a number of different views, and they have presented the House with a coherent package that clearly, from the debate we had in January, commands the confidence of the House. Most of the committee's recommendations are for the House to take forward in other ways, and I can assure the House, as a member of the House of Commons Commission, that that is exactly what is happening. The Commission has published 3 updates so far on progress in implementing the recommendations and will continue to keep the House informed. A very small number of recommendations from the Governance Committee that relate to the Commission require legislative action, and hence the need for this bill. The House of Commons Commission is established under the House of Commons Administration Act 1978. To meet the recommendations of the Governance Committee, this bill has 3 core provisions, all of which take the form of amendments to the 1978 Act. First of all, the bill increases the number of backbench members of the Commission from 3 to 4. This will allow for a wider range of views across the House to be represented, and it will reduce the likelihood of a government inadvertently finding itself with a majority on the Commission. Second, it provides for the appointment of 2 external members and 2 officials to the Commission. The appointment of these additional members is designed to provide a wider perspective to support the Commission's work and to embed the closer integration between setting the strategic direction and the implementation of policy decisions that the committee called for. The evidence to the Governance Committee suggested that the link between the current management board, which is to become the executive committee, and the Commission needed to be strengthened, and this amendment will provide for that to happen. As a start in that direction, the existing external members of the Management Board have already been invited to attend meetings of the Commission, and they have started doing so. But, yes, I give way to my right honourable friend.
Could I just thank him very much indeed for finding the time to make this modest change. But I wonder if he's able to update the House at all as to whether it will be possible to have both the Clerk and the Director-General in place at the beginning of the new Parliament so that these provisions can take effect immediately.
Well, it certainly should be possible to have the clerk in place. The recruitment process for the clerk is well underway. The period for applications closed on the 16th of February. So last week, an interview panel has been established, and so it's very much our intention on the Commission that a new clerk of the House will be appointed before dissolution. My right honourable friend will recall that the Governance Committee recommended that the clerk should be in place and indeed in a position to be one of those determining the appointment of the Director General. So there is a sequence to this. The process of recruiting the Director General has also begun. But it will be, given that the dissolution is only 21 House of Commons days away, that will not be completed before dissolution, but it will be well advanced, and it will therefore be up to the new Commission early in the next Parliament, working, including the new clerk, to complete the appointment of the new Director General. And thirdly, Madam Deputy Speaker, the bill adds to the functions of the Commission a specific requirement to set the strategic priorities and objectives for the services provided by the House departments. It's important the Commission is given this specific responsibility in view of the number of different bodies involved in the governance of the House, and this amendment to the 1978 Act will place direct responsibility on the Commission to provide strategic leadership for the services provided by the departments of the House. It will then be for the Commission to set priorities and the House administration to respond accordingly. As a member of the Commission, and I think like all other members of the Commission, I'm very supportive of the changes proposed, which should make the governance of the House more representative, more transparent and more cohesive. And we can say more about the individual provisions when we move into committee, but I think they are straightforward and fully in line with the Governance Committee's proposals. Indeed, we have worked with the chair of the committee, the right member for Blackburn, with the opposition and with officials from across the House to ensure that the bill is consistent with the committee's report, and I'm particularly grateful for the support of the opposition front bench in taking this forward so rapidly. It is my firm expectation, Madam Deputy Speaker, that with the support of the House today, the bill can progress through both houses before dissolution so as to ensure that the new Parliament can benefit from the governance of the new Commission at the earliest possible stage. And so I commend this bill to the House.
The question is that the bill be now read a second time. Mr Thomas Docherty.
Thank you, Madam Deputy Speaker. And if I could begin perhaps with just apologies from my honourable friend, the Shadow Leader, who is out of the country today. So I suppose the task force to me for this afternoon of representing Her Majesty's opposition, we obviously, as the Leader has just said, support this bill, and we thank my right honourable friend and his committee for the work that they put in, and also the speed with which they brought forward their report, which has allowed us, ahead of schedule, to make these straightforward alterations. It's perhaps worth just touching on the role of the Commission, because for those not familiar with the Commons procedures, the Commission is not like a select committee. It doesn't have the powers of a select committee. It doesn't sit in a scrutiny function. It doesn't summon witnesses. It doesn't produce reports. That role is provided by the Finance and Services to become the Finance Committee and the Administration Committee. The Commission is a governance body, and that is, and as the Leader of the House has pointed out, Clause 2 of the bill sets out, and I'll just quote, "The Commission must from time to time set strategic priorities and objectives in connection with services provided by the House departments." And as the Governance Committee highlighted, one of the defects in recent years is, frankly, the Commission hasn't necessarily understood its own role. And that certainly wasn't understood by the wider membership of the House and beyond. So we very much welcome not just the changes that have been made, but we also welcome this new clause, which I think for the first time sets out explicitly the role of the Commission to make those strategic choices. It is fair to say, of course,
very grateful. Whilst the Honourable Gentleman's talking about the responsibilities of the Commission and how it will work, is it still envisaged that the Commissioners will be elected, and if so, by the whole House or by the individual parties?
I'm most grateful, and I'll come on to that in just a couple of moments, if I can set out one of the major challenges facing this Parliament when we return, or when our successors return, perhaps, in May, is in the next Parliament we will have to make a decision on restoration and renewal. And I want to pay tribute both the right gentleman, the member for Caithness, Sutherland and Easter Ross, and the right gentleman, the member for Saffron Walden, for their role in tackling the early stages of the thinking on restoration and renewal. Restoration and renewal is not optional. We will have to spend money. We will have to spend taxpayers' money, and the huge decision Parliament must take is what is the appropriate timetable for carrying out that works, and how do we ensure best value for taxpayers. And the Commission, Madam Deputy Speaker, will have a crucial role in providing leadership on that issue. So I think it's absolutely right that, as well as the Leader of the House has said, that we ensure that it accurately reflects the views of the House. It's also very important that it has external members who will be able to provide, in our view, strategic advice, because it is not a criticism of members of this House, but not all members of this House have business experience. Not all of them are used to grappling with some of the issues that the Commission will have to grapple with. If I can turn briefly to the point raised by the honourable gentleman, he'll understand it's not for me to speak for other parties and their processes that they operate internally. He is probably slightly more familiar than I am with how the Conservative Parliamentary Party operates. It's clear that two of the members will be drawn from the chairs of the Administration and Finance Committee. Obviously, that will be a matter for post-election arrangements. What I will say, because it was raised when we debated the governance report, we are very clear on this side. We do not believe that the commissioners who are not chairs of select committees should be paid an additional sum of money for carrying out this work. Partly because I think it is not appropriate in the current climate, and I don't think our constituents would see that as a sensible move, but also because the role of the Commission is, frankly, if you're not chairing a select committee, it should not be more onerous than being a member of the Foreign Affairs Select Committee, the European Scrutiny Committee, or indeed the Finance or Administration Committees. And I think that's absolutely important, is that we're getting people selected by their parties because they have a particular interest or knowledge, and that is the reason why they're coming forward. Finally, just on the point about the Director General, we too welcome the progress that's been made, Madam Deputy Speaker. We think the Leader of the House is right to say that it is necessary to complete that process post-election, but we don't see that as a significant obstacle to making progress with this bill itself.
Sir Oliver Heald.
Madam Deputy Speaker, can I just start, as I have already said, by thanking the Leader of the House for finding the time to bring this short bill before the House. I know it's never easy at this particular part of the parliamentary cycle, but it is important that the newly composed commission proposed by the Governance Committee can start work immediately after the general election, and this bill will enable that to happen. And so we will have a new governance regime for a new Parliament, something which those of us who served on the committee were very keen to achieve. I'm glad the proposals outlined in the report are being implemented following the debate on the 22nd of January, particularly because there was such a warm welcome in all parts of the House for the report. And I think this will help as well to clarify the role of the Commission as the place where the decisions about what happens in our part of the Parliament are made. And, our committee did find that many honourable members feel disconnected from the administration of the House, and the proposals that we've made will change that. First, on the membership, of course, the number of parliamentarians will rise, with the ex officio members added to by 4 rather than 3 backbenchers. And it's certainly my understanding that they will be elected, and maybe the Leader of the House can confirm this. but of course with party balance in mind, so that we don't end up by accident having a predominance of one party on the Commission. I think the second change is that the external members will bring experience of business practice to the Commission, which I'm sure will be very welcome, both public sector and private sector business experience. And then to have the management there, the Clerk of the House and the Director General, will mean that those who have to put the decisions into play to implement them, they'll be there as part of the decision-making process, which should tighten things up considerably. I think these improvements will maintain the important presence of the political parties and the Speaker, but also increase the influence of backbenchers because of the fact of election. The portfolios that have been suggested, assuming that that does go ahead, will ensure that not just the House committees but other important concerns are represented at the top and are fully understood there. And the presence of the Clerk and the Director General will connect up the whole system far better. So hopefully these changes will strengthen the House of Commons Commission, make it more responsive to members, closer to its administration and more in tune with best practice. We also heard evidence that the Commission could be strengthened because it sometimes lacks authority and capability to provide consistent strategic direction, and that it's less good at taking a long-term view or setting a strategic framework for the House as a whole, rather than in responding to events. I think this is important, and in a way it's a structural issue, because administration and governance of the House should have a longer-term perspective, and members, just by the nature of us, we tend to concentrate on one parliament at a time. Very wisely, I think, because, and not unnaturally, given that the electorate do the same thing. But we did hear that this can lead to essential works being put off time after time, and at some point the nettle does have to be grasped, and the upcoming Restoration and Renewal project is an example of doing just that. So the new strategic role for the Commission is a key step in providing for better long-term governance of the House. Madam Deputy Speaker, this is a short bill. It's going to be a short speech, but I just wanted finally to say that it was the first time in 40 years that members had looked at these issues. I pay tribute to the chairmanship and the committee at large, because we did work very hard on this, and certainly I'll be proud to see this bill go into law and to see our recommendations being put into effect, and so I join in commending it to the House.
Yeah. Jack Straw.
Thank you very much, Madam Deputy Speaker. I begin by expressing my gratitude to the Right Honourable Gentleman, the Leader of the Commons, for the way in which, from the very outset of the establishment of this committee, he has embraced its work. And inevitably, when a select committee dominated by backbenchers comes forward with reforming recommendations, there is a sort of inbuilt tendency, which certainly was when I was sitting in his place, to think, well, this hasn't been invented here. We ought to look at all these proposals with great scepticism. I'm sure that we can improve them. And with one area where indeed the Right Honourable Gentleman and our front bench did indeed come forward with improvements in respect of the recommendations of the report, he, along with my right honourable friend, the Shadow Deputy Leader, have simply said this was an agreed all-party report, that it appeared to make sense, and therefore he has committed himself, along with my honourable friend, to implement it. It's, I think, a sort of irony about the way issues come up in this place, that the provenance of the committee was, of course, I put it delicately, a difference of emphasis about the future official leadership of the House. And it was dominating the news at the time. Out of that came the Committee on Governance, and I'm extremely grateful to the House for deciding that I should chair that. I was extraordinarily fortunate in having on the committee 7 other members drawn from a range of parties who showed astonishing dedication and commitment to working in some cases 3 days out of the 4 we have here each week from mid-October through to December in order to achieve the outcome. Well, we got there, and I think it was to everybody's advantage that we had the report out before Christmas rather than afterwards. Of course.
To the right honourable gentleman, and I hope he will allow me to say that we got there thanks to his amazing chairmanship. It was amazing to see so sophisticated and capable an operator steer us through when we had a lot of differences of emphasis at the beginning on the committee, and I hope he doesn't mind me interrupting him to put that on the record.
Not at all, least of all today. But those of us who now are Hegel and Marx, at least a bit, which is my case, could say that genuinely the dialectical process, I don't offend, I hope I don't offend the honourable gentleman, but a real dialectical process took place in the committee where there was thesis, antithesis and synthesis from a variety of sources. I was talking to my honourable friend, the member for Walsall South, who was energetic in the committee, wasn't going to let anything go, but out of that energy, and sometimes it felt as though I had a terrier locked into my ankle from her, we got a better report. One of the things that emerged in the course of our inquiry was the opacity about the current arrangements for running this place, the lack of connection between the Commission and everything else underneath. And frankly, the fact that one absolutely key committee, the Administration Committee, chaired by the right honourable gentleman, the member for Saffron Walden, was in some kind of limbo. It didn't have executive powers. Although everybody thought it had to negotiate with others. It had a membership which was principally put there by the whips, and had it, in my view, had it not been for the fact that the right honourable gentleman, the member for Saffron Walden, 2 or 3 others, almost exclusively, had sat through the committee over the last 5 years, it couldn't have operated at all. But that was one indication of the opacity and less than optimal way in which these arrangements were operating. Others as well, the fact that the non-executive members, to give advice to the administration of the House, were actually on the management board and not on the Commission, which is a slightly eccentric way of doing these things. And many others, but we also heard very good evidence, including from he himself, from the right honourable gentleman, the member for Thurso, Wick and Easter Ross. Anyway, a large chunk of Scotland. I may just say, Madam Deputy Speaker, parenthetically, that he and I were having a conversation about the difficulty of getting to his constituency. And as we know, he is the Viscount, or these days Mr. Thurso. And he was talking about the fact he was getting an aeroplane to Inverness and then would drive. And I said, what happened if you were to go by train? He said, well, we'd get a sleeper to Inverness and another train. And I said in my naivety, which station? To which the right honourable gentleman replied, Thurso, of course. It must be reassuring to have a station named after you. Anyway, sorry? But to go back to the bill, I was going to, but the right honourable gentleman, the member for that large chunk of Scotland, has chaired the House of the Finance Committee. He's also been a member of the Commission as well, and that was a very good exemplar for us to try and build on. There are many recommendations of the committee which don't need legislation. These do need legislation, and I believe very strongly that with these changes we'll have an administration for the future parliaments which is better and more effective than it is at the moment. On the issue of the 4 backbench commissioners Should they be paid? Should they all be paid? Shouldn't they be paid? I think that's something which obviously members have got to consider and consider very rapidly in the next Parliament. I'm absolutely clear that if two of those members at least have executive responsibilities for chairing important committees, they must receive the same kind of emoluments as any other chairman, because otherwise, amongst other things, given the amount of time that's going to have to be devoted to these positions and the fact that they will be much more public, as it were, within the firmament of the Commons, you will not get people of serious calibre attracted to undertake them. And what we don't want to see is a situation where, as it were, these positions and the other two on the Commission from the backbenches are seen as somehow a consolation prize for those who've failed to become elected to the chairman of some apparently prestigious subject select committee. I think it's really, really important, and I hope that the whips, I will in 1 second, of course, will bear that in mind, not least when they come to the timetabling.
Well, gentlemen agree with me that it depends to some extent what portfolios are given to the other two as to whether one would want to see them as paid positions. But if, for example, one of those posts is to play an important role on the restoration and renewal project, or to play a very active role with visitors to the House, then it could be a very onerous position that might require that.
I accept that entirely, and as I say, I think this is something which needs to be looked at in detail as soon as the new Parliament is assembled. With that, Madam Deputy Speaker, may I commend this bill to the House?
John Thurzer.
Thank you, Madam Deputy Speaker. Can I begin by saying this bill proves that great things come in small packages, and that brevity in a bill can lead to excellent clarity of statute, a model that anybody forming a government could look to follow in the future. Can I thank the Leader of the House, and indeed the Shadow Leader of the House, for having been able to bring this before the House so that we have these provisions put into statute to enable the next Parliament, hopefully, to get a flying start in the new Commission as it is set up. And can I also associate myself with the remarks of the Leader and others in paying tribute to the Right Honourable Gentleman, the Member for Blackburn, as I did when we debated these matters. Can I also assure him that I'm called after the railway station and not the railway station after me? But it is, I think it's an excellent report that found an extremely good way forward and has favour with everybody. Can I make it clear that these short remarks are not made in my position as the spokesman for the Commission? The Commission's position is set out in the written statements that I've issued in my name as the spokesman, and that makes clear that progress is being made to have the clerk in place before the dissolution, and because of the sequential nature as recommended by the committee, the Director General recruitment has started but cannot complete until that recruitment is in place, which will be an early order of business for the new Parliament. Other than that, I would say the Commission has sought simply to give effect to everything that was set out in the report as much as it can and as quickly as it can. Speaking personally, I'm delighted to see this bill before the House. And I don't want to go into any of the detail particularly because this bill merely or does the very important job of putting into statute those provisions that needed to be changed in the 1978 Act, and we had the chance to debate the other matters earlier. I would just like to mention one small regret, which is that we didn't find room in the bill to include an enabling clause which would have permitted a future Commission to look at bringing the administration estimate and the MEC together, which was a sort of recommendation, a think-about recommendation, and I think something that would have enabled that at a later stage been useful, but I completely accept that in order to get this through quickly, that was a provision that had to wait for another time. My worry is that House of Commons bills don't come along that often, and it therefore may be a very long time before there's a possibility to do that. The only other point that I would make, since it has been mentioned both by the Shadow Deputy Leader of the House and other members speaking, is the question of election remuneration. I do think it's important that these posts be elected by the whole House so that the whole House has confidence in each of the members. And I also feel, as I mentioned before, that the 4 posts should be equally remunerated. The reason for that is I have not the slightest doubt that both of the posts that are currently not filled by chairmen of committees, where there is no question on this, will end up with cabinet-style portfolios and should end up with cabinet-style portfolios. And one of the most obvious places for this to happen is around human resources, change and diversity. It's an area which we do not scrutinise particularly well, I believe, and I think that one of the commissioners taking a specific responsibility, and one of the commissioners who would have done it extremely well in this Parliament would have been the member for Aberdeen North. So I think there is a strong case, actually, for using commissioners, not saying commissioners shouldn't do work, should just turn up and make some decisions, but actually say this is a new commission operating in a different way, and these commissioners should actually be used to undertake work. But apart from that point, I believe this is an excellent bill that puts into effect the recommendations of the Governance Committee, and I too commend it to the House.
Sir Alan Hazelhouse.
With apologies to you, Madam Speaker, and to the House for my late arrival, because we were obviously the House's business had moved on faster than I had anticipated. If I might be allowed a word, I'm sure if I was sitting once more where you are now sitting, Madam Deputy Speaker, I would have frowned very much upon someone trying to get in at this point. But as the proceedings are moving along very swiftly, I hope I might be indulged. I would like just to...
For the avoidance of doubt, of course the honourable gentleman, with his long experience and so much to contribute, is hereby indulged. Sir Helen Hazelhouse.
You're very kind, Madam Deputy Speaker. I want to join in on this occasion with complimenting the Right Honourable Gentleman, the member for Blackburn, and my Right Honourable friend on the front bench, and my Honourable friend on the opposition bench, all of whom have cooperated to ensure, first of all, there was a good report with other colleagues, and then that it has been brought forward so swiftly. I have certainly, in the last 4.5 years, identified weaknesses, inconsistencies in management of the business side of the House, which I think the strengthened Commission will help to overcome. I have detected great weaknesses in the connection between the decisions made by the Commission and the political parties in the House, and then also weakness in communication between members of the House as a whole. And I believe the way that the committee has recommended that the Commission be composed in the future addresses all those weaknesses and enables us to have a more coherent system of management, and one which hopefully will be more easily explained to a very diverse audience in this House, not just amongst members but amongst the other important people who have passes on this House and who serve us in various ways. So I think that we may look forward with some confidence to the implementation of the plan that is presented to the House, and I have every confidence in it.
Tom Brake. Does Mr Doherty wish with the leave of the House, Mr Thomas Doherty?
To just respond to the opposition, Madam Deputy Speaker, very briefly, to just two of the points that were made in particular by the Honourable Gentleman, the Right Honourable Gentleman, the member for Caithness, Southland and Easter Ross. And perhaps I have picked him up incorrectly, Madam Deputy Speaker. We on this side don't think that the Commission members who are not chairs of select committees should be elected by the whole House. It is a matter for those parties to elect. It would be unusual if we started, if I can extend the principle of select committees. Members of select committees are not elected by their whole House. They're elected by their parties. Their role on the Commission will be to represent, as Leader of the House has already said, the views of those parties and those members of Parliament. I think it would not be democratic for example, Labour members to have a say on who represents the Conservative Party or the Liberal Democrat Party or the minority parties. And therefore, for the avoidance of doubt, the parliamentary party, Labour Party position is that it will be for those individual parties. Second point, of course I'll give way.
just to be absolutely clear, does he think that the Finance Commissioner, for example, ought to be elected by the whole House, even if he's not saying that the commissioners without portfolios should be elected by the whole House?
I think that is something that we'll look at, but my position is that the current arrangements for the Select Committee chairs have worked well in this Parliament, and they should continue in the next Parliament, if that provides clarity. On this other point, and I think it is critically important that there is no ambiguity about the position of the Parliamentary Labour Party, we do not believe that the other commissioners should be paid because the work is no more onerous than being a member of the Finance Committee or the Administration Committee or the Foreign Affairs Committee who do not receive payment. And my understanding is, Madam Deputy Speaker, the Commission, it meets once a month. It would be slightly strange if the only member of the Commission who was not receiving a additional payment ended up being the shadow leader of the House because the shadow cabinet are not paid. The Commission itself is not an onerous meeting schedule, and we should, of course, I'll give way.
I quite understand the honourable gentleman's point. I just fundamentally disagree with it, and it's not actually in this bill, so we can leave it till later.
And perhaps that's a sign of our democracy in work, at work. But as I say, that is the position of the Parliamentary Labour Party. We are absolutely clear that we actually want to see, Madam Deputy Speaker, more cost-saving measures. We very much welcome the steps that the Commission is taking, looking at the shared services, and it was something that came out of the governance report. We are clear, my honourable friend has said on more than one occasion, as have I, that it is absurd that we continue to have 2 catering operations. It is absurd that we have 2 research operations. We already have shared services. I know that the right gentleman has done a lot of work on this, and we think in the next Parliament that should be the goal. It is to reduce the cost of our democracy, not to drive up the costs further.
Tom Brick.
Thank you, Madam Deputy Speaker. And in responding to the second reading debate on behalf of the Government, I want to thank those honourable members who've taken part, and particularly for their positive comments about the bill. I'm particularly grateful for the support offered by members of the Governance Committee and the official opposition. A number of members have raised individual points which I will seek to respond to. First of all, I'd like to again thank the official opposition spokesman for setting out in his opening remarks the role of the Commission, which I think we could all benefit from, members of Parliament and, of course, the wider public. And he also, I think, set out his own party position on the issue of the election of commissioners, and I hope that he would agree with me that this is not a matter for the bill in terms of setting out in the bill how that process should be carried out. We then had a contribution from the member for North East Herts, who stressed the importance of connecting the Commission with members, and he was hopeful that the Commission would be more responsive, more in tune and in keeping with best practice, and I think that is something that we would all echo. He asked a specific point about, or raised a particular point about the Commission not always being good at providing direction. Now, I do agree with my honourable friend on that point. The specific function added by this bill will provide greater clarity in terms of the leadership of the House, and the new membership will ensure that this leadership is fully representative of members and staff. In the contribution from the Right Honourable Member for Blackburn, who I would like to, as all members have done, thank again for the key role that he took on in relation to governance and the willingness that he took up something that hasn't been done for the last 40 years. And I did think that he had put it very delicately when he said that there was perhaps a difference of emphasis on the issue of the leadership of the House. So how very diplomatic of him. He did go on then, however, to perhaps in slightly less diplomatic terms underline perhaps some of the slightly less functional or possibly even dysfunctional aspects of the Commission. He touched on the issue of pay and the pay for the commissioners. Now, clearly, that is a matter for the House. rather than for this bill. But I'm sure that those arrangements would, whatever they may be in the future, might also want to perhaps listen to the public and perhaps the public's desire that the cost of politics does not go up. Although I do fully understand the point made by the spokesman of the official opposition that if all the commissioners are paid, then it does leave the shadow leader of the House in a rather impecunious position in being the sole member who was not receiving a salary for that. My honourable friend, the member for Caithness, I'm happy to give way.
Of doubt. That wasn't the main argument. The point was that for the right honourable gentleman to say that there is a significant workload, my point was there was no suggestion, and I can say this because she's safely out of the country, and there's no suggestion that the shadow leader seeks to be paid. It is that if the logic is that they have a workload, then her workload is significantly higher than that of a commissioner.
I thank him for that clarification, although I must say that I don't think clarification was needed, because I had not suggested that the shadow leader had primed him to make a bid for additional funding for her post. In relation to the comments made by my honourable friend, the member for Caithness and Sutherland and Easter Ross, I would start by saying nice try on trying to convince us that the railway station you were named after it rather than it being named after the right honourable gentleman. I think that's probably not entirely factual. I would also like to thank him for the very important role that he plays on the Commission, really performing a key function for all of us as members of Parliament, and he does that very, very effectively, and we always enjoy listening to his responses to questions at House Commons Commission questions in this place, particularly when the subject of mice are raised, on which he is an expert. He underlined rightly that the Commissioners should have specific responsibilities, and clearly the whole issue of renovation and restoration is one where there is a very clear opening for someone to undertake a very substantial piece of work or to be involved with a very substantial piece of work. He highlighted that there is no enabling clause to bring together the members' estimates and the administration estimate. Now, I do accept that is something that is worth further consideration, but this will require a little more time to get that right, and we do not want to hold up this bill by trying to pursue that. And we've already touched on the subject of whether the extra members should be paid and the position that would leave the shadow leader of the House in, albeit she has not made a specific request for funding for her position. And finally, we had a contribution from the honourable member for Saffron Walden, who again I'd like to thank him for the key role that he has played on the Administration Committee, and that he, I think, as a number of other members did, underlined his hope that, or stressed his hope that the new Commission will improve communications and improve coherence. I think that is one of the key messages that has come out of this debate. Madam Deputy Speaker, this has been a short debate that has demonstrated that the modest provisions in the bill have the support from across the House, and on that basis I do not wish to detain the House further and hope that it can now make rapid progress. I commend the bill to the House.
The question is that the bill be now read a second time. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. Under the order of the House of today, we shall now move to Committee of the Whole House.
Order.
House of Commons Commission Bill.
We now have 3 closed-down part debates on a schedule, and we begin with Clause 1, with which it will be convenient to consider the schedule. And the question is that Clause 1 now stand part of the bill. Mr Brake.
Chairman. Clause 1 deals with changes to the membership of the Commission. It amends the House of Commons Administration Act 1978, which established the Commission and defines its membership. The amendments in Clause 1 extend the membership from the current 6 members of Parliament to 11 members in total. Under subsections 2 and 3, the new Commission will consist of 7 parliamentary members, 2 external members and 2 official members. Subsection 4 provides that the external members, like other members, will be appointed by resolution of the House and that these members cannot come from Parliament itself. They must be genuinely external. New subsection 2C specifies that the official members are the Clerk and Director General of the House of Commons when the latter is appointed. The new post of Director General is not otherwise defined in statute, so the Bill provides, in paragraph B of 2C, for the Commission to appoint an alternative official if the post is vacant or ceases to exist. This allows the Commission the freedom to change the name of this senior post at a future point without recourse to legislative change. Subsection 5 provides a definition for members of staff of the House of Lords. There is no need to provide an equivalent definition for Commons staff because the term staff in the House departments is already used in the House of Commons Administration Act 1978. Finally, subsection 6 gives effect to Schedule 1, which makes further provision about membership and procedure of the Commission, and which we will debate later. This clause and the accompanying schedule implement the legislative recommendations of the Governance Committee regarding the membership of the Commission.
Sorry, for clarity, we're debating Schedule 1 now. We will vote on it at the end, but we'll debate it now, if that's convenient. Mr Thomas Doherty.
It's a pleasure, Mr Havard, to share and to serve on your chairmanship. We'll be extremely brief. We welcome this. This is logical extension. I see no need to continue this debate any longer than necessary.
Mr Brick, wish to say anything?
Hear to that.
Okay. Right. The question is, that Clause 1 stand part of the bill. As many as that opinion say aye. Contrary, no. The ayes have it. The ayes have it. We now move to Group 2, Clause 2. The question is, that Clause 2 stand part of the bill. Mr Brake, the Minister.
Clause 2 amends Section 2 of the House of Commons Administration Act 1978. The clause extends the role of the Commission to include setting of strategic priorities and objectives for services provided by the House departments. This function is added to the Commission's current statutory responsibilities for staff appointments, numbers, pay and pensions. This amendment to the 1978 Act implements in full a recommendation from the Governance Committee and makes explicit in statute a role that the Commission otherwise fulfils by default. The precise way in which the Commission carries out this function is not prescribed in the Bill to allow the Commission flexibility to decide the most appropriate way to discharge its responsibilities.
Mr Havard, I'll be as brief as I can. As I said at second reading all that time ago, I am frankly more astonished that we have gone 30-something years without having a commission set out that one of its core functions is from time to time to set strategic priorities. And I therefore think this is a very obvious thing that should be addressed. The only observation I would make, Mr Havard, is that when it comes to selecting external members, and indeed for the parliamentary parties to choose its representatives, one can only hope that both the parliamentary parties and the Commission will bear in mind the qualities that are needed. Its job is not to micromanage the House service. It is there to set strategic priorities, and that therefore is a key requirement in both external member appointments and the choice of members to serve the parliamentary parties.
Question is that Clause 2 stand part of the bill. As members of opinion say aye. Aye. Contrary, no. The ayes have it. The ayes have it. We now move to Group 3, Clause 3. The question is that Clause 3 stand part of the bill. Minister.
Thank you. Clause 3 sets out the commencement procedures for the bill. These are designed to ensure that the reformed Commission can be established as quickly as possible. This is achieved through bringing the new Commission into being when the last of the parliamentary members has been appointed, but allowing for the appointments process for other members of the Commission to proceed prior to this date. For the benefit of the House, I will quickly set out the detail of how these commencement provisions will operate, as I am conscious they are not straightforward. From the day that this bill is passed, it will be possible to appoint the new members of the Commission. This will ensure that the process for appointing the parliamentary and external members of the Commission can start as soon as possible, and that the new Director General and the Clerk can join the Commission at an early stage. These appointments and the Commission's new function of setting strategic priorities and objectives for services provided by the House departments will take effect on the day after the last of the parliamentary members have been appointed.
Mr Doherty. The question is that Clause 3 stand part of the bill. Is many of that opinion say aye? Aye. Contrary, no. The ayes have it. The ayes have it. I now move the motion on the schedule to the bill. The question is that the schedule be the schedule to the bill. As many of that opinion say aye. Sorry, you move formally. Thank you very much, Minister. Well, I now put the question that the schedule be the schedule to the bill. As many of that opinion say aye. Aye. The contrary, no. The ayes have it. The ayes have it. Order. Order.
Order.
I beg to report that the committee has gone through the bill and made no amendment.
As the bill was not amended in committee, we shall now move to third reading of the bill. The Leader of the House to move third reading.
Madam Deputy Speaker, I beg to move the bill be now read a third time. This has throughout been a matter for the House, and the role of the government has been to facilitate and support the House in reaching a decision and in making these changes. The House has demonstrated its support for the recommendations of the Governance Committee implemented by this bill. The bill is one strand, it's an important strand of the package of measures that is currently being taken forward by the Commission and by the House. And that is a package overall that I'm sure will help bring the governance arrangements of the House up to date and deliver improvements for members, staff and for the public. So once again, I would like to thank everyone who has contributed to this work and strongly support it as Leader of the House. And I again commend the bill to the House for its third reading.
The question is that the bill be now read the third time. Mr Thomas Doherty.
Thank you, Madam Deputy Speaker. I'll be brief again. I'd like to join the Leader of the House in thanking not just the Governance Committee and their staff, but all the House service, the Secretary of the Commission, Mr Twigger, who's also the Clerk of the Finance Committee, and of course Helen Wood, the Chair of the Clerk of the Administration Committee, for all their work in taking this forward. If I may just say, I was slightly disappointed, Madam Deputy Speaker. For those of you who've been watching the documentary series about the House of Commons, I do recall the Leader of the House saying he had a 24-hour speech prepared once, and given the quickness with which we have moved through this, perhaps he could have been tempted to give us an excerpt from that 24-hour speech. I think we still have 4.5 hours left if he wants to fill the time. I'm most grateful. Here we go.
I have to say, we've seen aspects of the honourable member himself while watching that programme that many of us never wish to see again. And so there are many things set out in those programmes that are not to be brought onto the floor of the House today.
I'm most grateful for that. A very helpful intervention, and I'll be suitably short for the rest of this contribution. The only other observation I would like to make is, following on from the point about making good progress, I think it is absolutely crucial that both the Finance Committee and the Administration Committee move very quickly after the general election, because we will need to fill those two posts on the Commission, and I hope the Committee of Selection will therefore make one of its early priorities finding time to at least have an initial Admin Committee and Finance Committee so we can follow the process. But as I say, this has been a good debate. It's a very consensual debate, and we wish this bill all the best in the other place.
The question is that the bill be now read the third time. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to the motions relating to Procedure Committee reports. We begin with motion number 6 relating to sittings in Westminster Hall. Mr Charles Walker to move.
Madam Deputy Speaker, thank you. I beg to move the motion as it is on the order paper. Madam Deputy Speaker, sittings in Westminster Hall have become an established feature of the House of Commons life. However, the committee felt that there was room to make some small improvements to the second chamber, a chamber that has remained largely unchanged since it came into use in November 1999. Although not welcoming all of our proposals, the Government has supported many of the committee's recommendations contained in its report of 10 September 2014, and it is these that I shall focus on in this brief speech. Firstly, we recommend the introduction of 2 one-hour debating slots to take place at the end of Tuesday and Wednesday sittings. This hour-long debate will replace the half-hour debate at the end of these 2 days and extend the sitting in Westminster Hall by half an hour, both on Tuesday and Wednesday. It is hoped that the hour-long debates will provide some additional flexibility for members. This change, if approved by the House, will allow more colleagues to intervene or take part in a debate and provides the opportunity for the opposition front bench to make short contributions. And I have to say to the House, the emphasis really is on short. Just a few brief observations. Additional tidying up measures will see the Backbench Business Committee assume responsibility for allocating one 90-minute debate per week in Westminster Hall. As you'll be aware, Madam Deputy Speaker, this has been trialled over the past year and it has proved to be a success, so we wish to make this a permanent part of the House's procedures. We also recommend that overall responsibility for the business of all sittings in Westminster Hall should be given to the Chairman of Ways and Means. This move would give a single point of authority for all sittings and remove uncertainty about the oversight of Thursday sittings. In making this change, the appointment of business for each day will continue to reflect the requirements set out in standing orders, protecting the nomination of debates by both the liaison and backbench committees. An advantage of transferring responsibility for Thursdays to the Chairman of Ways and Means is that on the rare occasions that neither the Backbench Business Committee or the Liaison Committee nominated a subject for debate, the Chairman could nominate a replacement subject. The committee also recommends that those chairing Westminster Hall debates should have the power to order as opposed to ask a disorderly member to leave the second chamber. If the member does not comply with that request, the Chair has the power to suspend the sitting and report the conduct of the member to the House. And, Madam Deputy Speaker, let me be clear. The purpose of giving the Chair such a power of last resort would be to make it more likely that it need never be used. And finally, in a continued drive to make the procedures of the House more relevant and accessible to the public and its members, we, the committee, also recommend that debates taken in Westminster Hall should be termed general debates as opposed to adjournment debates. The title of such debates must remain genuinely neutral and free from argument or implied opinion. Madam Deputy Speaker, I hope that the recommendations that I've outlined briefly today will find favour with the House.
The question is motion number 6 on sittings in Westminster Hall as on the order paper. Thomas Doherty.
Thank you, Madam Deputy Speaker, and I will seek to follow the example set by the Chair of the Select Committee by being equally brief this afternoon on this debate. First of all, let me say that we very much welcome the fact the Government has found time this afternoon, not just for this report but for 2 other reports, though we are disappointed that time has not been found for example, the Private Members Bill report, and hopefully the Minister, when he responds, could perhaps tell us when we will have that report debated, as it too seeks to provide some sensible modernising steps that were agreed unanimously by the Select Committee and entered into negotiation with the Government over an extended period. However, this report, as the Chair has said, and I want to pay tribute to the Chair, of course I'm a member of the Select Committee as well, I am disappointed that the government didn't accept the recommendation about switching the business on a Monday and Thursday. I've always found the leader to be incredibly humorous, and I thought there was no better humour than when he told the Select Committee it's because the government was keen to preserve Thursdays as a full day of business. Having attended many of our Thursdays, I'm not sure that is a fair reflection of all the business that timetabled, and I still believe that it would have been more helpful to colleagues had important Select Committee debates taking place on a Monday afternoon, and then Thursdays were for e-petitions. However, in the spirit of going forward, very much welcome the fact the government has accepted those other changes. I think in particular what would be a useful innovation is the 1 hour slot. I'm not sure that my recollection was it was a very brief contribution from the opposition front bench. I think our position is it would operate in the same way as a 1.5 hour debate, rather than just a few remarks. Oppositions do tend to have, certainly our opposition period, have substantive policy, and it would be unfair to try and cram that in just to a few brief remarks. But as I say, thank the Chairman for the way he set this report out, thank the Government for finding the time, and hope this can be agreed without dissent.
Tom Brake.
Thank you, Madam Deputy Speaker. I rise to speak in support of the motion on the order paper in the name of my right honourable friend, the Leader of the House, and that of the Chair of the Procedure Committee, the Honourable Member for Broxbourne, relating to business in Westminster Hall. But before going any further, I'd like to congratulate my honourable friend who today received his OBE in the Palace. I'm grateful to him for returning to the Chamber. I know he has been keen for the House to consider and decide upon the outstanding work of his committee before the dissolution of the House. I'm pleased we have been able to facilitate that this afternoon. We will be considering 3 of the outstanding reports of the Procedure Committee in the Chamber today, but there is further House business to attend to. There are reports for the Procedure and Standards Committee as well as standing order changes that will be necessary in order to bring into effect the recommendations of the House of Commons Governance Committee report. These are in addition to the House of Commons Commission bill the House has just considered. I expect there to be further opportunities for the House to consider those issues before the 30th of March, and it is the intention that the Government provides time for those outstanding reports, indeed maybe the Private Members Bill report that was referred to earlier, that have been agreed, so that those issues that have a wide consensus can be resolved before the end of the Parliament. And I do stress the importance of there being a wide consensus. Madam Deputy Speaker, I'm happy to give way.
I listened very carefully to his choice of words there, Madam Deputy Speaker. It's our view that with the best will in the world, a wide consensus is not the same as a government veto. If the government does not like a substantive part of the Private Members Bill report, it should have to state so publicly, which ironically enough is one of the things that the Private Members Bill seeks to do, the Private Members Bill report seeks to do on Private Members Bills. The government simply not wanting to table something is not an excuse for not bringing it forward to the House. The House is supreme. The House should decide, not the government.
Well, I've heard that, and he has made 2, I think, forceful bids for the same report to be debated. I think it is worth underlining, however, that I think he will be as aware as anyone is of perhaps the range of views on the issue of private members' bills and how that process could be improved, ameliorated or changed. Madam Deputy Speaker, I'd now like to move on to the motion before us.
Will the honourable friend give way very briefly?
I'm happy.
Since we stray into the area of private members' bills, Madam Deputy Speaker, I shall be brief because I know this is slightly naughty. I would say to my honourable friend that the government's opposition to so much of that report seems implacable, that it is probably best that it's not brought forward, to be honest, in this session, unless that opposition relents.
My honourable friend for that clarification, and indeed what appears to be a counter bid in terms of blocking any proposal to debate this particular report. Madam Deputy Speaker, I would now like to move on to the motion before us. I start by thanking my honourable friend for the way he set out the motion for the House in his speech. The motion is the result of the reports of the Procedure Committee Business in Westminster Hall published in October 2014 and the follow-up report which included the government response and a revised Standing Order No. 10, published in January of this year. I'm grateful to the Chair of the Procedure Committee for the comprehensive way he set out the implications for the House of agreeing the motion before us. I'm also grateful for the work of the committee in this area, and I'm pleased that the report recognises that the Government accepted the majority of the recommendations in the committee's original report. I think that these changes that will be introduced if the House approves this motion represent a sensible package of evolutionary changes to the work conducted in the second chamber. Westminster Hall has proved itself as a valued resource since its introduction in 1999. And indeed, I can confirm, Madam Deputy Speaker, that I used to make extensive use of Westminster Hall for debates normally around the future of my local hospital, St Helier Hospital, which, with my honourable friend, the member of Sutton-on-Cheam, we continue to campaign on to this day. But that's not the purpose of the debate today. These changes will hopefully add further to its status. Some of the changes we've already seen this Parliament, for example, the use of additional time on Mondays for the consideration of e-petitions by the Backbench Business Committee, are testament to the sort of valuable work that is conducted in Westminster Hall. The recommendation of the Procedure Committee for the provision of 1-hour debates on Tuesdays and Wednesdays by extending sittings for half an hour will provide useful additional flexibility and is a welcome recognition of anecdotal evidence that many members who wish to raise issues feel constrained by the limits of a 30-minute debate but would not necessarily wish to apply for a 90-minute debate. This change will be welcomed by members without placing additional onerous requirements on ministers and opposition spokespeople. The arrangements set out by the committee in Chapter 2 of its original report to provide an opportunity for opposition spokespeople to participate in such debates are sensible. Although I think he's already heard from, my honourable friend has already heard from the other side, perhaps a request for some clarification over the precise role that opposition spokespeople would play, and certainly that is something that I would perhaps appreciate a little bit of clarity on in terms of whether that is something that is optional or whether it's something that the member who's initiated the debate will have to request and so on. So any clarity the Procedure Committee could give on that would be welcomed by me and others, I'm sure. Similarly, the changes which mean that debates in Westminster Hall will be considered on neutral general motions and not adjournment motions is entirely sensible. I suspect that amongst the wider public, and clearly there are people who understand what an adjournment motion is, but I suspect the overwhelming majority of members of the public and indeed perhaps members of Parliament would be more comfortable with general motions as a more accurate description or a clear description of what is indeed being debated. I'm happy to give way.
I just referred him to our report that deals with speeches by opposition frontbenchers, and it reads this: so long as they are brief, we recommend that opposition spokespeople be able to participate in hour-long debates in Westminster Hall. We trust that chairs in Westminster Hall, backed by the Chairman of Ways and Means and the panel of chairs, will offer robust guidance to opposition spokespeople on the appropriate length of their speeches. It is not the committee's intention that opposition spokespeople get the same amount of time, I believe, as the government frontbencher does, the Minister.
Well, I thank him for that clarification. I think it still slightly leaves open the question of whether that is something that is optional. In other words, the Chair could choose not to allow the opposition spokesman or spokeswoman to speak. But that, I'm sure, is something that can be clarified in future. Many around the House are keen that our work is open and transparent to members of the public as it can be, and this is a small step in that direction, providing the House's procedures with greater clarity and consistency. There were 3 issues with which the Government did not agree in the original report. These are set out in the Government's response and the subsequent report containing the revised recommendations. I'm grateful to the committee that it was willing to accept the Government's view on these issues and bring before the House a set of proposals which should have widespread support across the House. With regard to the use of substantive motions in Westminster Hall, the Government agrees that the main chamber is the proper place for debates on amendable business, not least in view of the practical difficulties surrounding voting in Westminster Hall. The Government does not, however, wish to rule out the possibility of some substantive business being taken in Westminster Hall at some point in the future, for example, in order to remove pressure upon the chamber. However, much more work would need to be undertaken on the practical and procedural implications of this. It is for this reason that the Government did not support the recommendations of the Committee to repeal paragraphs 9 and 12 of Standing Order number 10, although we do accept that this is not something that has been used. The Committee recommended that the current sittings on Mondays and Thursdays be swapped so that Select Committee debates chosen by the Liaison Committee and backbench debates are taken on a Monday, and any debates on e-petitions are scheduled on a Thursday. The Government, contrary to what was said earlier by the Honourable Member and the Member for Dunfermline West Fife, the Government is committed to maintaining the integrity of Thursdays as a full parliamentary day. And I hope that all members in this House would respect that that is what Thursday is. The Committee's proposals would send a contrary signal, particularly given that there would be many Thursdays on which there would be no business in Westminster Hall, and the Government could not support them. The Committee also proposed an earlier start and finish in Westminster Hall on Thursdays, although without evidence of widespread support for this measure, the Government opposed it. I'm grateful that the Committee decided not to press these proposals. Madam Deputy Speaker, I'd like to finish by thanking again the Committee for its work and by asking the House to support this motion. If approved, the new standing orders will be introduced at the start of the next Parliament.
Mr. Charles Walker? Charles Walker.
Just to say I'm satisfied, Madam Deputy Speaker, so I move it formally.
The question is motion number 6. As many of that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to motion number 7 on Queen's and Prince of Wales consent. Mr. Charles Walker to move the motion.
Thank you, Madam Deputy Speaker. I beg to move the motion as it is on the order paper. Madam Deputy Speaker, the Political and Constitutional Reform Committee, in its report on the impact of Queen's and Prince's consent on the legislative process published in March 2014, makes a number of proposals to change the process for obtaining and signifying consent to bills before Parliament. The Procedure Committee agrees that consent should not be re-signified when a bill has been carried over from one session to the next, and we recommend that the House should formally endorse this practice. However, in a departure from the recommendations made by the Political and Constitutional Reform Committee, the Procedure Committee suggests that this consent should continue to be given by a Privy Councillor, as we have seen no evidence that any bill has been delayed by a Privy Councillor not being present. The Committee is of the view that continuing the current signification process is more open and transparent. Madam Deputy Speaker, currently consent can be signified at either the second or third reading of a bill, depending on the extent or nature of the way in which the prerogatives or interests of the Queen or Prince of Wales are affected. However, even when consent has been signified at second reading, amendments to the bill at subsequent stages can require consent to be resought and re-signified at third reading. We therefore share the concerns of the Political and Constitutional Reform Committee that the signifying of consent at different legislative stages can add confusion to the legislative process. On October 30th last year, the other place agreed that, where necessary, whatever the nature or extent of the interest or prerogatives engaged, consent from the Queen or Prince of Wales should be signified in that House at third reading. Following the decision of the other place and the recommendations of our colleagues on the Political and Constitutional Reform Committee, we recommend that where it is required, consent should be signified at third reading, whatever the nature and extent of the prerogatives or interests engaged. And we recommend that the House should formally endorse the practice of noting the need for consent in relation to a particular bill by including a note on the future business section of the order paper that consent is to be signified on third reading as soon as this requirement is known.
Thomas Doherty.
I'll be even briefer than my standard today, Madam Deputy Speaker. We have important business to discuss. I thank the committee for its work. I think it is right that the PCRC offered no substantive evidence that requiring signature in person was delaying the bill, was delaying bills. Governments have found enough ways otherwise to hold up bills they don't particularly like, and therefore we think this is a sensible way forward.
Madam Deputy Speaker, I rise to speak briefly in support of the motion on the order paper in the name of my right honourable friend, the Leader of the House, and that of the Chair of the Procedure Committee, Honourable Member for Broxbourne, relating to Queen's and Prince of Wales consent. These recommendations arise from the report of the Procedure Committee published in December 2014, which was itself a result of earlier work by the Political and Constitutional Reform Committee. I am grateful to both committees for their work. As was stated in response to the report of the Political and Constitutional Reform Committee in June 2014, Queen's and Prince of Wales consent is a long-standing parliamentary requirement for certain bills, and these are therefore matters for Parliament to decide on. The Procedure Committee have brought forward changes that are entirely sensible. They will increase transparency by noting on future business when a bill requires consent, simplify the procedures by endorsing the practice of not requiring consent to be re-signified when a bill is carried over between sessions, and increase consistency between bills by ensuring that consent, when required, is always signified at third reading of a bill. These are small and sensible tidying reforms, and the Government is happy to support them. The Government will continue to actively cooperate with Parliament and its requirements in relation to the legislative process, and I hope the House supports the motion today.
The question is motion number 7. As many of that opinion say aye.
Aye.
On the contrary, no. The ayes have it. The ayes have it. We now come to motion number 8 on petitions and e-petitions. Mr. Charles Walker to move the motion.
Thank you, Madam Deputy Speaker. I beg to move the motion as it is on the order paper. Madam Deputy Speaker, of the 3 debates we've had this afternoon from the Procedure Committee, I would suggest this is the big enchilada. This is the one that the House has been waiting for with bated breath. Well, those here have been waiting for with bated breath. Madam Deputy Speaker, on 8th May last year, the House agreed to establish a collaborative e-petition system. In the intervening time, the Procedure Committee has worked hard to come up with a workable and robust set of proposals. In brief, what we're proposing is the following system. A petition will need to attract the support of 6 people before going live. It will remain live for 6 months. Oversight of the joint e-petition system will be undertaken by a House of Commons Petitions Committee. This committee will have an elected chair and elected members. It will be able to correspond with petitioners on their petition, call petitioners for oral evidence, refer a petition to a relevant select committee, seek further information from government, either written or oral. And might I just say that oral evidence will only be requested in exceptional circumstances. And the committee will obviously be allowed to put forward petitions for debate. The committee will be supported by the excellent House of Commons staff, and may I remind the House, if it's drawing breath at the thought of another committee being created, that we actually had a petitions committee in the House from the early part of the 19th century up until 1974. And I don't think it is the Procedures Committee intention to create an additional committee. I think that our intention is to allow for there to be a new Petitions Committee that will replace an existing committee, but that is for the business managers to decide. In his evidence to us, the then Leader of the House, the Right Honourable Member for Cambridgeshire, said, "I think it is important to have a committee in some form to highlight to the public that Parliament treats this seriously, to make sure that government departments respond properly and fully, and to be able to recommend debates where necessary. Therefore, the Petitions Committee will decide what petitions merit further action. It will take the existing 100,000 threshold as the established starting point for consideration of a debate in the House. However, and this however is a very important however, in this age of mass campaigning, the committee will also be mindful of smaller petitions, which, although not benefiting from the support of well-funded and organised pressure groups, are nevertheless deemed to be of great importance to a community, or perhaps, in extreme cases, even an individual. The Petitions Committee will seek to improve engagement with petitioners. It will often be the case that those submitting and supporting a petition will not get the exact outcome that they want. However, they will hopefully feel that their concerns have been appreciated and heard through constructive engagement with the committee and through receiving responses from government and, on occasions, the relevant select committee. And moderation of the site will be carried out by e-petition staff. It is also our intention that the e-petition system contains a facility that allows our constituents to alert us when they have signed a petition. After all, we all greatly enjoy and love hearing from our constituents. And this facility would be provided through the provision of an email address and a strong suggestion that when our constituents provide us with an email address, they also provide us with their home address so we can verify that they actually are our constituents. Now, let me turn to the threshold. The threshold of 6 signatures has been identified because it requires the lead petitioner to seek support for his or her position, but in seeking this support, the demands on the individual are not too onerous. Within the current system, around 1 in 5 of the e-petitions which have been submitted have attracted fewer than 3 signatures and 42% fewer than 6. Madam Deputy Speaker, this is a petition system. It really shouldn't be for individual representations, though those are best made to the relevant Member of Parliament. And to emphasise the parliamentary oversight of the system, and in line with the House's historic role as the principal recipient of public petitions, we have recommended that the URL of the site be epetitions.parliament.uk and with a clear link from the Parliament website to the e-petition site. Now, on the important matter of privilege, a petition should not be privileged simply by virtue of having been approved by staff of the Petitions Committee. The House publishes much material on its website which is not a proceeding in Parliament and which is therefore not privileged. The point at which an e-petition becomes a proceeding in Parliament will be the point at which it is considered by the Petitions Committee itself. Only when the Petitions Committee has considered the petition and determined that it considers it fit for presentation to the House does it constitute a proceeding in Parliament. And notwithstanding the issue of privilege, it is possible that a petition published on an e-petition site endorsed and established by the House could attract the more limited protection of the Parliamentary Papers Act 1840. Therefore, the Petitions Committee staff drawn from the House will need to exercise their usual great care in the moderation of petitions to ensure that no potentially actionable material is published in an e-petition without the explicit authority of the Petitions Committee itself. Now, Madam Deputy Speaker, a petition will be open for signature for 6 months. After this period of time, the title of each e-petition will be recorded in a list in the votes and proceedings of the House, together with the number of signatures it has attracted. Should a member wish to pursue it, the paper petition system will enable the formal presentation of the subject of an e-petition on the floor of the House. In bringing forward debates, we recommend that the Petitions Committee assume responsibility from the Backbench Business Committee for determining debates on e-petitions in Westminster Hall. And importantly, Madam Deputy Speaker, the Chair of the Backbench Business Committee, the Honourable Member for North East Derbyshire, is supportive of this change. If the Petitions Committee decided that the petition warranted debate in the main chamber, it could then approach the Backbench Business Committee and ask for that time to be provided. However, the Backbench Business Committee is under no obligation to grant this time, so there is no land grab in this, Madam Deputy Speaker. In regards to paper petitions, we have concluded that the rules and procedures should remain as they are, with one exception, and that is to provide the Petitions Committee with the power to consider paper petitions and take the appropriate action on them alongside petitions coming through the electronic system. And I believe that change will strengthen the paper petition process, Madam Deputy Speaker. Now we return to the vexed issue of cost. The cost of the new system we are proposing is set out at the back of our report. However, in brief, we estimate the start-up cost as being £188,000. That's a one-off start-off cost, Madam Deputy Speaker, with an annual running cost for the e-petitions of something in the region of £115,000. These costs will be shared between the House and the Government. There could also be an additional cost of £39,000 to enable data from the site to be made available through data.parliament.uk. This cost will be borne by the House if approved by the Finances and by the Finances and Services Committee. In addition to the cost of setting up and maintaining an electronic e-petition system, there will also be a staffing cost, which we estimate will be in the region of £200,000 per year. This equates to a team of 4 full-time equivalent people, officers of the House. The cost of these House staff will be borne entirely by the House. Finally, the running cost of the Petitions Committee itself is, depending on its practices, is expected to be around £50,000 per annum. Now, if anybody's doing a running total, I believe these numbers add up to about £395,000. If they don't, well, the honourable gentleman who discovers my maths is wrong can approach me later, or indeed the honourable lady. So for further details of costs, I refer colleagues to the recently published memorandum from the accounting officer, which is available in the Votes Office. So, Madam Deputy Speaker, in concluding my rather lengthy remarks, I would like to thank my excellent committee clerks. They are heroic in every way, patient, intelligent, insightful, and just rather brilliant. So I'd like to thank them for the huge amount of effort that they've put into this report. I'd also like to thank the Government Digital Service. I'd like to thank the former Leader of the House, who is now sitting next to me, for all his efforts in bringing this to life. I think it is one of the most amazing things that has happened in this place for some time, a joint petitions committee overseen by a committee of the House, and he is to be congratulated for his foresight in allowing this to become possible. And I would also like to thank the current Leader of the House for all the support he's given our committee in allowing us to bring these proposals forward here today.
The question is motion number 8 on petitions and e-petitions as on the order paper. Nic Dakin.
Thank you, Madam Deputy Speaker. And I rise very briefly to commend the comments of the Chair of the Procedure Committee, who perhaps, while he's thanking everybody else, we might thank him for his stewardship of that committee. And can I also just apologise for arriving slightly late? I've been at the Statutory Instrument Committee, which is the reason why I'm late joining this debate. I think, in a sense, you have in this particular piece of work where the modern world intersects with our traditions, and I think the Chair of the Procedure Committee has spelt out very clearly why the proposals here in this report are the right way to take this forward in a way which recognises public interest in this. There's been a lot of enthusiasm for the public in e-petitions, and I've seen that myself by being involved in one that was created by a constituent on pancreatic cancer and raising that up the agenda. And e-petitions are a very good tool for interacting with the public in an engaging way, but it needs to be managed properly in the way in which it intersects with this place. And I think the Chair of the Procedure Committee is to be congratulated on the way in which he set out, Madam Deputy Speaker, a very sensible way forward, which I hope this House will take advantage of. Thank you.
Andrew Lansley.
Thank you, Madam Deputy Speaker, and I apologise to the House and not least to my honourable friend for missing the start of his remarks opening this debate. You've been so admirably brisk this afternoon, Madam Deputy Speaker, that I was caught elsewhere in the palace at that when the debate began. Yeah, it didn't used to happen like that under my the present Leader of the House is so efficient. But I am very grateful to my honourable friend. The House resolved some time ago, when I was Leader of the House, to ask the Procedures Committee to look at this issue, and I'm going to take no issue with the way in which they brought it forward. I think it's an excellent examination of the issues. I think they've brought forward very good recommendations. I think it does enable us, not least, to do something which I think for this Parliament, or the next Parliament and beyond, will be regarded as important, which is to enable people to interact directly, collectively, with their Parliament on issues that matter to them. The history of petitioning Parliament is, of course, a very rich one, and if only we had the honourable member from Somerset here, he would be able to explain it to us in great detail. But it is actually at the heart, along with voting supply, petitioning and petitioning to this Parliament is one of the central missions of a Parliament. And I think in recent years, it fell into disuse My predecessor, credit to him, the Right Honourable Member for North West Hampshire, at the start of this Parliament, we brought and developed the e-petition system so that people who did want to petition what they thought of as their Parliament had a mechanism for doing so, although in reality they were petitioning the government. And it was only by virtue of the government's reference on to the Backbench Business Committee that issues and an expectation, no more than that, nothing written formally into standing orders, an expectation that petitions which attracted substantial support would get formal responses from government, which I introduced, or that beyond 100,000 signatures they would be eligible for debate in this House, and the way in which the Backbench Committee have consistently and positively responded to that has enabled people to believe that they were petitioning their Parliament, but they weren't. And I know we've debated in this chamber before the distinctions between government and Parliament, but they are important. And it was clearly the public's belief that they were petitioning both government and Parliament. They weren't really distinguishing between the two. That they wanted the people who, as it were, had their control of executive power to listen to them and respond. They wanted their representatives to take their issue and to hold the government to account, or to have the opportunity to express their view. And these proposals in the next Parliament will enable that to happen. I think it will become rapidly a very meaningful part of our new reformed relationship between the public and Parliament. Not least, I think, and here credit my right honourable friend, the Deputy Leader of the House, and I visited Wales and Scotland, the parliaments there. And I think particularly in Scotland, in our conversations, we saw in the Petitions Committee in the Scottish Parliament a lot of good practice, which we were very keen to bring back here. I know the Procedure Committee have looked at that experience as well. Of course, the scale is immensely different. Orders of magnitude greater scale of petitioning to this Parliament than to the Scottish Parliament. But in truth, as my honourable friend made clear, very large numbers of petitions do not attract substantial support, or clearly do not raise broader issues of public policy or accountability. And it will be for a Petitions Committee to be able to examine the flow of petitions and isolate those where it is important for them to be debated, and also, which I think will become a very significant part of our practice here, the opportunity to bring petitioners before the Select Committee on Petitions to present their case. So people will literally have their day in the Court of Parliament to be able to say, not just to present their petition, but to explain their petition. And as my honourable friend made clear, by the mechanism of enabling them to tell their Member of Parliament, if they wish, that they have signed this petition, then also to update their Member of Parliament about the progress of the petition, and an opportunity for Members of Parliament, if they wish to join in that process of examining the merits of a petition and how Parliament and Government are responding. I think it will be a dramatic improvement in the accountability. We've seen in this Parliament some positive indications that the public believe this Parliament, over these last 4.5 years, is more likely to debate issues of relevance. There are other things that have contributed, the use of urgent questions and so on, but I actually think the petition system has been a part of that. That we are seen here to be responding on issues of importance, of relevance, in a timely way for members of the public. This will add to that, and I think the public will recognise that and use it, because that's what will be the deciding factor, is if they use it. Finally, I would just say, at the risk of contention, to my friend, that of course he's absolutely right. I do pay tribute to the Government Digital Service, to my former colleagues in the Leader's Office who have managed this system. They have demonstrated how this can be done effectively and efficiently and economically. I know that the new system will rest on that to a large extent, and we should certainly pay credit to that. And the Government and Parliament working together is a very powerful illustration of how we can bring our activities together to benefit the public. But where cost is concerned, we should be aware, going all the way back to the Right Committee, that there was one of the recommendations of the Right Committee as yet unrealised is a critical examination of the number of select committees. We are here resolving to have one more select committee. I make no bones about it. I think that's the right thing. But I think we should be prepared critically to examine in the next Parliament. It won't be me, but it'll be many members whose job it will be to look critically at the structure of select committees and whether the number of select committees is more than we need in order effectively to do the job that select committees are required to do. There should be no part of government activity which is without a select committee whose job it is to scrutinise and to hold them to account. But to some extent we do have some overlap where that is concerned. And I think it will be important for the House collectively to take an active decision at the start of the next Parliament about how many select committees and the structure of select committees for the future. But with that more contentious point, I just would say a final thank you, to return to the consensus, a final thank you to the Procedure Committee and my honourable friend for the very efficient and effective way they've taken the request from this chamber and turned it into a practical way forward for the next Parliament.
Thomas Docherty.
Thank you, Madam Deputy Speaker. I'm conscious we have an important debate on mental health to follow and will not seek to delay the House unduly. If I can begin actually by just praising the Honourable Gentleman for South Cambridgeshire. I think it was the Honourable Gentleman for North East Somerset who suggested to him that if we as Parliament got this right, then it would be the most significant reform since the 1979 setting up of select committees, and that he will have left his mark in a positive way at the end of this Parliament. And I think that the report which we have before us will set us on that right track. And if I could pick up on the point that he made at the end, I don't think actually it is contentious to highlight the issue of costs, and it's something that we've talked about already this afternoon, Madam Deputy Speaker. We on this side are absolutely clear that this is not an additional select committee, as the Chairman himself stated. It has to be a replacement for one of the select committees. It's clearly not for us today to determine what the next Parliament does. I think there are one or two select committees which are not government scrutiny select committees, which could be looked at. And on the issue of the cost that the Chairman highlighted so boldly, I think it's probably also worth pointing out that a lot of those costs are already being met by the government, and that the taxpayer, of course, pays for both, and that what we're doing is moving those costs from the Cabinet Office onto Parliament. And hopefully, when the Leader of the House responds, I'm hoping that he will confirm that the government will be seeking to assist in mitigating those costs to Parliament as the new system is implemented. The Procedure Committee rightly raised concerns about the misuse of e-petitions by campaigning organisations. We are absolutely clear that, as has already been said, that genuine petitioning of Parliament is a constitutional right. It goes right back to the 17th century. That this is not designed to be a mechanism to allow well-funded vested interest groups to seek to engineer debates, and that's why it's absolutely appropriate that when the e-petition reaches the 100,000 threshold, it still has to be considered by a select committee before it's granted time. We also think that the proposals for granting privilege are the sensible way forward as well. This is not and should not be a backdoor mechanism for ingenious members to try and attach privilege, having failed in other mechanisms to circumvent the courts. If I may perhaps make a couple of critiques of the current system, and again, to be fair to the right honourable gentleman for South Cambridgeshire, he himself has highlighted many of them, and the Procedure Committee published a report a couple of sessions ago that said that the greatest challenge facing the electorate was the confusing nature that the e-petitions website, when it was established in 2010, gave the impression, onerously, that members of the public were influencing Parliament. And as he has himself acknowledged, they weren't, the e-petitions were influencing government to then ask Parliament to do something. And therefore we think it's absolutely right that this is a joint system. I know my honourable friend, the chairman of the PCRC, has a different perspective on it, and he would prefer separate systems. But we are clear, not just because of cost reasons, but because of providing opportunities for members of the public to greater influence our democratic process. It's absolutely right, it should be a single system going forward, and it should be therefore clearer that who is being petitioned. And as the right gentleman has said, it is Parliament that is being petitioned, not the executive branch. And I think, if I can now be positive about the success of the last 4 or 5 years, we have had some fantastic debates. I mean, I would argue, Madam Deputy Speaker, that one of the best debates that we've seen was the Hillsborough debate that we had on a Monday afternoon, with some very powerful speeches on both sides of the House. And that, of course, began with an e-petition, and was one of the earliest e-petitions. And that's why I think that, provided that we all enter into this in the correct spirit, we should be seeing more of those type of powerful, public-led debates influencing our democracy. We are very clear on this side of the House. My honourable friend, the Shadow Leader, has said several times that Parliament must do more to reconnect with our constituents, who ultimately are our bosses, and that e-petitions are a useful tool. There's also been talk about the Scottish Parliament system, and again the Procedure Committee, like the government, did go up and visit. He's absolutely right as well to caution that you cannot take a straight read across because of the size and the scale of the system. The members of Parliament remain the key advocates on behalf of our constituents. The e-petition system should not replace that. It will simply not be possible with 10 times the constituencies, and of course the Scottish Parliament doesn't have the full range of issues to cover that the Westminster does, and that therefore it's right that the Clerk Service is there to support it. Madam Deputy Speaker, we fully support the system. We think it's an excellent way forward, and we hope that it will be implemented with great acclaim in the next Parliament.
Just before I call the Leader of the House, I should tell the House that I am aware that there's a problem with the annunciators. It can be confusing to members if the information upon which we rely is wrong, and it has been consistently wrong one way or the other all afternoon. Those who put these things right know about it, and work is being undertaken now. It should be better soon. Leader of the House, William Hague.
Thank you, Madam Speaker. Yes, indeed, the enunciator froze altogether during consideration of the pension schemes bill earlier, which I hope was not a comment on the complexity of the discussion then going on in the House. But I rise to speak in support of this motion, which is in my name and that of the Chair of the Procedure Committee, my honourable friend, the member for Broxbourne, and I join in the congratulations to him on receiving his OBE today. And I join in the warm welcome for this report and for these changes all around the House. This is a very important historic right, as my right honourable friend, my predecessor, has said, and there was a time in the late 18th and early 19th century when the table of this House groaned beneath the weight of the hundreds of thousands of signatures on petitions against the slave trade, against slavery, which were part of changing the political culture in the sense of what was politically possible at the time. And it is right, given that new technology now enables, again, millions of people to get in touch directly with us on a wide range of issues, that we make these arrangements. And I also join in paying tribute not only to the Procedure Committee, who have done outstanding work on this, but to my right honourable friend, the member for South Cambridgeshire, for supporting this so strongly in his time as Leader of the House, and making it very simple and straightforward for me to continue with that support. The system that has been running in this Parliament, that the government established after 2010, can be considered very successful. I think more than 10 million individuals have signed one or more of 32,000 e-petitions, over 150 of which have reached 10,000 signatures and received a formal response from the government. 37 e-petitions to date have reached 100,000 signatures, becoming eligible to be considered for debate, and 31 of those have so far been debated, either in the Chamber or Westminster Hall, with one more planned for debate next month. This is a straightforward means by which people can submit a petition to raise an issue and press for action. As the Honourable Member for Dunfermline and West Fife has just said, we've seen important debates as a result. Hillsborough is a good example. Also on the badger cull, on Sophie's Choice, on female genital mutilation. These have been important debates with no shortage of members wishing to take part in the debates on these issues, and they've provided some of the most constructive and memorable debates in this Parliament. In May last year, the House agreed unanimously to a motion supporting the establishment of a collaborative e-petitions system. And since that debate, the Procedure Committee have been working hard to bring to the House proposals for such a system. The motion before us is the result of that work. I'm very grateful for the way the committee have engaged with officials in my office and from the Government Digital Service in reaching their conclusions. The fact the current government system has worked so well is reflected in the committee's recommendation that the joint system should be based on the existing government e-petition site, redesigned and rebranded to show that it's jointly owned by the House and by government. And I support that approach, that the use of a platform already developed will save time and it will minimise the costs of the new system. The Procedure Committee have recommended a couple of useful changes to the process of e-petitioning, and my honourable friend set those out. I don't need to go through them in detail, but I think the change requiring an additional 5 signatures to that of the creator of a petition before moderation and standardising the duration of petitions to 6 months are sensible changes. The most significant recommendation in this, the big enchilada, as my honourable friend described it. Those weren't the words I was going to use, but this important reform, the most significant recommendation in this is the creation of a petitions committee. That's a major change. It should be the catalyst for a fundamental change in the relationship between Parliament and the petitioner. The greater range of available outcomes, the use of House staff to moderate e-petitions, should all improve the engagement of this House with petitioners, and I think that is a very important step forward. There is a cost for the House in agreeing the motion. The costs were set out by my honourable friend. I think there is agreement, certainly among the front benchers, that the establishment of a new committee does require us to look at a corresponding reduction elsewhere, but that is a decision for the new Parliament that is now not far away. And the government, in response to the question about the government mitigating the costs, well, the agreement is there will be a sharing of costs. So that certainly mitigates the cost to the House. And my honourable friend set out the precise numbers involved. Should the House approve this motion, the necessary changes to standing orders will be implemented at the start of the next Parliament. The current government e-petition site will close at dissolution on the 30th of March, and the aim would be to have the new site established as soon as possible after the election of the chair and members of the Petitions Committee at the start of the next Parliament, allowing for the Memorandum of Understanding and terms and conditions for the site as appended to the Procedure Committee report to be agreed between the Petitions Committee on behalf of the House and the Government. So I urge all members to support the motion before us, Madam Deputy Speaker.
The question is motion number 8. As many as that opinion say aye. Aye. Of the contrary, no. The ayes have it. The ayes have it. We now come to the backbench business and the motion on mental health and unemployment. Mr. Paul Burstow to move.
Thank you very much, Madam Speaker, and I move that the House has debated mental health and employment. And I'm very grateful to the Backbench Business Committee for enabling us to have this debate this afternoon. And I'm very grateful to my honourable friend and honourable members who supported the application, the honourable member for Broxbourne, and I add my congratulations to him along with others for receiving his OBE today, and the honourable gentleman, the member for North Durham, who also supported the application to the committee. I want to start with a story that I think helps illustrate what this debate is all about. It's a story really that I think illustrates very powerfully why progress has been made, but why more progress has to be made to make sure that we really tackle issues of mental health in the workplace. And it's a story of Anne-Marie, and it's in her own words. And I quote, "I was suffering in silence because managers and colleagues didn't know what I was going through. At work, they just didn't have the knowledge to deal with a mental health illness. So I didn't bring it up because I was afraid of being judged or being looked down on. If I had a broken leg, they could have physically seen it, and workplace adjustments would have been made. Every job by law has to have a first aider, so if someone hurts or burns themselves or falls down the stairs, there's someone to assist them, or professional help is available. But what happens when my mind goes into crisis? Where do I go in the workplace? I was taking my problems home and I was causing further damage to myself. But in the workplace, where are the avenues for us to turn to or people to speak to?" Now, eventually, Anne-Marie was off from work due to her illness, and it took some time before she did finally leave hospital and return to work. And when she did, things didn't go well. And she goes on to explain, "I remember returning to work and I felt so lost. I wasn't sure what I was supposed to do and I didn't really know where I was. I had a meeting about why I was off and how they could support me. I wasn't in a place to tell them my needs or say, this is what I require, so I just went back to work and was very unhappy, which led me to being off again." Now, there are thousands of Anne-Maries up and down this country who have those sorts of experiences, and with the right occupational support, people can be helped to remain in the workplace. Reasonable adjustments can be made. And with the right back-to-work support, people can get back to work, and that work can be good for them. And that, I hope, is a message that we can get out from this debate. And Anne-Marie's story comes from an excellent report by the Charity Mind called I've Got Work to Do. And it makes the case, I think a very compelling case, for changes to the way back-to-work support operates in this country. Now, for most people, work is a normal part of everyday life. Having an occupation, a sense of purpose, can play a critical part in promoting recovery and social inclusion. Good work can be good for your health. So I wanted to secure this debate to highlight the fact that over a third of people with mild and moderate mental health problems and almost two-thirds of people with severe mental health problems are unemployed, and that the vast majority desperately want to work. Now, oh, sorry, yes, of course, I wasn't certain whether the honourable gentleman was trying to...
I'm most interested in what he's saying, and thank you for giving way and agree with everything he's been saying. But in some cases, work itself can be the cause of mental health. If there's bullying at work, if there's poor management, and so on. So it can be, as it is, in this chamber, for example, is very makes us feel good about ourselves. Work can do that, but it can also be a cause of mental health problems.
The honourable gentleman is absolutely right, and that's why I chose my words carefully. Good work can be good for your health. Equally, bad work can be bad for your health, and certainly poor employment practices, bullying cultures, all of those things, Madam Deputy Speaker, can make a difference to the quality of a person's mental health when it comes to... On that point, of course I will.
On that point, leadership in companies is crucially important. Management, caring about colleagues, these are all things that sometimes we forget about, because this is something, Madam Deputy Speaker, that should be inculcated in all our companies and in all our organisations. Care for people and leadership.
I'm very grateful to the honourable gentleman for his intervention, and he underscores a point which I want to make during this debate, and I hope others will contribute to making this point as well. Good mental health is everybody's business, and it certainly is part of business to make sure that we're looking after the mental health and well-being of staff. It's key to reducing sickness absence. It's key to increasing productivity. It has so many benefits for the individual. So the honourable gentleman is absolutely right. Leadership and culture are critical to that, whether it's a business organisation, whether it's a public service, whatever it might be. So the vast majority of people do want to work. and this is no small issue. Among the under 65s, nearly half of all illness is mental illness, and we know that the cost to the UK economy exceeds £100 billion a year. Now, the good news is that over the past 5 years, public attitudes towards mental health have begun to change. Indeed, they have changed quite rapidly. On that point of change, of course.
Thank you for giving way. And I hope he's right that there is a change, but I'm sure we still have people come to see us who have, when they've applied for jobs, have actually admitted that they do have a mental health issue, and they are sure that that is one of the reasons why they don't actually get to that next stage of the job interview.
Undoubtedly, that is true, and indeed some people do not go through the recruitment process in the first instance because they believe they will be discriminated about, or indeed they are fearful of disclosure. So those are very serious issues about the lack of parity, the lack of equality, and the discrimination that people both impose upon themselves but also exist within our society. It's why tackling this issue of stigma is so important, and why we should celebrate the progress that has been made, but also be challenging the government to continue to support campaigns like Time to Change, because they are clearly demonstrating progress. So stigma has not gone, but it is going. Indeed, Time to Change, the anti-stigma campaign that was set up by Mind and by Rethink and is funded as part of this government's mental health strategy, has recorded the biggest annual improvement so far in public attitudes to mental health. It found a 7% rise in people's willingness to work with someone with a mental health problem, from 69% to 76%. Now, we still have to go further, but I think that is a mark of the progress that has been made, and I hope we can see more. Now, the government has made parity of esteem between physical and mental health the clear goal of its mental health strategy, and progress is being made. However, when it comes to employment and the way people with mental health problems are supported, I believe we still have a long way to go. And there are 4 different sets of data that lead me to that conclusion. First, according to the OECD, unemployment rates of people with severe mental health problems in the UK are 5 times as high as for people without a mental health problem. Second, a clinical commissioning group outcome indicator on employment and severe mental illness, which was included in the 2014-15 indicator set, which was published just last December, shows a worrying decline in the number of people in paid employment who have a severe mental health diagnosis, from 43,000 to 35,000, a significant 20% drop. And third, the Care Quality Commission's Community Mental Health Survey for 2014 showed that 34% of respondents on the care programme approach, and over half of respondents not on this approach, said they did not receive support from someone in the NHS mental health services in getting help with finding or keeping work, but that they would have liked it and would like to have been told how to get that access to that support. And fourth, of the 150,000 people with mental health problems on employment support allowance who have been placed on the work programme, just 6.7% have been helped into work. Now, that's compared to the 25% success rate for those without a health condition. For me, this shows that there is a huge amount still to do. But it's worth saying, whilst the national average employment rate for people with severe mental health problems has dropped to 5.7%, a number of areas are achieving higher levels of employment for people with severe mental illness, such as Wokingham, Mid-Essex and Aylesbury, all of whom are achieving rates of 20%.
Would you give way?
Of course.
Thank the honourable gentleman for giving way. Would you not agree with me that there should be scope for the use of individual placement and support for those with serious mental health issues? And I know the government has been piloting some individual placement and support programmes. I'd be interested to hear from the Minister actually later about whether or not they're proving to be successful in getting people with severe mental health problems back into work.
Yes, and I want to come on to that, and I look forward to what the Minister will want to say about the pilots and where they have got to and the intentions going forward. But I think it's inescapable that back to work support that is designed primarily around physical health problems and disabilities are poor at meeting the needs of people with mental health problems. And where the support is well designed, it has so far not got the reach or take-up necessary to make a difference. For example, the Access to Work Mental Health Support Service was described in the SACE review as the best kept secret in government. because, despite its success rates, 90% retention rates, for example, very few people have been helped. Just over 2,500 people with a mental health problem since the service started in 2011, on the most recent data I could find. Now, the potential is good, and that is important and clear, but more needs to be done to ensure we have take-up of programmes like this so that people can get the advantages that they obviously provide. Now, over the past 2 years, I've had the opportunity to chair an independent commission on mental health for the think tank Centre Forum and co-chaired a task and finish group with Marjorie Wallace, the Chief Executive of the charity SANE, on mental health and employment. And that task and finish group's work has led to the NHS adopting an employment-based indicator. It's also led to the development of a new commissioning incentive for NHS organisations to provide support for adults in contact with secondary mental health services to gain or retain employment, and it's also helping with the drafting of a new nice quality standard on schizophrenia with a specific reference in that to employment. I will indeed.
I've been listening with great interest to my honourable friend's very good speech, but would he agree with me that the incidence of mental health problems increases the risk of unemployment, but the fact of unemployment itself also has the capacity to induce and exacerbate mental health problems from those who find themselves in a distressful situation of being unemployed?
Very shortly, yes and yes, and particularly with regards to severe mental health such as schizophrenia, it can lead to a 65% increased likelihood of not being in employment unless properly supported. So there is clearly an issue. Indeed, SANE's report into schizophrenia and employment revealed that out of those who were not engaged in employment or related activities, 59.4% said they would like to be. And when you consider that about 45% of people who receive a diagnosis of schizophrenia recover after one or more episodes, but about 20% show unremitting symptoms and disability, with the remaining 35% showing a mixed pattern of varying periods of remission and relapse, there are clearly important issues about the way one tailors support for people with those conditions. Even those healthcare professionals who acknowledge the importance of work often hold the view that people with schizophrenia will be better suited to low-skilled and low-responsibility or non-competitive work. This is a fallacy. This is a mistake. It needs to be challenged very vigorously indeed, and we need tailored programmes that fit the individual's circumstances, abilities and needs. And the evidence of the beneficial nature of work for people with schizophrenia include increasing social skills, enhancing opportunities for the development of friendships and social connections, learning new skills, financial rewards, and of course stabilisation of their condition. It does bring clear health benefits. Research shows that those in paid employment are over 5 times more likely to achieve functional recovery than those who are unemployed or in unpaid employment. So last year, my right honourable friend, the Minister for Care Services, launched a programme along with ministers from the Department of Work and Pensions to pilot better ways of coordinating mental health services and employment services. And the pilots are testing a number of different approaches based on recommendations from the RAND report. And this work points the way to a more tailored approach to meeting the needs of people with mental health problems. And as I said earlier, the work programme helps just 6.7% of people with mental health problems into work. In some cases, the way different parts of the back-to-work system work has the unintended consequence of pushing people further away from the workplace, and that can't be what anyone would want. So what next? First, I think the goal needs to be clear going forward. Just as we have said that we want to close the scandalous life expectancy gap that exists with regards to mental health, that 20-year life expectancy gap that we know about and we must do more to tackle. We also need to close the opportunity gap that exists. Currently, just 5.7% of adults in contact with secondary mental health services are in paid employment. Yet in some areas, employment rates are as high as 20%. Surely the goal should be to achieve at least 20% rates of employment by 2020 across the whole country. And this means building on the learning from the pilots. It also means acting on the evidence of what works. In particular, it means much more use of individual placement and support that my honourable friend was talking about just now. Because individual placement and support has been shown to be twice as likely to enable people with severe mental health problems to enter work as any other employment support scheme. IPS works to secure paid employment that matches the person's interests and aspirations by co-producing a plan of action, rather than requiring them to undertake certain activities. Support continues once the person gets a job, and these schemes are often based in secondary mental health care services, and they are integrated with the person's health support. A recent psychological wellbeing and work report by RAND for the government estimated the cost-benefit ratio at 1 to 41 for this approach. In other words, the government saves £1.41 for each pound it spends on IPS models. Now, where is IPS already in use? Well, where it is in use, it is delivering very positive outcomes. For example, Workplace Leads, which is part of Leads Mind, has a specialised service, using individualised, tailored and collaborative approaches to enable clients to meet their goals. And Workplace Leads uses the IPS model. It includes CV building, interview skills, job search and tailored applications, as well as confidence building, one-to-one sessions, advice and benefits, and practical assistance to overcome barriers such as childcare difficulties or public transport. It offers peer employment support interventions to develop confidence and shared understandings of the struggle to get back to work. And it recognises that there is no quick fix, and that the journey can be a long one, and it can sometimes take a lot of support for clients to achieve the goals, such as volunteering or training along the way. And whilst work is the focus, that's the outcome that people are striving for, that there is a recognition that the journey itself is important and needs to be properly supported. And I do think, as I say that perhaps that story of Anne-Marie and what happened to her could have been different if she had had access to that sort of support when she returned to work. And support is delivered in partnership, in this case, with the mental health, social care and housing services, all of whom play a crucial part. And there is the partnership with the secondary mental health services. And they also, and I think this is critical to the evolution of services in this area, they've worked in partnership with Job Centre Plus to identify the gaps in service provision. In other words, joining up at a local level, a devolved approach that actually seems to work. Now, the annual cost of this approach in Leeds has been put at £5,819 compared to £13,700, which is the cost of the work programme for supporting an ESA claimant. So I hope that one of the things that will come out of the pilots, and I look forward to what the Minister says might be his aspiration for this government and indeed future governments, that a future government will put in place a programme to improve access to IPS, rather like previous governments introduced a programme to improve access to psychological therapies. We need that level of drive and determination to make sure this evidence-based practice becomes the norm, not the exception, which it is at the moment. Now, finally, surveys find that mild to moderate mental health problems, including stress, anxiety and depression, are the most common reasons people are signed off work. The figure that is quoted is £26 billion every year is the cost to the economy. And that's an average of more than £1,000 for every employee. So it's in everybody's interest and everyone's business to actually make sure that we properly support people in the workplace. And whilst there are great employers who really get mental health and its impact on their employees in their businesses and do take the necessary steps, there is still so much more to be done. And I do just want to, as I bring my remarks to a conclusion, ask the Minister whether or not one of the things that we could do more is make better use of the role of the Health and Safety Executive, sometimes maligned as a body, but actually some years ago it developed new tools around stress audits, which could be used by employers, again perhaps in the case of the story I gave of Anne-Marie. If that company had used a stress audit, it may well have identified some of the things it could change before she got to a crisis and had to leave work. And I hope perhaps the Minister can say more about how the HSE and the work it has done in the past could be updated and become part of its day-to-day practice in the future. And with that, Madam Deputy Speaker, I hope this debate today will generate a useful exchange across the chamber, but also demonstrate again that there is a commonality of purpose here, a recognition that for far too long these issues of mental health have not had the time or the focus or the priority they should get, that they are getting that now, and that we will make progress in the next Parliament to come, because if we don't, we are not just costing our society a huge amount, we are costing individuals a fortune.
The question is, as on the order paper, Kevin Jones.
Speaker, can I say what a privilege it is to follow the right honourable gentleman for Sutton and Cheam?
This debate is an important one, but it also sends a message that, again, this chamber is discussing mental health. And I will say, and I'll say it time and time again, the more we talk about mental health, the better. And to speak out on the floor of the House in the main chamber, I think sends a clear message that this House, on all sides, are taking mental health seriously. Now, it is quite clear that work is central to most people's lives. There are also mountains of research that the right type of work is actually good and positive for somebody's mental health. Madam Speaker, in the debate today, I just want to touch on three main areas. The first is mental illness and the benefits system, because I don't think you can not talk about unemployment without talking about the benefits system. The second one is how we actually manage long-term mental health problems in the community, because we have to be realistic. There are individuals that will not be able to work or hold down full-time jobs, and we need mechanisms of being able to manage those and support those people in the community. The third point, I think, is an important one related to unemployment, is how mental health is dealt with in the modern workplace in the UK. So I think many people would ask, Madam Speaker, why is mental health in the workplace important? Well, to coin the phrase of I think it was from Bill Clinton, well, it's quite clear, it's the economy, stupid. Bad mental health is bad for the UK economy. The UK report on mental health in the workplace, commissioned in 2014 in February, estimated that it cost the UK economy some £70 billion a year. That's 4.5% GDP. Now, I know that in the current climate, that those figures that were drawn up by both using DWP data and OECD Eurostat labour market figures, I'm sure that, for most Chancellor of Exchequer, that type of a reduction in that type of GDP would actually be something that would be welcome. But there is also another important issue here, Madam Speaker. It's actually good for the individual. In a decent modern society, we should actually make sure that people are not harmed by the work they do. Their mental health is not harmed by the work that they do. And remember, it is not just the individual that is harmed, it's the families in many cases as well. Now, the Honourable Member for Sutton-Cheam raised the issue around the number of individuals that are on employment and support. Some 46%, according to government figures, are actually have mental health issues in terms of their claim for employment and support. Now, we've heard the rhetoric over the last few years from the government about trying to be tough on welfare claimants and get people off benefits, and no doubt in the next coming weeks in the run to general election we'll hear more of this type of rhetoric. I'm not sure that it actually helps the situation in terms of people who are suffering from mental illness who are claiming benefits. Madam Speaker, it's quite clear, and the evidence is there, that the work capability test has been a complete disaster for people who have mental health conditions. It's also, Madam Speaker, been a complete financial disaster for the government. It doesn't work for the people it's supposed to support, and it doesn't actually help the taxpayer in terms of the way in which it is actually operating. I will.
Forgiving way, he mentions the situation in the workplace regarding mental health. I was very interested in the point the Honourable Gentleman made from Sutton-Cheam about the Health and Safety Executive enlarging its role in that area. I wonder what he thinks about that. Could they play a part in that?
Well, I don't do, because if you there seems to be I think something that somehow the Health and Safety Executive is something to be afraid of for business. I know from my working with them in a previous life, they were actually good at driving up standards and productivity in workplaces, not just about around the Honourable Member for Sutton-Cheam mentioned around stress, but actually making sure that the working environment is actually safer. So I think, yes, there is an opportunity there. But I've seen from my own constituency, and I'm sure honourable members and right honourable members who are present here today have seen the merry-go-round system which we've got in terms of the work capability test. Monday, so it goes a bit like this. You are assessed by Atos, by people who have no mental health training whatsoever. You fail and are deemed fit for work. You then put into the work group. You then appeal that decision and have your benefits reinstated. And there's the ludicrous situation. Within a matter of months, you get recalled yet again to Atos to go on to that merry-go-round yet again. That is not only bad for the individual, Madam Deputy Speaker, it's also a complete waste of taxpayers' money. The idea that not only the cost of the assessments, but the cost of the appeals, and we know that the appeals system has been, overloaded with people and had to employ more people. It is just not an efficient way of dealing with these individuals. Now, charities I know in the North East, such as the Mental Health North East, have explained this expensive merry-go-round and have done very good reports in terms of the numbers, hundreds of cases in the North East of England, of people that are on this merry-go-round system. It's the most tragic, I think, in terms of not only the effect it actually has on those individuals, but the families as well. And I would argue in some cases, Madam Deputy Speaker, it actually puts back people's mental health rather than actually improves it. And we have seen, and I don't think we should shy away from this fact, that there have been some cases nationally where, because of the Atos system, people have taken their own lives. And that is something no government should be proud of. And I also think that the pressures that people are under, not just in terms of the effects of the work capability test, but also in terms of the economic downturn. And we've seen the statistics that came out last month, where the number of suicides now, touching just over 6,000, are actually higher than they were 2 and 3 years ago. In the North East of England, surprisingly enough, it has the highest number of people in terms of regions of people, young men mainly, committing suicide. I find it very uncomfortable that in the year 2015 that we have a system whereby that it puts these pressures on individuals, and the fact that the major killer for men aged 20 to 34 is actually suicide. Now, this is something we need to address, not just because it is the right thing to do, is there's an economic case behind that, because that's 6,000 people who are not making a contribution to the economy of this country. It also, remember, it is 6,000 families which are going to be hugely affected by the loss of a loved one. Each one is a personal tragedy, each one like a ripple has an effect on an entire community. And I think it is important that we address this issue because we cannot have a situation where avoidable deaths are going unchecked. And I'm one that clearly thinks that whatever happens after May, I think on a cross-party basis, the issue around suicides and mental illness needs to be taken forward on a cross-party basis. Now, in terms of the government's response to the Atos merry-go-round, as I call it, the Honourable Member for Sutton-Cheam is right. They have actually done they've actually finally, after 4 years, worked out that it's not an effective way of dealing with people with mental illness on benefits, and actually have put in place some of the pilot schemes, which I've got to say I think are broadly in the right direction. But I would like to ask the Minister, like the Right Honourable Member for Sutton-Cheam, is what is the timescale for rolling these out across the country? Because I'm also of the opinion that what we need to do is take people out of this system who have got mental health issues. Now, I'm not arguing for 1 minute, Madam Deputy Speaker, that these people should not be assessed in any way. They should. But putting them through the Atos system is not the way to do it. And I think if we can make sure that we get the individual help and care that they need, it will not only help the individual return to work or actually gain access to work, it will also, I think, save the taxpayer a great deal of money.
Just on that point, and one of my honourable friends is making a very powerful speech, but wouldn't he agree that at the really heart of this, certainly in my constituency, What we know is that what we need is sensitively trained, highly professional people dealing, not an Atlas type, untrained person, highly trained people, whether they come from the health sector, fully professional, or they come, as in my own constituency, from a lot of the voluntary and social sector.
Well, I'm very pleased that honourable friends raised that, because that's the area which I'm going to go on to next, into the important role that there is here for the community and voluntary sector. But an alternative system needs to be explored, Madam Deputy Speaker, and it is important that if we come to the conclusion that some people cannot work, we need to be able to offer them alternatives. And like the Honourable Member for Sutton and Cheam, I'm a big believer in voluntary and charitable work. If people can't actually hold down permanent jobs, and that's not necessarily their fault, it's possibly in terms of some of the employers who can't necessarily understand that someone who's got a severe long-term mental health problem is not going to be able to turn up to work every day. Why don't we allow them to do voluntary work? It improves their own position, but it also gives something back to society. And we all know that social isolation of individuals is one of the worst things possible for people's long-term mental illness. And I think in terms of trying to get those individuals, making not only some contribution to society, but actually helping them, it would be very important. But I think, as my honourable friend said, the charity and voluntary sector have a key role to play here in terms of not only the getting people back into work, but also in terms of the long-term management of people with long-term mental health conditions in the community. But the government talks a lot about the community and voluntary sector. And we have the Health and Social Care Bill, which I've got to say, I got scorned for this by some people on my own side, but I actually thought there was an issue in it which was actually helpful. And that was the idea that we could commission the third sector to deliver local services. The problem is, Madam Deputy Speaker, in practice, that has not happened. And it's not happened because of the way in which contracts are being let. They're too big, they're too complex, and there's not the capacity in a lot of these organisations who are doing fantastic work at the local level to bid into those contracts. But I actually want to say what the scandal is of the present system. In my own constituency, I have a great organisation called the Just for Women Centre in Stanley. It's run by Linda Kirk, a former businesswoman, and Listerine Tweedy. And it caters for women who are suffering from domestic violence, obviously mental health related issues, and people who have been on probation. Their model is very simple. And their model is this, is that you use counselling, you use support and crafts to actually support the individual to look at their underlying mental health issues before you actually get to getting them into work. They're individual tailored programmes which lead sometimes to individuals being there in 2 years, but their success rate is fantastic. And the cost, Madam Speaker, is less than £800 per job placement. That is in stark contrast to what the government is paying, is nearly £4,000 for some of the companies like Ineos and others who are getting people into work. But it's even worse than that, is because what is happening with small charities such as the Just for Women Centre is not only they cannot bid for the contract, but what is disgraceful is that women that come to them are also on the books of Ineos. So what happens is when they actually get them into work, Ineos ring them up and ask them, have they got into work? They say yes. Ineos claim the money, but the Just for Women Centre, the charity, doesn't get an actual single penny for it. And I think that I would like to know if the Minister could look at this in detail, because it's not just happening in County Durham, it's actually happening elsewhere as well. So we need a method in which small charities can actually access these contracts and would do it, I think, a lot cheaper, a lot more cost-effective way. But we also need, I think, a system of how we're going to manage people long-term in the community. And again, a fantastic centre in Durham called the Warrington Street Centre. And can I pay tribute to Steve Mansfield and his staff and his chair, Professor Fred Robinson, who through education, therapy and other activities manage people in the community. And just like the Just for Women Centre, they can't actually access any of these contracts and have to rely on the charitable sector and charitable donation. We all know that sector is being cut. So we need some method by those organisations can actually get that. Can I in closing, turn to another issue finally, which is the issue around mental health in the workplace. Now, I'd like to focus on this because I think it's a subject we don't actually talk a great deal about. I've already said that it's costing this country some 4.5% of its GDP, and if you just reduce that by 1% or 2%, I'm sure most Chancellor of the Exchequer would be salivating at that type of saviour. So, it does raise the question why it is that this is not a higher priority, both for government but also for UK PLC. And I think it's quite simple. Partly it's culture. It's cultural by the fact that in this country the best way to do things is to work every hour God sends you, and somehow you'll be more productive. And also that any talk about mental health in the workplace is fluffy and conceptual. Well, I've got to say, at least some businesses like BT have actually taken this on and are actually addressing mental health in the workplace. And they've done it because they've taken a board-level decision to do this. And they're working very closely. I've got to congratulate the Communication Workers Union for the work that they're doing in terms of BT and working with management to put in place not only the support mechanisms, but also the early warning signs and awareness campaigns around mental health. And I think it's this type of approach which leads to the situation whereby the results speak for themselves. In terms of BT's case, they've decreased by 30% in the last 5 years the number of their employees that are actually off work through sickness absence because of mental health problems. They've had an astounding 80% return rate for those that have been off with mental health illness for more than 6 months to return back to work, and that's against a national average of less than 20%.
Honourable Member for giving way. He's making a very powerful speech, and the examples he gives from BT are very interesting, because isn't it the case that what we need to do is flip the way that we think about mental health in the workplace? It's not a problem to be managed, it's an opportunity to be taken. Because a lot of people who are on a mental health recovery journey can be some of the most creative and productive employees in a particular organisation. So we need to embed it into HR practice and drive productivity that way.
And what it needs to be about isn't about mental illness, it should be about mental well-being in the workplace. And, BT, when I've spoken to the medical director there, I said, why did you do this? Is it for some, altruistic, being a good corporate citizen point of view? No, they're doing it for hard brass tax reasons, that this is good for their business. They see the fragility in terms of their employees and the risks in terms of poor mental health has been a risk to their business model. And I'm sure it's the case in all other types of businesses. So they've actually recognised this and have put the mechanisms in place. And we need, Madam Deputy Speaker, to have a system where this is rolled out amongst other companies in the UK, because.
I thank Morrice for giving way. He's been making an incredibly powerful speech. I thoroughly agree with what he's saying about mental health in the workplace. But he also paid tribute to the work of organisations like mine that are now producing specific training packages for dealing with mental health issues in the workplace. Because as he says, it's a huge cost to organisations and the individuals involved. I think it's the #1 cause of absenteeism in the workplace at the moment, and we need that systematic training across all workplaces.
Well, I do congratulate mine for their mental health training, and I shall come on to suggest in a minute when I wind up what actually I think is the next step for government. But yes, I agree totally. What they're doing is not just in terms of raising the issue around stigma, but actually talking about it is very important. I'll give one.
For giving way, and I'm listening with great interest to what he says about bringing people with mental health difficulties back into employment. I hope he will acknowledge the work that's done by Disability Confidence, which is a scheme which is supported and run by the DWP, and which recently ran a presentation in my constituency, which a number of large employers were brought to and for the very first time challenged with the opportunities there are, as opposed to defining this as a problem. There is a big scope, I hope he would agree, for this to be taken beyond the pilot stage across the whole country.
I think in terms of making it a must for business, I think that's one of the big tests we've got to do. In terms of the next government, I mean, I would like whatever shade or complexion it's going to be, is one of the things that we should do is make this compulsory in terms of, my honourable friend from Coventry South raised earlier about the Health and Safety Executive. I think there's a key role for them to play in this. But this should not be seen as a threat to businesses. This is actually about helping businesses, irrespective of size, to actually perform better in terms of not only being good for their individual employees, but actually more productive in terms of the economy. So, in closing, Madam Speaker, I would just like to say this, is that there's a huge challenge here. We've got to take this issue seriously, and it's got to be tackled and not just seen as a health issue. This has got to be tackled across government. And I just hope, like I say, after May, whichever government is in power, and certainly if it's one that I'm, my party and I'm involved in, I will be arguing very strongly for what we need here is a cross-government initiative which involves all government departments who ask that question, what are they doing in terms of promoting good mental health, not only in their own departments, but in terms of developing the policies which are actually vitally needed. Because if we get this right, this makes economic common sense. It can grow the UK economy. And I think if you put it in that type of dynamic, I think it makes certainly people sit up and think in terms of making sure that this actually becomes a reality.
Charles Walker.
Thank you, Madam Deputy Speaker, for calling me to speak in this important debate. Madam Deputy Speaker, mental health in the workplace is undoubtedly hugely important, but mental health is a continuum throughout life, and mental health starts in the earliest years. It's a matter of the relationship between a young child, a baby, and their mother and father. And if we can improve those early years, then we improve the chances of that child having good mental health throughout his or her life. It's about resilience, and it's about building resilience. Again, Madam Deputy Speaker, I'm sure you will be concerned, as I am, that when you see headmasters in primary and secondary schools, they will now talk about the levels of self-harm in their school. And this is extraordinarily worrying, that we have young children of primary school age, children at secondary school, who are now self-harming, that they feel so desperate, so out of control, so out of touch perhaps with their peers, that the only way they can relieve that pressure is through harming themselves, through cutting themselves. And of course, mental illness manifests itself in other ways, such as depression and a feeling of isolation. But, Madam Deputy Speaker, if we are to enable workplaces to flourish, then we need to ensure that our young people can flourish. And I would urge the government, in looking at the mental health piece, to see it as a joined-up continuum, and that without good mental health in the early years, without good mental health in schools, we will not have good mental health in the workplace, despite the best efforts of employers. Now, the truth is, as my right honourable friend has identified, and my honourable friend from North Durham has identified, is that the longer you are out of work, the less chance you have of rejoining work. And I remember a couple of years ago, President Obama's mental health advisor came over to the United Kingdom to speak, and they've done a huge amount of work in the United States in this area about exclusion from the workplace. And it just is simply the case that if you have a mental health crisis at work and you leave that workplace for what is even deemed to be a short period of time, your chances of returning are diminished, and the longer you are away, the less and less chance you have of getting back into any form of work. And again, we need to be mindful of that, and I congratulate the Minister for recognising this, and I know he's doing some important thinking in this area. I read an article yesterday in the Evening Standard in which the Minister's leading efforts to ensure that people who've been out of work for a long period of time have the pathways back into work. And why is work important? Well, work is important because actually, a lot of the time, it's fun. It's not fun all of the time. Nothing is fun all of the time. But a lot of the time, work is fun. It's challenging. It's where we socialise. It's where we meet and make friends. It's where we become part of a team. It's where we achieve. It's where we have success. And it is sad to think that there are people who have mental health problems, a period of mental unwellness, who are excluded from this environment, from all those successes, all the things that we enjoy and on occasions take for granted. And my honourable friend from North Durham, and I call him my honourable friend because I've known him for so many years and we've talked about this on so many occasions, it would be churlish of me to call him anything but my honourable friend. My honourable friend made a very, very insightful and incisive point. What does success look like? Because success will not always be going straight into a full-time job. Success actually may never be going into a full-time job, but success may be leaving your flat or your home and doing some voluntary work for the third sector, perhaps starting off as 1 or 2 days every couple of weeks, going to 1 day a week to 3 or 4 days a week, engaging with your community, being part of a team, being valued and appreciated as an individual. Now, of course, I hope that the option of progressing back into full-time work is available to all people. But let us not set this as the only benchmark, because for some it will be unobtainable. What we need to make sure is that there is a way back to some form of engagement in the workplace that meets the spiritual and emotional need of people who are recovering from a mental health setback. And a number of colleagues, quite rightly, have focused on the efforts of British Telecom. And I would like to also mention Legal and General, because they recognise that mental health impacts all their performers. And when I say all their performers, I include their high performers in that as well. Now, a good employer shouldn't want to lose anyone for the wrong reasons, but they certainly don't want to lose their best and most productive employees. And I don't think there's anything wrong with British Telecom making a commercial decision that it's in its interests to ensure that it supports its workforce, and they are to be applauded for that. But again, as my honourable friend for Durham North observed, and my right honourable friend for Sutton-Acheen observes, where are the other employers? I mean, we know they're out there. They've got to be out there, because it can't just be two. It can't just be BT and Legal and General. But they need to make some noise. We don't want them being shy. We want them to stand up and say, standing shoulder to shoulder, that this is important to us. Because the more that say it, then the more companies will also want to stand up and say it. And then we'll get a movement going, and there's nothing we prefer more in this place than getting a movement going. We will have a lot of voices in unison saying this is important to us. Voices that employ maybe just a few people locally, up to tens of thousands of people nationally. And Madam Deputy Speaker, again has been observed here. We cannot separate mental well-being from physical well-being. And of course, many employers now have company gyms and all sorts of schemes to get people fit and healthy physically. But of course, mental well-being is just as important, perhaps even more important, and that's where some focus and emphasis needs to be. Now, what we also have to do is make sure that people who are in a period of difficulty and turmoil have good coping mechanisms and strategies. And again, the employer can be at the forefront of that, because too often, it's not always the case, but too often, people who are struggling find their coping mechanisms tend to revolve, or can revolve, around substance abuse and misuse. And that is in no one's interest. It's not in the employee's interest, it's not in their family's interest, it's not in the employer's interest. So what we need is we need employers at the forefront, not just looking at the physical health of their staff, but also placing a huge premium and emphasis on the mental well-being of their staff.
I'm very grateful to my honourable friend, and he's making some incredibly important points. And particularly, I just wanted to ask him what he thinks about the possibility that there should be a requirement, voluntary or otherwise, on companies to report on their human capital, because that is a very important risk factor for investors in companies if they are not properly looking after their staff, and their staff have higher turnover rates as a result of that. I wonder whether that's something that might create a push to get employers to focus on these things more.
I think my right honourable friend makes a very good point, and I will conclude my speech in answering that point. Most companies like to talk about the importance they place on human capital. Most of them talk about it. I suspect very few of them do it very well. And again, that's why I think it is so important for good employers who are doing it to stand up and say, this is what we're doing, it can be audited, and you can prove to yourselves that we are doing what it says on the tin. So my right honourable friend makes a very good point. Now, I am not into naming and shaming companies. I'm not into coercion. I think that's the wrong way to go. But there has to be a premium and a reward placed on good practice. And perhaps in concluding, I would join my honourable friend from Durham North in saying to government, we need to give that some thought. We need to give that some thought. We don't want to come up with a stick. We want to come up with carrots. So good employers are celebrated and celebrated loudly.
Jim Shannon.
Thank you, Madam Deputy Speaker. First of all, can I congratulate the honourable gentleman for Sutton and Cheam for setting the scene very well for each and every one of us. To the honourable member for North Durham as well for his impassioned plea in behalf of those who have mental illnesses and who need employed, and the interventions of those gentlemen, right honourable and honourable members who have made a very detailed contribution. We look forward to the Minister's response, because this issue is one that concerns us all. Whenever we have debates in this House, Madam Deputy Chair, these, I have to say, are the sort of debates that I like to be involved in, because these are the debates of the nitty-gritty of our constituencies. These are the debates and the issues, the people who come to our office every day, and these are the issues that they wish us to speak on. I can also say I deal with these issues every day in my office. Every day we see people who are struggling to cope with mental health illnesses and issues. These are made worse by the times we live in, and the pressure on those in work and also those in benefits. And the honourable member for North Durham mentioned about benefits and that issue. I've seen of late greater need in people who suffer from depression, as they've had to deal with issues with which they never had to deal with before, ever in their life. Poverty.org has said people who are working are at much lower risk of mental illness than those who are either unemployed or long-term sick or disabled, with the proportions assessed as being at high risk between 10 and 20% for those who are working, around 30% for those who are unemployed, and 50% for those who are long-term sick or disabled. One of the greatest issues in my office, Madam Deputy Speaker, is the issue of the benefit system. I have a lady in my office, one of my staff members, who does nothing else now but benefit issues. It's because of the enormity of the change that has come through. The honourable member for North Durham referred to the ESA merry-go-round. Yeah, we've all experienced that. I've experienced ones where constituents have had to, and 3 times in 1 year, do the ESA again. I really fail to understand why that happens. Is it that dramatic a change within 4 months every time? Is there a dramatic change within 6 months? I mean, I understand the system and the need for it, but I do not see the need for a regular 3 times a year assessment of someone who is very clearly ill at that time. I want to speak and give examples. We get all of our examples, and the honourable member for Sutton and Cheam gave an example of one of his constituents. I'm not going to mention any names, but I'm going to tell you what the story is. I've recently helped a young lady of 32 years of age with her DLA form, who suffers from chronic inflammation of the bowel. Very, very serious case of this. And over the past 5 years, she's had to go down to part-time hours, and eventually she lost her job due to her periods of sickness. This in turn has led to her suffering from depression, which has made her illnesses worse, and she is now at a stage where she can't go out to work, and being in the house just makes everything worse in her life. As she said to me, even if I'm well, Jim, who's going to hire me with my record? I just can't see any light in my future. That was her words, and it was a terrible thing for this young girl to say. And these are examples of our constituents, and there are many of them that worry us and concern us. The question I asked myself after this appointment, wherein this girl said little, and her mother outlined most of the illness, was what is the system doing to help her and others in her situation? It is undoubtedly the inability to find a job or to be able to work is a massive factor in mental health. And with all respect, I seriously question that the system is right in this circumstance, and many others would have examples of that as well. The honourable member from North Dermot referred to isolation, and I'd just like very quickly to make the point for those in rural isolation. Because I have a constituency that is fairly well maybe 50-50 in relation to urban and the countryside, I'm aware of the rural isolation of those people who live alone, who are unemployed, who have little or no family contact, who every day is a challenge in their homes. Those who are, as a result of their unemployment and their rural isolation, become depressed. These people we've got to reach as well, and it's something that burdens me greatly. The information on the website continues saying that research suggests a connection between the conflict and the risk of mental health within Northern Ireland. And if I could, Madam Deputy Speaker, mention the issue of Northern Ireland in particular. I know the Minister has heard this before, and the Shadow Minister as well, and others may have heard it before, and I know they have. And we had a 30-year conflict, and during that conflict we had a greater numbers of those who were affected emotionally and mentally by what took place. The greater the extent to which someone's area or life is affected by it, the greater the likelihood that they have poor mental health. How far the conflict explains the overall levels of mental health in Northern Ireland is less clear. Among those who chose to answer questions about their experience of the conflict, 7% indicated that they themselves had been injured during it, while a further 36% indicated that a close relative or friend had either been injured or killed. And if you put these two figures together, it implies that in the early years of this decade, almost 500,000 people in Northern Ireland have been affected by the conflict in this way. And that gives you an idea of the magnitude of what took place in Northern Ireland and how it's affected us who have come through that. The figures show that mental health is a greater issue in Northern Ireland than it is in other parts of the United Kingdom. When someone is under pressure or stress or worried about whether they will live or die, they turn to drink, to drugs, to other things that affect their lifestyle. And ultimately, a great many people in Northern Ireland suffer from depression and mental health issues because of our country's past. There's an advert in Northern Ireland that we have, and it's, you know, when you think about it, I expect it's the same across the whole of the United Kingdom. And that's the young boy who's the life and soul of the party. He's the one that's telling the jokes, he's the one that's involved in all that's going on. And when he goes home and his friends are all away, the door closes and he becomes a different person. And sometimes you see the outward look of someone and you see them bubbly and seemingly cheerful. But the fact is that whenever they return to their homes on their own, depression sets in. These are issues that perhaps maybe, I know when it comes to the workplace, there's something that the person who works alongside the person in the workplace can make the issue. It's also a job for family and friends to note as well. The Prince's Trust has found that between 10 and 20% of teenagers from Northern Ireland will suffer from depression at some point in their short period of life. Over 1 in 3, 35% of youngsters here had experienced mental health issues, compared to the United Kingdom national average of almost 1 in 5 of 19%. It shows a greater level of depression amongst those of a younger group in Northern Ireland than there isn't anywhere else. It also revealed that long-term unemployed 16 to 25-year-olds are twice as likely as their peers to be prescribed antidepressants and believe they have nothing to live for. We have a role to play. Indeed, I'm going to mention later on in my contribution, Madam Deputy Speaker, about the suicide rate. But we've had, unfortunately, a large number of young people who have been unable to cope with life and took what they felt was the only way out. And again, I would like to hear from the Minister. I know that his response will be very positive, because it always is, in relation to what we can do together to make this better, or try to solve some of the problems, and we look forward to his contribution. Ian Jeffers, Director of the Prince's Trust in Northern Ireland, said the report comes at a time when long-term youth unemployment has shot up by 197% since the start of the recession in 2008. While saying that, it would be remiss of me not to make the comment, because I took the opportunity to check the unemployment rates for February of this year, and it has shown a clear drop of 17.9% amongst young people over the last 12 months, so that there are steps being taken to create employment opportunities. And when you look at the overall unemployment for Northern Ireland, the jobs have been created, almost 10,000 jobs created over the last period of time as well in Northern Ireland. Unemployment has proven to cause devastating, long-lasting mental health problems amongst young people, is what the Ian Jeffers said. Thousands wake up every day believing that life isn't worth living after struggling for years in the dole queues. Across Northern Ireland, 5,000, and there's still work to do, 5,450 young people are facing long-term unemployment, and there's a real danger that these young people will feel hopeless as well as jobless. The research also highlighted that people suffering from depression would be less likely to ask for help in the circumstance. And the poll also revealed the polls give a very good, accurate flavour of what is happening. Over 1 in 3, 34% of young people have said they always or often feel down or depressed, compared to a national average of 32%, with the long-term unemployed significantly more likely to feel this way. 1 in 4, 29%, said they feel like an outcast, compared with 24% nationally, with the report finding that the long-term unemployed are significantly more likely to feel this way. More than 1 in 5, 21%, admitted that they feel like a waste of space. Well, often have you heard that comment, and we've probably said on many occasions frivolously, but for these young people, they react to it in a much, much more difficult and serious way, against a national average of 17%, with the long-term unemployed more than twice as likely to feel this way. The youth charity Princess Trust said it would support 58,000 disadvantaged young people this year. Around 280 of those surveyed were not in unemployment, education or training. 166 had been unemployed for over 6 months, and 135 had been jobless for a year or more. Almost 1 in 5 young people looking for a job at present cannot find it in today's marketplace. And there is a job, I believe, for us to look at those people who aren't qualified, and we have a problem in Northern Ireland amongst young Protestants who for some reason haven't got the educational qualities that they should have, and there's an issue for us to address. It's a devolved matter, and I understand that, but I suspect that there are parts of the United Kingdom where young people have not qualifications, and they need to have. These statistics are horrifying, and yet not a complete shock. The amount of young people in my office for benefit and housing help is very sad when I think of how much I loved having my first job and getting my first paycheck. And we have a generation of young people who are waiting on their benefit check with nothing else to live for. Is it any wonder that we have a serious problem with mental health issues? Suicide in the community is a great worry for all of us as elected representatives. Every one of us have dealt with families, with people whom we know personally, or with people from families that we know personally who have lost loved ones, who took their own lives because they felt there was no way forward. And I look back, Madam Deputy Speaker, with I probably ask myself this question, as probably many others probably do as well. You ask yourself, if I had known that, could I have persuaded that person in some way not to do what he did, what he or she did? And it's always a very difficult question to answer. But the fact is, we don't know that. All you can do is do your best in this world, and speak to the people who come to see you, and try to give them some hope that they can look forward with a positivity. And these are issues. They were coming off the back of terrible depression or terrible pressure, didn't know where they could go next. NISRA states in their website, and I conclude with this, Madam Deputy Speaker, in 2013 there were 14,968 deaths registered in Northern Ireland. Of these, 303 were suicides, the second highest number on record in Northern Ireland. The highest was 313, recorded in 2010. Just over 3/4, 229 of those suicides in 2013 were amongst young men. And that perhaps maybe highlights the issue of why this debate on mental health and unemployment is so important. Because it's a chance for this House to shine on how it can help those young people to move from their mental health into employment, and how we can help them to achieve their vision that they have, their goal and their challenge for the future. The link between unemployment and mental health issues is clear, and it is time that strategies were in place to deal with this. Are we getting this right at present? I don't believe we are, Madam Deputy Speaker, But that doesn't mean we shouldn't stop trying. For the sake of the families throughout the United Kingdom, of Great Britain and Northern Ireland, we must and we can do better. Thank you.
Adam Murphy.
Thank you, Madam Deputy Speaker. I'm glad that I wasn't sure I was going to be able to make it to the debate this afternoon, given my other responsibilities, but I'm very, very glad that I have made it here. And I want to say thank you to the Backbench Business Committee for scheduling the debate, and thank you to the Honourable Member for Sutton and Cheam for leading off in what is a very, very important debate, not only for those with mental health challenges who are unemployed, but I think actually this is a debate which strikes at the heart of what we're all doing here in politics. Because it seems to me that with millions of people affected, 1 in 4 people will be affected with a mental health challenge in their lifetime. This is at the heart of what it is to be human, to be British, to be part of a democratic society. And right now, in this chamber and across this house and in our offices and across the country, there are probably 1 in 6, 1 in 7 people right this moment struggling with some form of mental health challenge. And what that says to me, this is part of the normality of the human condition, and surely as members of Parliament, as members of government, as lawmakers, we must have this in mind when we're making the laws of the land. Now certainly on the Conservative side of the House, if you like, and perhaps across the House, it often seems that our objective in politics is to seek to have the greatest level of utility for the greatest number of people. But it strikes me that GDP growth, incomes and salaries, the growth in physical goods and services that we can consume is not necessarily the best aim, and I'm not sure that it is actually the fundamental aim that we all share. It seems to me that a better motto, a better modus operandi, a better objective, and I suspect it may be the objective that we do share, is actually to create the greatest level of happiness for the greatest number of people. And what I mean by that is not that politicians, we can work out how to make people happy. That would be preposterous, ridiculous. But there are certain things which are absolutely certain to make people unhappy and to create stress and to create a sense of a lack of control, which actually do lead to a greater prevalence of mental health challenges. When I first arrived in Parliament in 2005, I co-wrote a pamphlet which was entitled The Forgotten. And my chapter was on those with depression who, almost by virtue of that condition, if they're going through an experience at the time of an election, are kind of disenfranchised from society, disenfranchised from the democratic process. And one of my burning passions is to make sure that everyone, no matter what their background, no matter what their mental health condition is able to participate in the democratic process, but is also never forgotten. So certainly we don't know how to create happiness, and I would be very, very nervous if anybody did suggest that they know how to create happiness for somebody else. But when it comes to public services, I think and when it comes to lawmaking, I think there is an awful lot we can do to remove the causes of unhappiness, the causes of depression, or the exacerbating factors which lead to greater levels of depression and mental health challenges. So looking at the causes of mental health challenges, well, certainly there's a degree of genetic propensity. That's becoming ever more clear as the scientific research progresses. And certainly there are specific causes in life, like bereavement, certainly of a close family member. And I thank the Honourable Member for Strangford for his comments that actually in troubled zones, during times of war, during times of conflict, again, the incidence of mental health challenges rise immediately because of those changes in what's going on around people. And certainly mental health challenges can be brought forward or exacerbated by accidents and certainly by the loss of a job or a divorce. So these are known causes or accelerating factors for mental health challenges, and these are some of the things that I think that we can certainly look at when we're making policy. But there's one area which is really almost entirely within our control. And that's why I'm delighted to participate in the debate today. Because when it comes to the welfare system, when it comes to the benefits system, when it comes to the way in which the state enables people or helps people to find employment or to get training or to go through education, these are things that we can have an impact upon. And I was particularly mindful of and supportive of many of the comments that the Honourable Member for Durham North made about actually some of the systems that we introduce for getting people back into work or for identifying if they have challenges. Because one of the greatest forms of stress, one of the greatest forms of pressure which can cause certainly depression and trigger many other mental health challenges is a feeling that your life is out of your control. And when you have a very complicated benefit system, and when you have to jump through so many hoops to achieve recognition within that system, then certainly, I'll certainly give way.
Would you also agree with me that what we need to do in terms of back to work programmes is actually tailor-make them and have a recognition that on some occasions it might take longer than others to get people capable for work, and also have a system which does allow people who have got long-term mental health issues or are not going to work to have at least some positive contribution to make back to society?
I think management's hit the nail on the head. That's precisely it. You know, the distribution of traits within mankind, within the British population, is like a bell curve. Every person is unique. There are very few identical twins, and there are certain mental health conditions which require a longer period for somebody to adjust in order to be able to participate within the workplace or potentially in voluntary activities or making a contribution to society. And I think that any system that we have must be flexible enough to recognise those differences. So a feeling that life is out of your control. Now, can you imagine, and I'll create a caricature here, but can you imagine somebody who has literacy difficulties, dyslexia, who's come from a tough background, who may have just gone through a divorce, who is then presented with forms that can be up to 70 pages long in order to try to get some form of support from the state? For me, that's tantamount to mental cruelty. The idea that somebody who's in a very, very difficult state is able to navigate this incredibly complex system. And then again, we've had cases in the press recently where parents with children with difficulties have been presented with a stream of health workers, of disability benefit support staff, of people from from job centres, people from the council. So again, a stream of people knocking on your door, approaching you from different directions, can certainly again create a greater form of stress and a greater sense that life is not in your control. So I think that we have to be very mindful when we design the public services to be sure that they are fitting for people who may be going through a mental health episode at that particular time. But I want to say some positive things, actually, about mental health and about unemployment and employment. Because it is part of the normal human condition. You know, probably 1 in 4 of us here will struggle with a mental health challenge at some point during our lifetime. And certainly as members of Parliament, I'm absolutely sure that virtually every one of us has seen many people come to our surgeries who maybe present because they say they've got they're unemployed and they're having a challenge finding work and they're finding the benefits system very difficult to navigate. But when they present to us, you begin to realise pretty quickly that actually there's something more behind it, that they do have a personal challenge, whether it's with depression or bipolar or perhaps, in many cases, paranoia, which needs further assistance and further support, and that's sometimes behind some of the challenges that they present to us with. So it seems to me that actually if we're going to have a society that's at ease with itself, this stigma about mental health conditions needs to disappear. And it's part of our job here, in today's debate, but in our daily lives as well, to make sure we're very relaxed about talking about mental health conditions, no matter what they are. And in many cases, actually, I quite welcome the idea that people joke about mental health conditions. Now, I don't mean in a derogatory way, but just that it's part of our normal discourse. You know, you stand by a coffee machine, whether it's here in Parliament, in Westminster, or in a business, and people talk about, oh, yeah, so-and-so broke their leg when they were skiing the other day. Everyone has a laugh and says, how's it going, and writes their name on the cast. In the same way, I'd like that to be, I don't want mental health challenges to be part of a sort of corridor whisper. And we should be able to laugh about them, talk about them. Oh, so-and-so's having a bit of a struggle at the moment. So we're very relaxed about it because it is part of our human condition. The other interesting thing, actually, about mental health, positive thing about mental health, people with mental health challenges in the workplace, is this. Is that, yes, British Telecom have recognised the benefits of employing people who may have challenges, but actually there are a raft of smaller firms that have also recognised the benefits. In my working career over the last sort of 20 years, I say working career before I entered politics, but I suppose this is work as well. But in the world of business and in the world of small business, there are many enlightened small businesses that actually, on many occasions, compete for people who may have mental health challenges, like depression or bipolar. And I'm going to try and put this subtly, but actually when somebody is struggling with bipolar, if they're in a good period, they are exceptionally creative, exceptionally productive, and that's very useful, provided that you recognise when they're in a down period that actually you need to give some flexibility and some understanding. So I think there are a lot of small businesses as well who would absolutely benefit from almost specifically looking to recruit people with certain mental health challenges into particular roles within the organisation. And my own experience, having observed businesses over the years, is those that do recognise these challenges and those that do show the flexibility actually perform exceptionally well. So even if you want to be less altruistic about it, if you want a workforce that actually is really up to the mark, that is really dedicated and loyal to a business and will go the extra mile during good times, then actually this is a great, people who have mental health challenges are a great resource on which to draw. But equally, as one or two honourable members have said, it would be very helpful if there were some sort of guidelines or suggestions or input, perhaps from the public sector, but hopefully from people like Mind and others, to give a template for how to work with certain types of people who have certain types of mental health challenges, particularly in small businesses. Now, when it comes to welfare, and I hope members opposite will just bear with me for just a moment, but when it comes to the welfare changes that the Coalition is seeking to undertake, many of which were initiated under the previous Labour government, I think we have to take our hats off, in many cases, to the direction of travel here. Because it seems to me that one of the greatest pressures that somebody can feel is to be young, to be unemployed, to feel unwanted, and that again can exacerbate a condition of feeling isolated from society. So I think that we need to be very mindful that changes to the welfare system that the Coalition is seeking to make, some of which have been made, they may not be perfect, but they are the correct direction of travel, and I know that many members on the opposite benches agree with this, because if you can help somebody into work, not in a brutal way, but if you can help somebody into work, it gives them that sense of meaning, it gives them that sense of control. It also gives them a sense of well-being, that even if they have a mental health challenge, that actually they're welcomed within a workforce. These are really positive things we can do as members of Parliament to really enfranchise the large minority of the population who will struggle from time to time. Certainly I give way.
I don't disagree with the honourable gentleman if it was the right type of help. But the honourable member for Strangford raised the system, and I think I did as well, about this merry-go-round which we've got, which I've got to say, if you're suffering from a long-term mental health care, is pretty brutish in terms of the way it's done. And it does need refining, because if it's not only wasting money for the taxpayer, it's actually creating a lot of unhappiness and, I think, fear amongst people who've got long-term mental health issues.
And I think we agree. And one area I was going to focus on, 2 or 3 areas where I think improvements can be made. Very significant improvements can be made when it comes to dealing with, working well with people who have mental health challenges. And one of the first ones I was going to come up with, or to suggest, was that when it comes to public services and welfare to work type arrangements in particular, then we need to be very finely attuned to the processes which are undertaken. Because if somebody who has a mental health challenge may present initially as being absolutely fine, and therefore if they're put through a very, how can I put it, you used the word, the honourable gentleman used the word brutal, but if they're put through a very mechanistic process that doesn't give allowances for those kind of challenges, then I think it can sometimes cause more harm than good. I give way.
But one of the fundamental flaws, which I've been raising, and I know honourable members opposite have been raising for a number of years now, is the fact that ATOS assessors aren't even mentally health trained. If there are actually people who've got an expertise in mental health to do the assessment, that would be a huge step forward, I think, in terms of helping those individuals. But the government, frankly, just ignored this for the last few years.
I'm not sure the government have ignored it, because I've actually been in meetings where this has been very carefully discussed. It's certainly on the agenda, but again, I agree with him, and I think that we have an election coming up. I'm sure we'll get to it the other side of the election. But the focus has been on making sure the overall system is shaped in the right way, and it will now definitely. There's no question about it. We agree that it will need refinement to make sure that either the first level of interaction with the system very quickly identifies where people may require a greater focus on their mental health and well-being than the average person. But certainly, and I can give them this commitment that once we're through this short period before the election, if we're both fortunate enough to be here afterwards, then I give him my assurance that I'm very happy to work with him and with many others in the chamber to make sure that these mental health conditions are better recognised or integrated within the process. But there was a huge mountain to climb just to change the system in the first instance, but we certainly need greater sensitivity in that regard. So it seems to me that I remember knocking on the door of a very elderly lady in Windsor about 4 or 5 years ago, and she had received through her letterbox a consultation on whether or not there should be a development locally. And she was clearly struggling with a mental health condition at the time. And she was agonising about whether she should fill this massive form in, this consultation form. There was another form from the council, and there was another form on planning. And I just about, I almost didn't have the heart, but I just about had the heart to say to her, actually, given that what you write on this form, it's a merely a consultation, given that what you write on this form, out of the hundreds that go in, may only have a very small impact on the outcome, you maybe do better off, seeing your family, having relatives visit, and actually enjoying your life. And what I pick out from this is that actually when you have lengthy forms and deeply bureaucratic processes, particularly around those who are unemployed, actually what you can be doing is taking away the quality of their life, and in many cases unnecessarily. So I think a secondary focus for a future government and for what we do here must be to look at the way in which we ask people to participate in our bureaucratic procedures in order to get assistance and in order to get back into work. And one of those key areas to look at is the length of forms and whether or not things can be done a little more quickly, either on the telephone or face-to-face, with a recognition that some people may be struggling with a challenge at the time. I think our responsibility here must be to continue to talk about it. And although it's a quiet afternoon here in the chamber here today, I think we must continue to talk about it, not only in the chamber, but actually in every brief that we may hold, in every committee that we may be participating in every bill that we may examine. I think we must keep it in the forefront of our minds that there is a very large proportion of the British population who are struggling with mental health challenges. So every policy that we create must be designed to reflect that and to accommodate people who may be having a challenge. One other idea which may be of use at some point in the future is that I love the idea of the market. I love the idea of competition between businesses to hire employees. And I love the idea that over time, if we have competing businesses, desperate, with low unemployment, desperate to hire staff, that actually, I hope that in time, that many smaller businesses, as well as one or two larger businesses, will actually put an imprimatur on their website, an imprimatur on their recruitment pages saying that this is a mental health friendly working environment. And the curious thing is, in my view, is if smaller businesses and medium-sized businesses, in fact, if all businesses don't move this route, then what they'll be doing is actually they'll be hamstringing themselves from actually getting the best advantage they can and the best recruits they can from the marketplace. So my vision for politics is I would like to see a country that's at ease with itself, with people from different backgrounds, with people from different walks of life, and included in a country being at ease with itself must be the acknowledgement that there is a large minority in our country at any particular time who has a mental health challenge, but they are equally part of society, and everything we do here must reflect that the policies we create must be user-friendly for people from all sorts of backgrounds with all sorts of conditions. I'm optimistic for the future. Why? Because on the Labour benches, the Lib Dem benches, independent MPs and on the Conservative benches, there is no question whatsoever that we all recognise that mental health is a serious challenge for a large proportion of the population, and that any future government, I am hopeful and confident, will be addressing this issue more so than we have done in the past.
Kate Green.
Thank you very much, Madam Deputy Speaker, and can I thank all honourable and right honourable members who have contributed to what I think has been a very interesting and rich debate, and particularly my thanks to the right honourable member for Sutton and Sheen for introducing in a very wide-ranging speech, I think, all the issues that have then been developed and taken forward by other colleagues. There is, Madam Deputy Speaker, clearly widespread concern about the poor employment outcomes and poor employment experience of people with mental health disorders. And those concerns are wide-ranging. There is obviously a concern about the poor employment rate among people with mental health problems, and the fact that unemployment is both a cause and a result of poor mental health. Particular concerns rightly highlighted by the Honourable Member for Strangford about the implications for young people who experience unemployment at the very start of their adult lives. There are also, Madam Deputy Speaker, concerns about people with mental health illnesses being dismissed or exiting work prematurely, about lack of not just joining the workplace but progression in the workplace, relatively reduced chances for promotion, concerns about lack of support in the workplace for people with mental health problems, and, as was highlighted in the debate this afternoon, concerns about so-called presenteeism, which is damaging both for the health and well-being of the individual and for business productivity. And that, of course, has been highlighted a number of times this afternoon, the concerns about the cost both to the individual and to society. Poorer mental health outcomes are suffered by poorer people who are less likely to be in employment. And we also know that 39% of sickness absence is as a result of mental health problems, amounting to 11.3 million working days lost to our economy each year. And I think we've also heard this afternoon concerns about the wider context in which mental health problems in the workplace arise and are then addressed. There are problems, I think, with people accessing therapies, accessing treatments to deal early with mental health difficulties, and we've heard quite a bit this afternoon, and rightly so, about stigma and discrimination and what can be done to tackle that. I think it's also interesting, and I very much welcome the comments from the Honourable Member, I think it was for Broxbourne, about the importance of dealing with mental health difficulties among children and young people and intervening very early to address those. Because, in fact, many mental health problems begin in childhood, begin before the age of 18, and yet we know that only 6% of spending on mental health services, therapeutic services, is through child and adolescent mental health services. So there's clearly a massive imbalance in the way in which we are spending our resources to address the problems in the pre-adult years as compared to picking up the pieces afterwards when so much damage has been done. And I think there were also concerns expressed this afternoon about the extent to which programmes which should be helping are actually not doing so. And we heard quite a lot about difficulties with the benefits system and problems with some of the work support programmes, which mean that we really cannot be complacent about an employment rate of 37% among people with mental health problems against an overall employment rate of 77%. Now, as we know, as we heard this afternoon, in most cases, being in work is beneficial for mental health, though in her 2013 report for the Government on Mental Health and Work, Dame Carol Black rightly set out a number of caveats to that, including the quality of the job and the degree of autonomy, the degree of control that's enjoyed by an employee. But we also know that people who are not working because of a mental health problem represent the largest proportion of those who would like to be in employment. And the reasons that they are not working are partly as a lack of access to the therapies and the care that would make work possible. And we've heard on many occasions of significant delays in accessing so-called talking therapies, and we must be concerned that one driver of the rise of the number of people who are being placed in the support group of employment and support allowance because of mental health problems may be that people can't get access to the health care that they need. And I think it's also important that we pay attention to the particular anxiety identified by the independent reviewer, Dr. Paul Litchfield, about the very large number of young people in the support group or in work-related activity group of the Employment Support Allowance who have mental health difficulties. And the fact that we are perhaps parking some of those young people onto a benefit without properly intervening early, and that in fact the way in which the system operates in fact exacerbates and encourages a disregard of early intervention, something that I know the Minister in his appearance before the Select Committee recently expressed his own concerns about. Repeated reports have recommended much more effective joining up of employment support and mental health services, and I very much welcome the introduction of specific indicators for mental health and employment in the NHS outcomes framework. But as well as long delays in accessing therapies, we also know that doctors can be reluctant to identify a mental health problem or sometimes fail to recognise that a patient could work or that work would be beneficial for that individual. Now, although the introduction of the Fit Note offers doctors the opportunity of providing more useful fitness advice to patients with mental health conditions, there remains, I think, a significant challenge in ensuring that healthcare services and healthcare professionals support rather than work against the grain of increasing and sustaining employment. We also know that employer fear and stigma play a part in the poor outcomes, poor employment outcomes of those with mental health disorders. Half of employers say they wouldn't employ someone with a mental health condition, although I strongly suspect that a large majority of that half of employers in fact already do. Sickness absence because of a mental health problem too often leads to dismissal under capability procedures or to early exit or early retirement. And the introduction of fees for employment tribunals under this government makes it harder for an individual who's been forced out of work to gain redress, and in fact, I guess, makes it more likely that employers may put people under pressure to leave a job. So, as has been said this afternoon, we do need the workplace environment to be much more effective at supporting people with mental health disorders. A few days ago, I met representatives from my own union, USDAW, who highlighted some of the difficulties that their members face at work. They talked about unrealistic performance targets, about 0 hours contracts and the insecurity associated with them, about low pay, and about the difficulty of balancing family and working life as stressors that people face at work. And these problems aren't confined just to one industry sector. Workers in the public sector, teachers, probation officers, police, those in the armed forces, for example, also experience high levels of pressure and stress. And I think we should also note, Madam Deputy Speaker, that these pressures cut across all levels of jobs, from the most senior jobs to basic and entry-level jobs. In fact, stress is particularly high among lower-paid workers who don't enjoy autonomy and control over how their working day is spent, or who feel that they have low status at work. And in fact, levels of stress among those low-paid, more junior workers can be particularly high. So there are lots of opportunities, I think, for us to intervene to improve workplace support, and we heard some very helpful and imaginative suggestions and examples this afternoon. I was very interested, and I hope the Minister will comment on the role of the Health and Safety Executive in relation to this agenda. There's also, Madam Deputy Speaker, a real opportunity for managers to work with trade union workplace representatives to address some of the issues. And there's also an important role for the public sector as an exemplar employer in having appropriate strategies to support staff, as well as proactively recruiting those with a history of mental ill health, as suggested by the Honourable Member for Windsor, and rightly so. Sir Stephen O'Brien, who is chair of the Barts and the London NHS Trust and who was commissioned recently by the Leader of the Opposition to advise my party on a mentally healthy society, has suggested that accreditation schemes could do more. And in addition, I think we also need to pay attention to manager training, to information in the workplace to enable people to self-refer to mental health services, and the positive use of the Fit for Work scheme, something which USDOR representatives told me people were quite fearful of. It could, in fact, help and be supportive in getting people back to work quickly, and I hope employer bodies will take very positive steps to engage and to reassure their workers about the way in which they are engaging with the new Fit for Work scheme. Now, as we've also heard this afternoon, Madam Deputy Speaker, government has an important role too in supporting those who are out of work because of a mental health problem into employment. And despite a raft of initiatives and pilots described in the government's disability and employment strategy, the number of people being placed in the Employment and Support Allowance support group is rising, and labour market programmes that ought to be getting more people back to work continue to let them down. The work programme has really been a failure, I think, for those with a mental health condition, as the Right Honourable Member for Sutton and Cheam pointed out, getting just 6.7% of them back into work. And I think the black box approach and the national contracting regime have shut out specialist provision, as we heard from my honourable friend, the member from North Durham and others this afternoon. We've also seen a 20% reduction in the number of specialist disability employment advisors in job centres, and as the Minister himself, I think, acknowledged in a written ministerial statement on the 18th of December, access to work last year suffered from quite significant delivery problems, which I think will have inhibited access to some of the support that could have been provided through the mental health component of the Access to Work programme that could have enabled more people more quickly to have functioned better at work. I do think there is a problem with the work programme's absence of a specialist programme for people who have been placed on employment support allowance for mental health and indeed other chronic health and conditions and disabilities, not getting the tailor-made support that they need. And that's why Labour has said that we would introduce a specialist programme of work support for those who have been on employment and support allowance for more than 3 months, which will mean that by commissioning that support locally, we will be able to make much better use of the kind of specialist organisations mentioned by my honourable friend, who have expertise in mental health and employment and who will be able to offer appropriate support. Now, I agree with the comments that were made early on in this debate too about the opportunity presented by the individual placement and support programmes which are run out of a number of NHS trusts. And I had the privilege of visiting the IPS team in South Manchester a few months ago and heard about the successes that they achieve, both in placing and sustaining people into work and in reducing the incidence of hospitalisation. And we know, including from an international study, the Equalise study, that such interventions can be cost effective compared with other vocational support for some people, yet too often people are being referred to this kind of support too late. I will be very interested to hear the Minister update us on the government's thinking in relation to IPS and what the learning is currently. I would also be interested if he'd comment on what I was told in South Manchester, that the NHS is itself funding these IPS programmes, but if work programme providers have referred someone or introduced someone to that IPS service, it's the work programme provider that claims the outcome payment. Now, that does seem a bit mad that DWP is paying a work programme provider when all the work is being done and all the cost is being borne in the NHS, and I hope the Minister might be able to say something about that. Yes, of course I will.
Well, can I just say to you, that's exactly what is happening with the charity which I mentioned in my contribution, is that they're doing all the work. The work provider is doing nothing at all for individuals, apart from making a phone call at the end to try to ascertain whether that person has actually got a job, and then obviously claim the money from the government.
And that is absolutely not how those contracts should be working. And if subcontracting to specialist organisations is taking place from the work programme, then those organisations to whom those subcontracts are being let should be being properly rewarded. So I think we've got a number of problems here. First of all, actually, a lot of local organisations don't have the opportunity or the wherewithal to participate in these programmes at all. And then, as my honourable friend says, those who can participate or do try to participate find that those programmes are utterly economically unviable for them because they're not paid for the work that they do. Finally, Madam Deputy Speaker, I would like to pick up on the discussion raised, which was introduced by a number of colleagues in the Chamber this afternoon about the operation of the benefit system and how that bears on those with mental health conditions and their chances for employment. I think the Honourable Member for Windsor was absolutely right to talk about some of the complexity and forbidding nature of some of the system. I hope the Minister is not going to tell me that universal credit is going to resolve all of that, because I don't think it is, and particularly because actually the gateway into the system is as much a part of the problem, I think the Honourable Member was rightly saying, as the way in which the benefit system is designed. Can I also say that although it is right that moving people into employment is in many cases going to be good for their mental health, moving them into poorly paid jobs which leave them still struggling to make ends meet will not of itself make them feel that their well-being is being holistically addressed. I think poorly paid, poor quality jobs are just not in the long run going to be consistent with good mental health. And I also want to say to the Minister that, of course, he will know that there has been a massive upsurge in sanctioning of benefits claimants under this government. And that must mean that a number of those who are being caught are those with mental health problems. Now, of course, there have to be conditions for benefit and sanctions for willful non-compliance, but inappropriate sanctioning not only causes financial hardship for many, but it will also be a source of huge anxiety and stress. And despite repeated protestations from ministers that there are no targets for sanctions in Job Centre Plus, we hear again and again anecdotal reports that such targets, at least at managerial level, do exist. I think it's also true, Madam Deputy Speaker, that the regime is now much more punitive. Sanctions bite harder and last longer, and a culture has grown up where claimants are being sanctioned inappropriately. Just a couple of weeks ago, I was told of a case in the West Midlands of a work programme participant who was unable, because of his mental health condition, to discuss his situation in a public forum as was required by his work programme provider. The resulting anxiety left him unable to engage at all with the work programme, and he was sanctioned for 14 days. Now, it would be useful to know what analysis ministers are undertaking of the numbers affected by sanctions who have a mental health condition, and it's really quite shocking that we have so little information on their fate when a sanction has been imposed. So I want to be quite clear, Madam Deputy Speaker, under a Labour government there will be no targets for sanctions, and we will assist that assessors and decision makers at every stage of the process, from the work capability assessment to the imposition of conditions to decisions about sanctions, properly take account of the mental health of the claimant, and that expert advice will be available to ensure relevant information is considered, with penalties and assessors for poor advice. And can I also highlight to the Minister the concerns that arise from the recent regulations to allow data sharing in relation to universal credit recipients with a range of other service providers, including housing associations, credit unions and debt advice agencies. Constituents have told me that they're very concerned that this could lead to data sharing about their mental health, which they haven't authorised and don't want to happen. And I think the Minister does need to be very clear about what protections will exist when these new regulations take effect. So in conclusion, Madam Deputy Speaker, I'm very glad we've had this debate this afternoon and taken the opportunity across the House to share our aspiration for the best employment chances and rights at work for those who suffer mental illness. Warm words, as we all know, won't be enough. There must be a rigorous focus on access to support and on measurable outcomes. 1 in 4 of us will suffer mental illness at some point in our lifetimes. We can't afford the waste of potential when so often worklessness is the result.
Minister.
I'm grateful, Madam Deputy Speaker. And first of all, I'd like to thank the Backbench Business Committee for approving this debate, but also my right honourable friend, the member for Sutton and Cheam, for being one of those that secured it. I think, just as my honourable friend, the member for Broxbourne did, I think on this occasion, my honourable friend, the member for North Durham, on this particular subject, and my honourable friend, the member for Broxbourne, and I'm afraid, Madam Deputy Speaker, going to try your patience by also congratulating him on the award of his OBE, which he collected this morning, which I see from your furrowed brow, Madam Deputy Speaker, you were not aware of, but you are now. I'm afraid he has been congratulated rather a lot today, but I felt remiss if I hadn't also done so from the dispatch box.
One could never be congratulated too much, and it's right that it should be acknowledged for the honourable gentleman's contribution. Yes.
I'm grateful, Madam Deputy Speaker, that you were also able to join in that level of congratulation to my honourable friend and embarrass him still further. It has been a very good debate and important, I think, for our constituents, because mental health conditions are indeed very common, with 1 in 6 people facing mental health conditions at any one time. I think a statistic my right honourable friend mentioned, as did my honourable friend, the member for Windsor, who had the opportunity to put on record his early contribution on this subject early in his parliamentary career. And I think it was common from all members who participated in the debate, the absolutely clear linkage between mental health, whether good or bad, and someone's employment position. And I think it was also right that many members highlighted the fact that labour market outcomes for those people with mental health conditions are poorer than the population as a whole, and for people with health conditions in general. And I think it was also right, as my right honourable friend, the member for Sutton-on-Cheam, said, and others did, that the vast majority of people with mental health conditions want to work. Now, he, I think, had some statistics, particularly for those with severe mental health problems. I listened very carefully to those, just in the spirit of trying to cheer him up a little, and also noting that he referred, I think, to some positive data from the Time to Change campaign about the views of employers and the changing views of employers on mental health. Just to say, reassure him a little, although I am not in any way complacent, because the gap between those with a mental health problem working and those generally working is a very significant gap and is far too wide, there has been at least some improvement in the last year, between the last quarter of 2013 and the last quarter of 2014. The employment rate of those with a variety of common mental illnesses actually went up by 2.6%, with a further 70,000 people in employment, which is obviously positive. It's a step in the right direction. I'm not going to overclaim for it, because it is just a step, but perhaps it indicates that those employers, because of the good work that those organisations involved with the Time to Change campaign are doing, because those employers are now more open to both keeping people in work who develop a mental health problem and employing people with mental health problems, we are perhaps just seeing an improvement in those employment figures, a start of an improvement. I don't want to claim more than that. I think it's also fair to say that we are doing a lot, but there is also clearly more to do. I just wanted to pick up a couple of points that the Shadow Minister mentioned. I absolutely agree with her in the comment that she made early on in her remarks, when she referred to employers that say they wouldn't employ someone with a mental health problem. And she was absolutely right. If they employ a reasonable number of employees, they almost certainly already do. They may not know they employ someone with a mental health problem, but they almost certainly do. Maybe the employee doesn't know they have a mental health problem either, but the statistics suggest that anyone who employs more than 6 people is likely to have at least one of their members of staff having a mental health problem. And perhaps they ought to just look around a little in their workplace and just think perhaps there are people they already employ who have a mental health problem, and just think about how well they support that person, not out of any altruistic sense, although that is of course the right thing to do, but as the Honourable Gentleman Member for North Durham said, because it's the right thing to do for their business. It means that that person will be more productive, will stay working for that business for longer, and be beneficial. So I think that was a point well made. And it was also a sense, Madam Deputy Speaker, looking at the cast of characters here today, I recall clearly the debate 3 years ago when my honourable friend, the member for Broxbourne, the honourable gentleman for North Durham, and my right honourable friend, who was then the health minister, participated in a debate where the two honourable gentlemen behind me and in front of me spoke about their own personal experiences. And I thought what was quite heartening, both of them in the debate, were nervous, I think, about how their comments would be taken outside, and I followed this quite closely myself, and I thought what was very heartening about it was actually their remarks were taken very positively, not just by the organisations you would expect who are familiar with these issues, but I thought more widely and interestingly amongst members of the public. And I think they kicked off a very interesting process, and I know since then a number of other Right Honourable and Honourable members have also talked themselves, both inside and outside the House, about their own experiences, and the more members are encouraged to do that, I think is right. And I think the Honourable Gentleman, the member for North Durham, put it very well when he said the more we talk about these issues, the more we're open about them, the more the House has debates about them, and we talk about mental health issues in the same matter of fact, and I mean that in the most positive sense of the word, that we do about physical health issues without making a huge drama about them. I think that's very positive for encouraging employees and employers to have those very sensible conversations in the workplace. There are a number of support mechanisms that members spoke about. My honourable friend, the member for Halesowen and Rowley Regis, referred to the improved access to psychological therapies programme, and the Honourable Lady, the Shadow Minister, referred to the various talking therapies that were available. Those programmes have a proven record of delivering. They were started by the party opposite when they were in government and have been continued by us and expanded. By next month, they will have expanded so that 15% of people who could benefit will have access to them, covering about 900,000 people per year. And from next financial year, we will introduce, from next year rather, we will introduce access standards and waiting time standards for the first time in mental health services, and an £80 million investment will ensure 75% of people will receive the IAPT treatment within 6 weeks, and more than 50% of people who are experiencing their first episode of psychosis will receive a treatment within 2 weeks. More to do, but I think that's very significant progress. A couple of other things that flowed, I think, from how we deal with people with mental health problems. The Honourable Gentleman from North Durham referred to the work capability assessment and also the performance in delivering that by Atos. I will just, in just a teeny bit of partisanship, just remind him that it was his government that actually introduced the work capability assessment and appointed Atos as the contractor, and we inherited such a thing, and we spent quite a long time putting it right. And I think he'll be pleased to know, because I detected from what he said that he wasn't Atos's biggest fan, that he will of course be aware that they are exiting from that contract to deliver that service in Great Britain, and in fact it's next week that Maximus take over, and members will receive ahead of that in the next few days a communication from Maximus, where I hope the Honourable Gentleman will be pleased to note, if I just finish this point, of course I'll take his intervention, will be pleased to note that one of the areas where Maximus are very keen to improve the performance of the WCA, and something they take very seriously and have themselves highlighted, is indeed in the area of mental health. And I hope that he will engage with them using his expertise, both locally and his own personal experience, in helping to improve that performance. Of course, I'll give way to him.
I'm glad to see the back of Atos, but the fact of the matter is, you know, this has been raised for the last God knows how many years in terms of Atos. The key issue is it's the people doing the assessments. I've got no problem in terms of people with mental illness going through an assessment, but when you've got people with no mental health experience whatsoever, you know, coming to the conclusion that those people are fit for work, I just hope the new provider actually employ people with mental health backgrounds to do those assessments, because that would be a huge step forward and better for the government, and also, more importantly, better for the individuals who are affected.
I think he makes a perfectly good point there, and one of the things actually which Maximus are planning on doing is increasing the number of people they employ who are mental health specialists. It is worth just, of course, putting on the record, I think it was the Honourable Member for Huddersfield, who's no longer in his place, who said that the people that undertake assessments for the WCA, of course, are not qualified, which of course is not right. They're all healthcare professionals. They're all properly accredited healthcare professionals. It is true that they are not all mental health healthcare professionals, but one of the things that Maximus are proposing to do is increase the number of mental health specialists they've got, increase the number of their healthcare professionals with knowledge of specific health conditions, including mental health, but not just mental health, and also make sure that they have across their organisation mental function champions to discuss mental health cases with other healthcare professionals to bring that expertise to bear, of course.
That is a welcome move, but can I make a kind of little suggestion to the Minister that he picks up on what I said is that if that's the case, that they're going to employ people with mental health backgrounds to do those assessments, that he actually ensures that anyone who's going for an assessment and they've got a clear mental health condition, that's why they're on ESA, for example, that they only actually be assessed by someone who actually has got that expertise, because that will save a lot of time and money for government and also help the individual.
Well, one of the issues, of course, is often not that clear. People often don't just have a single health condition when they're going for an assessment. And of course, I should remind him, of course, it is important to remember that the assessment is not a medical diagnosis. It's about the impact of somebody's health condition or disability on their ability to work. So it's not, so someone isn't carrying out a diagnosis of a mental health problem. It's about the impact of their condition on their ability to work. Let me just finish this point. Of course I will. So, but I can assure him, and I think if he looks at the communication he gets from Maximus, and I'm sure they will be delighted, I mean this genuinely, to hear from him about experiences of his constituents, and they are genuinely committed to improving the performance of the work capability assessment. And of course, they do have experience in their other contracts around the world of delivering healthcare assessments. So it's not that they're a business that's not experienced in this type of work. And I think the signs are positive about the way they're going to engage with that contract. Of course, I'll give way.
It's a very important point about individuals not having a single health condition, whether that's mental or physical. And one of the challenges in terms of assessment is the assessment of somebody who's got a fluctuating mental health condition, which might require a special form of assessment.
My honourable friend makes a very good point about fluctuating conditions, and that's both for assessments, and one of the changes actually in the work capability assessment has been recognising that you can have fluctuating conditions, not just in the mental health space, but other conditions, and actually recognising that that has to be taken into account when you're doing an assessment, and not when, in terms of the questions that you ask claimants, it's not just about what their experience is today, but it's about what a typical day looks like and the extent to which their condition fluctuates. And it's a very good point that he makes. A number of members referred to, including the right honourable gentleman who opened the debate, about the work that my department and the Department of Health are doing, working together to look at how we can improve employment and health prospects for people. And he referred specifically to the pilots that we're doing. There are four broad pilots, one into looking at the individual placement and support model, one into looking at group work to see whether that peer-led group work employment intervention can improve outcomes, whether a telephone support model is effective, and also an online service pilot, which was one of the recommendations from the RAND study that he referred to. Those pilots have, as he knows, have started and moving into the next phase to have a larger set of pilots. One of the things we're very keen to do, and it's both frustrating because it means pilots take longer, but we are very keen to get really robust evidence bases for these, because if, I think it was the Shadow Minister said this, if one wants to roll these out in a significant volume, both my department and the Department of Health working together, and you're going to invest a significant amount of money in them, you do need a very good evidence base to be clear about what are the outcomes going to be. And so we're very clear that we want to make sure that we have, for example, a sufficient size of pilot, a sufficient number of individuals going through those pilots to develop really robust evidence, rather than get to the point where we have lots of qualitative data and lots of anecdote that they sound like they're good, but actually you don't have a really robust evidence base. And I think that's very important. Of course, I'll give way to him.
absolutely agree with the Minister that we need to have a robust evidence base on which the rollout takes place. But can I just say to him, when it comes to individual placement and support, this has already been the subject of randomised controlled trials. There is a very good evidence base that really should be used to roll it out.
He's right about that, and of course that's why the access to psychological therapies work is already underway, and as I said, is being rolled out further, and this is looking at whether other models. One of the issues is also how well you can scale this, given that pilots which require skilled mental health professionals, of whom there are a limited number, and by limited I don't mean a small number, I mean finite capacity, looking at are there models which enable you to scale these things up more quickly. So that's why we're looking at those, and those are promising, but we want to make sure we have a very good evidence base. The Honourable Member, just at this point, the member for Strangford, of course, referred to some very specific experiences in Northern Ireland which may have some specific issues. It is worth just putting on the record, he knows this because we've had this conversation before, quite a lot of the services in this area, both in the welfare arena and also in the health arena, are obviously, of course, devolved to the Northern Ireland Executive. Absolutely right for him to raise his constituents' experience here in the House, but in terms of the ability to deliver those services, those are obviously not under my control or my colleagues in the Department of Health. Those are under the control of the Northern Ireland Executive. But of course, one of the things we're very keen to do, and I'll be meeting the Minister in due course, is looking at both our experiences to inform the experiences and how the Northern Ireland Executive rolls some of these things out, but also vice versa. And obviously, if there's things that we can learn from each other, of course, we're very happy to do so. Of course, I'll give way.
Obviously, that is a situation, we understand that. In my contribution, Minister, I also referred to the Prince's Trust and some of the good work they do with vulnerable young people. In particular, and the Shadow Minister referred to the young people. Is there any intention of rolling out across the United Kingdom on the mainland here the contact with the Prince's Trust and the vulnerable young people that are involved in that, for instance, to give them the help that they need at the coalface of their lives? I'm just asking that question.
Carefully, that I don't have a specific answer I can give him immediately, but I will take that point away and look at it further. But I listened very carefully when he was setting that out for the House, and I thought there were some very positive aspects to that approach that he set out. Just a final point on individual placement support for my right honourable friend. Around I think around a third of NHS mental health trusts in England are using this support. Department of Health is grant funding the Centre for Mental Health to extend IPS further, and also there's some work that my department and the Department of Health are doing with the Centre for Mental Health to trial IPS with schizophrenia as well, which, looking at his expression, looks like he's familiar with that programme. And one of the things, of course, is to encourage at a local level my department and Job Centre Plus to work closely with the health service, and I know there are some examples indeed where that close working takes place. The Fit for Work service was referred to by a number of members, including my honourable friend, the member for Broxbourne, who referred to the point that how long people were out of work, the longer they were out of work, the less chance there was of return. The Fit for Work service, which the Shadow Minister referred to as well, which is obviously at a relatively early stage, is about helping employers and employees manage the sickness absence programme. Also, another service we offer, and I thought I was tempted to do an advertisement for it earlier on, but I resisted. When my honourable friend, the member for Sutton and Chene, was running through the example he opened his speech with, I think a lady called Anne-Marie, I was thinking that that was a very good example, actually, of where she and her employer would have benefited from the mental health support service, which is part of access to work, which is clearly not as well known as it ought to be, which, as he said, has a job retention rate of around 92%. The sort of support it offers is assessing an individual's needs, so to identify strategies they can use for coping with their mental health problem, looking at a personalised support plan, either for returning to or remaining in work, and also giving employers advice And I think this is very important, particularly for perhaps those smaller employers that don't have the capacity themselves to perhaps have occupational health support in place. And one of the things I'm doing, indeed tomorrow, as it happens, is speaking at a disability confident, mental health focused event, which is being supported by Mind, Remploy, the Business Disability Forum, and hosted by Royal Mail, specifically to raise the awareness. We've got a significant number of employers coming about the mental health support service, and I have therefore in the process of that named several other employers, the Royal Mail, who, for example, who are very committed to this. Another one, which I think a couple of members, honourable friend, isn't here at the moment, but referred to leadership. And I was at an event, and I hope it's in order to mention it, given that I did used to work for them, although it was an awful long time ago. But I attended an event with KPMG senior partner, who has been very open about his own mental health problem. And what was very heartening about it was he referred to the fact that the senior management of that organisation had created an environment in the business where he felt, as a senior member of the management team there, comfortable with being open about his mental health problem. And I think the fact that he's been able to do that has been well supported by that employer will have, and I know has, talking to other members of staff, had a powerful effect on encouraging others in that environment to be open about their mental health problems. So there are other employers who recognise that, and although he's not in his place at the moment, the Honourable Member for Hazel Grove referred to a disability confident event that he has run. I know my right honourable friend is interested in this area as well. I hosted a disability confident event in my own constituency a couple of weeks ago, and I would encourage, I've written to all honourable and right honourable members to encourage them to do so in their own constituencies, partly to engage with those small and medium employers who may otherwise not be familiar with the campaign. And the right honourable gentleman wrote for Politics Home today a column called "I Don't Like Mondays, How Work Can Affect Mental Health." And the only potential criticism I had of it was he urged UK PLC to take action. And I know what he meant by that, but it's worth remembering, of course, we're not just talking about UK PLC, we're also talking about UK Limited and all those small and medium enterprises, because actually half the workforce works for small and medium enterprises, not large companies. And sometimes it's small and medium enterprises that perhaps don't always have the HR support, don't always have access to those services that other larger businesses perhaps do. And I would just like to add a word. I think my honourable friend, the member for Broxbourne, referred to BT. And I had a very positive experience at BT. The head of occupational health and wellbeing at BT, Dr. Paul Litchfield, also worked for, has done 2 reports for the government, 2 of the independent reports. I waited until he had concluded that work, and therefore only had one hat on. And I visited BT, and I had a very positive experience. They took me through their programme, and the Honourable Member for North Durham spoke very positively about it as well. And he's right, they put a lot of effort into supporting employees with mental health problems. It is the right thing to do, but also because it's absolutely in their business interest, and they have a very high retention rate. They keep almost everybody who develops a mental health problem at work, the vast majority of them in their existing roles. Sometimes they have to change job role, but they were very positive, and I heard 4 very powerful testimonials from individuals who had told me about the support they'd received from the company. I thought what was incredibly positive was they felt very open about discussing that in a meeting in front of their management chain, and spoke about some quite difficult issues that they'd had in their working career, and I thought that was very positive. And they clearly work in an environment in BT which is very positive. I will just mention, because the Honourable Lady, as I draw my remarks towards their conclusion, I will just mention, because the Honourable Lady will think it's remiss if I don't, about universal credit. Now, I'm not going to pretend that universal credit solves every problem on the planet, but I think there are 2 areas where I think it actually is very positive in mental health, particularly. One is the way it's set up. It's about getting work coaches to engage with people earlier, looking at what support people need, because it's quite right that actually if someone does fall out of work and approaches the job centre, and I think this was the thrust of the Honourable Member for North Durham's point, you actually want the support to be delivered earlier in the process rather than later. And the way Universal Credit's set up, it is about having that conversation, about looking at what somebody can do and delivering that support earlier on, which I think will help. It's not the only solution, but I think it will make things better, of course.
I agree with him, but would he also address the point I did raise in my contribution around the companies which the government are actually employing, who are actually getting paid, even though they've got people on their books, but the support for those individuals into work is being carried out by voluntary and community sectors? I think it's quite a serious issue that if these companies are claiming to have helped these people, where actually what's being done by the voluntary and community sector, then that is something that's quite serious, I think.
Yes, he over-anticipated. I hadn't quite got to that point yet. But no, he raises, I think there were two issues that arose from what he said, and he was supported in that by the Shadow Minister. One was the ability for smaller, both private sector companies, but also the voluntary sector, to be subcontractors to prime providers. That's one issue, and that's something I think as we look to developing what follows on from the work programme about how can we make that easier. The second point, though, which was his central point, was about making sure that work programme providers only get paid where they've done the work. So he raised a specific issue about the a third sector organisation in his own constituency. If perhaps he can supply me with a little more detail about that, I will absolutely look into that, because if a work programme provider literally hasn't done anything at all, they shouldn't be pretending that they have in order to claim a payment. Either they shouldn't be being paid, or they should be sharing that payment effectively. They should be subcontracting with having the smaller provider subcontract with them. And clearly, if that smaller provider is being very successful, we would want them inside the programme, as it were, working with that prime provider. So if he can give me some more details of that, I will absolutely task officials with going and having a look into that, because it's not very sensible, the taxpayer paying someone for work they haven't done, but also what we should be doing is making sure the money goes to support people who are successful at getting people back into work, so they can improve their organisation, be more successful, more sustainable, and get people back into work, of course.
The Minister, and related to that, would he also either comment on or ask his officials to look into the report I received from the IPS in South Manchester that work programme providers were being rewarded for work that was both being carried out by and funded by the NHS? It sounded like the public purse was paying twice, and the work programme provider was getting a reward for very little, if any, activity at all.
Yes, I will. I listened very carefully to what the Honourable Lady said. I'll look into that specific example as well. The last couple of things I'd say is, first of all, my right honourable friend referred to the work programme. It is true, in the earlier phase of the work programme, that the success rates for those on ESA as opposed to JSA were not very impressive. I think 1 in 24. But actually, more recent cohorts have actually been more successful, getting something like 1 in 10 into sustainable work, and obviously we want to see that performance continued. So I think, in conclusion, Mr. Speaker, and it's very apposite, I think, as I draw my remarks to a close, that you are in the chair, because I don't think it's a secret to say this is an area where you take a close personal interest. I remember when you allowed a discussion to run for a fairly reasonable length of time in the last set of Department for Work and Pensions questions on mental health. This is an area you feel is very important, and you referred to the changes we'd made in law to reduce the stigma for members of Parliament who might have a mental health problem. And I referred earlier in the debate to the Right Honourable Gentleman and my Right Honourable friend who spoke very openly in the House about their experiences. So I think this is an area where the government takes it very seriously. There's a lot of working across government departments, both not just with my department and the Department of Health, but also with the Home Office, where members will be where the Home Secretary has been pressing a great deal to make sure that police cells are not the places of safety for those that develop a critical mental health problem, and other ministers across government. So this is an area where I think We are moving in the right direction, but we're not complacent. There is some progress being seen in the unemployment figures, but there is still a very considerable gap, and there is more work to do. And I think there's a shared sense of purpose across the House about the direction of travel. I want to see us continue moving in that direction, both through the general election and beyond.
Mr. Paul Burstow.
Thank you very much, Mr. Speaker. And the question that is put in a moment is that this House has considered mental health and employment. And I thank the Minister for a very full response to the contributions from the Honourable Gentleman, the Member for Durham North, my honourable friend, the Member for Broxbourne, the Member for Strangford and the Member for Windsor, who contributed this debate, along with those who intervened. And also want to thank both the Minister and Shadow Minister for their responses to what has been a very wide-ranging debate. The Honourable Member for Broxbourne talked about work being fun and purposeful, and I think that's an important message to get across. We need to make clear that most people with a mental health problem do want to work, and I think that message has come across very clearly in this debate. But we need our benefits and back-to-work systems to work for people with mental health problems, and we've had some of the issues and challenges well described and debated in this debate today. The approaches have to be tailored and personalised, and they have to be grounded in very clear evidence. And I welcome what the Minister had to say about the promise from the pilots so far. I also take his gentle chiding about my use of UK PLC. He's absolutely right that we need to focus on all types of business entity, from sole trader all the way up to major corporations. But it's also right that there are still far too few businesses that are taking a lead in this area. We've heard about BT, Royal Mail and others. Perhaps the whole of the FTSE 100 should step up and give a lead and do what they need to be doing to give good mental health to their employers. The Honourable Member for Windsor talked about happiness and how that should be something that we do measure, and government is measuring well-being as part of the ONS work. In the Centre Forum work that I have been doing, we struggled, and often you do when you're writing reports, as to what we would call the report. And we called the report The Pursuit of Happiness, because we think the focus on well-being is absolutely key. And we did make a recommendation about the importance of the kite mark for employers who are actually striving to be mental health friendly employers. The Honourable Member for Broxbourne talked about the first 1,001 days and how critical those are to shaping a person's life, making them more resilient and capable of dealing with adversity and being able to be less likely to be at risk of mental health. That life course approach is absolutely key to the strategy this government has, and I think it will endure whoever is in government after the general election. Mr. Speaker, this House, I think, probably in this Parliament, has debated mental health more often than any previous Parliament. And not only has it debated mental health more often than any other Parliament, it has debated it in a positive and constructive way. It has not cast the idea that this is something to fear and dread. It has cast a much more positive perspective on it, and that is due to the honourable members who've talked about their own lived experience and those of us who bring a policy interest and a determination to see change in this area. I hope the next Parliament will not just continue talking about it, which it really must, but also will go on to make sure that we step up the pace of change, because there is so much we can do for those who suffer from mental health problems. It's good for the country if we do that, and it will be good for them too.
Yeah. Order. The question is as on the order paper. As many as have that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. We come now to motion number 10. With the leave of the House, I propose to take motions 10 and 11 together, because each of them is entitled Companies. So with the leave of the House, we will take those two together. The whip to move.
I beg to move.
Thank you. The question is as on the order paper in respect of motions 10 and 11. As many as have that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. We come now to motion number 12, entitled Senior Courts of England and Wales. The whip to move.
I beg to move.
Thank you. The question is as on the order paper. As many as have that opinion say aye.
Aye.
Of the contrary, no. I think the ayes have it. The ayes have it. Motion number 13 on environmental protection. The whip to move.
I beg to move.
Thank you. The question is as on the order paper. As many as have that opinion say aye.
Aye.
Of the contrary, no. I think the ayes have it. The ayes have it. We come now to the adjournment. The whip to move.
I beg to move that this House do now adjourn.
Thank you. The question is that this House do now adjourn. Mrs Mary Glindon.
Thank you, Mr Speaker. I'm really pleased that, if I may say first of all, that the Minister who is answering this evening is my former colleague from the EFRA Committee, and I hope that we can have a good debate here this evening. Mr Speaker, this debate could not be more timely, as only today the Oil and Gas UK published its 2015 activity survey, which has quite rightly attracted much news coverage throughout the day. I think not only because of the recent crisis and ongoing crisis with the price of oil, but because, as the Association's Chief Executive, Malcolm Webb, has said, the offshore oil and gas industry is a major national asset. While the report does contain some bad news about the fortunes of the oil and gas industry, it also identifies the potential of the UK continental shelf, which, according to the recent Wood report, has seen the production of 41 billion barrels of oil equivalent, and it is estimated a further 12 to 24 billion could be produced. The report highlights a number of important statistics, notably that 1.42 million barrels of oil equivalent per day were produced in 2014, which represents the best year-on-year performance in 15 years. However, production revenues fell to just over 24 billion for the year, the lowest since 1998, and there was a negative cash flow of 5.3 billion, which was the worst position since the 1970s. It's expected that production could be around 1.43 million oil equivalent per day this year, and up to 15 new fields could come into production. By 2019, over half of the UK's continental shelf production is likely to come from fields that started production since 2012. The survey states that the long-term outlook for the UK continental shelf is bleak. Drilling activity is collapsing and prospects for significant new development are fading. Exploration activity was significantly worse than expected in 2014, with only 14 of the expected 25 wells actually drilled, and reflects the downward trend since 2009. Inability to access capital was cited as the main reason for low exploration activity, which led to the discovery of just 50 million barrels of oil equivalent that has the potential to be commercially developed. As few as 8 to 13 exploration wells are forecast to be drilled in 2015, as the lower oil price adds to existing barriers. There were 18 appraisal wells drilled, more than were forecast, but a significant fall from the 29 drills drilled in 2013. No more than 5 appraisal wells are forecast for this year, a fall that is driven by poor exploration results over the last 4 years.
We don't really give way.
I will give way.
Thank you for giving way. The Honourable Lady is outlining the case for help for the industry. At the same time, we all know, Mr. Speaker, the goodness that has come out of this year has been lower prices at the pumps, which means that we all benefit, and that's my constituents. It also has driven down the price of oil for home heating. There's been real benefits from the reduction in oil price. I know the Honourable Lady accepts that. Is the Honourable Lady then acknowledging the fact that prices have come down and therefore inflation has come down and people have more money in their pockets? At the same time, is the Honourable Lady suggesting to the government that what we're looking here for is tax incentives for the oil companies so that they can then proceed?
That's exactly what I'm hoping for from the government. I will come to that later. 6 more development wells were drilled than in the previous year. In relation to reserves, the survey states that there are potentially 10 billion barrels of oil equivalent, with 6.3 billion in sanctioned projects or under development and 3.7 billion yet to get boardroom go-ahead. However, companies are saying that less than 2 billion of these are likely to be developed, a figure that could fall further because of current global capital rationing. And, under the right conditions, the industry would need to invest £94 billion to recover these reserves. The fact is, Mr Speaker, our reserve and untapped resources can provide for a successful industry for years to come, but the industry faces exceptional challenges and an uncertain future. There must be a concerted effort on tax, regulation and cost to make the basin more attractive to investors and ensure that significant sums of much-needed capital come to the UK. The best year-on-year performance was largely due to new investment in new start-ups enabled by tax allowances. Tax concessions are generally the most effective and meaningful incentives. There needs to be a permanent reduction in the headline rate of tax for the industry, a simplification of the tax allowance structure and stimulus for exploration. I hope the Minister will confirm that the Chancellor, in his forthcoming budget, will significantly reduce the headline rate of tax for the industry, which currently stands at between 60% and 80%. The Oil and Gas Authority must be rapidly resourced with the right capability and capacity to swiftly implement the recommendations of the Wood Report. Enhanced capability and authority of a better resource regulator will greatly improve the stewardship of our oil and gas resources on the UK continental shelf and cut through many of the existing blockages to maximising its economic recovery. The Treasury is presently going through a public consultation regarding a proposed investment allowance for North Sea gas and oil developments. This allowance should be modified to include provisions to support exploration and appraisal drilling along similar lines to the Norwegian approach. A decade ago, Norway was faced with a slowdown in exploration and investment, but has solved the problem by giving a massive rebate on exploring in the Norwegian waters. It is only through exploration that we can find new discoveries. It would be helpful if receipt of the investment allowance was subject to an undertaking by the operating oil companies that full and fair opportunity on a level playing field would be given to the UK supply chain to tender for related contracts. The North Sea can indirectly be a significant stimulant to jobs, especially in the manufacturing sector and in deprived areas of the UK, such as the North East. Over the past 5 years, the majority of North Sea fabrication contracts have been placed overseas. The government can do a lot more to support the British fabrication industry without breaching EU or WTO regulations. Our domestic fabrication industry has the skills, expertise and track record to fulfil most of the contracts that have sadly been placed elsewhere. Oil and Gas UK has recently highlighted that development costs for new offshore facilities over the past 4 years have risen to unsustainable levels. Budgets have been exceeded and projects have suffered major delays. In most cases, the projects under review were constructed outside the UK. Recent contracts awarded by Maersk to overseas fabricators for the forthcoming development of, and I apologise for my pronunciation of this, of the Culzean field have been widely reported, but very few UK jobs will be created by the development of this field, or even though Maersk will benefit from significant UK tax concessions. At best, UK fabricators will be second-tier contractors. UK fabricators, including OGN in my constituency, are facing a bleak future along with the rest of the industry, with a limited number of contracts only on the horizon. Unless these fabricators win a reasonable proportion of these projects, there will be significant job losses, likely yard closures and the extinction of domestic manufacturing skills that will never be restored. It is vitally important that we maintain pressure on the oil companies to place work in the UK. That pressure can be maintained by ensuring the work of the DEC Industry Development Team is fully transferred and incorporated in the Oil and Gas Authority. For my part, I will press to have the work of the cross-party industry promotion group carried forward into the next government. This group, of which I'm a member, has proved to be very successful, and we will be meeting with 3 major operators this week to discuss their projects and what opportunities these will bring to the UK supply chain. Finally, I look forward to the reassurance from the Minister that she is listening to the oil and gas industry, and that action taken by this government will mean jobs are protected and our major national asset is there for many years to come.
Secretary of State of the Department of Energy and Climate Change to reply to the debate.
Thank you, Mr Speaker. And I'd like to congratulate the Honourable Member for North Tyneside for bringing this debate to the House. And we know each other, of course, from our joint shared time on the DEFRA Select Committee. And I was particularly grateful when she came down to Hastings with a group of us and sampled some of the fantastic fish down in my constituency. But now, of course, I'm aware of her long-standing commitment to the oil and gas sector from my department. And I'm delighted to join her here today to discuss this. There is no doubt that oil and gas will remain central to the UK's energy mix as we make the transition to lower carbon economy. Investing in domestic oil and gas production is essential. It helps reduce our reliance on energy imports and provides a significant input into our economy. The government's policies, therefore, aim to maximise economic recovery of our resources. This debate is, of course, timely, given the current challenges which lower oil prices bring to those companies operating in the North Sea and all those who work in the sector. The UK industry is widely acknowledged for overcoming some of the toughest operating conditions anywhere in the world and renowned for spearheading revolutionary technological solutions in offshore exploration and production. It is due to this determination and creativity that we have seen around 42 billion barrels of oil and gas produced so far. And there could be up to 20 billion barrels still to be produced. But getting at these has challenges. We have a mature province. Therefore, most of the hydrocarbons, which are easier to get at, have already been exploited. We have ageing infrastructure, most of which is in place much longer than was originally envisaged. And this requires careful stewardship and the necessary maintenance and investment to keep it functioning effectively. We have different types of technological challenges, including deep water fields, high pressure, high temperature fields, and existing brown fields whose full potential we need to realise. We also need to ensure that when fields do come to the end of their economic life, they can be decommissioned economically and with minimum impact to the environment. And of course there is the challenge of maintaining the competitiveness of the UK continental shelf and the UK industry, including the supply chain. Government is absolutely committed to the long-term future of this sector, which supports 375,000 jobs across the UK, contributes £3 billion a year to government revenue, and still supplies half of the oil and gas that we consume. We recognise that the sustained fall in oil price presents real challenges for the sector. Operators are having to implement substantial savings to maintain financial viability. Of course, job losses like those we have heard over the last few weeks are a real concern and will have an impact across the UK. The north east of England, where the Honourable Member's constituency is located, has significant expertise across the spectrum of offshore engineering and manufacturing. It supports many thousands of quality jobs, providing families with a good standard of living and contributing to the local economy. I would particularly cite the offshore fabrication capability, which has been rebuilt in the region after a decade of decline. This capability once more supports 2,000 jobs on the Tyne. Continued investments and new projects are therefore vital. Any further cutbacks on exploration, which is the lifeblood of the basin's future prosperity, are a real concern. Therefore, we are committed to working in partnership with industry, the workforce and other stakeholders to provide all the support we can. Indeed, the Minister for Business and Enterprise, my right honourable friend, the member for West Suffolk, recently engaged with key players in Aberdeen and plans to visit other key oil and gas hubs, including the north east of England, very soon. Industry must address rising operating costs and reverse recent declines in operating efficiency. The workforce, whose dedication to working in the North Sea's challenging environment I much admire, must work with industry to avoid any industrial action whose timing could compromise the future success of North Sea operations. And for its part, the government must continue to pursue its efforts in finding solutions that preserve jobs and that maximise economic recovery. And we have already taken action. In 2013, we commissioned Sir Ian Wood, a leading oil industry expert, to examine how we could maximise the North Sea's full potential. In his response, published a year ago, Sir Ian recommended a need for a tripartite partnership between Treasury, industry and a new purpose-built regulator. Government has moved fast to implement this. We are setting up the regulator in the form of the Oil and Gas Authority under the expert stewardship of Andy Samuel. He is working to ensure that it will be up and running come April. And Dr Samuel has been asked to accelerate work with industry to identify key risks to UK oil and gas production and what further measures might be taken to mitigate them. He will be sharing his conclusions with us at the end of this month. At last month's meeting with industry in London, Government heard industry's concerns about falling oil prices. Since then, senior officials have participated at both the Aberdeen Oil and Gas Emergency Summit and at the Oil and Gas Jobs Task Force to ensure that we fully understand the breadth of issues. And we continue to ensure that we have a tax regime which encourages investment while providing a fair return to the taxpayer. A number of positive initiatives, such as brownfield allowances and new field allowances, have been introduced. Most recently, from the start of this year, the Chancellor has reduced the rate of the supplementary charge on oil and gas production profits by 2%. And he has signalled, with the budget approaching, that the Treasury is looking at what more can be done to support investment in the North Sea. The Honourable Lady for North Tyneside and the member for Strangford will have to wait for the details from my right honourable friend, the Chancellor. The Honourable Lady referred to the results published today of reduced activity, where, as she rightly said, it was stated that inability to capital was one of the leading factors. And this reinforces the government's need and the department's commitment to make sure that action is taken to support the industry. There is no doubt that the industry is facing particularly testing times, not just in the UK, but globally. And I can assure honourable members that the government will continue to work closely with the industry to ensure that it can ride out these choppy waters and emerge stronger on the other side. We will continue to support new exploration and investment, encouraging a collaborative approach to protect jobs and to realise the full potential of the UK's oil and gas resources.
Order. The question is that this House do now adjourn. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Order. Order.